All right. I'd like to call to order this Ottawa County Board of Commissioners. The date is Tuesday, August 24th. Our invocation today is by Commissioner Holfloor, followed by the Pledge of Allegiance, led by Rachel. Please rise.
You pray to me, please. Our Father, we come before you this afternoon and ask for your protection for our police department, first responders, our fire personnel, our county employees, and our armed service personnel. We ask for your protection for those thousands of Afghani people who are forced to leave their homeland with only what they can carry in a plastic bag. We will go to their new facility, countries, new homeland, where people do not speak their language. We also remember the people of Haiti who suffered from a tremendous loss after the earthquake and then the storm that came to their island. We ask for your understanding for all of our county residents in this time of disagreement. We ask for your enlightenment of our minds and give us strength to participate in worthwhile discussions and subjects today. Amen.
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 I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Call the roll, please.
Yes. Mr. Garcia.
Present.
Mr. Baumann.
Here.
Mr. Zylstra.
Here.
Mr. Dannenberg.
Here.
Mr.
Here.
Mr. Holtfloor.
Present.
Mr. DeYoung.
Here.
Mr. Kyers. Mr. Bergman.
Here.
Mr. Fenske.
Here.
Mr. Chair, we have a quorum.
Thank you. It's important for each one of us to speak clearly and distinctly into the microphone so that people in the audience can hear us. I have a few opening remarks I'd like to start our meeting with today. I want to start by recognizing that the limited mask mandate order of the local health department has divided our community like no other issue in my lifetime. No matter what side of the issue you happen to be on, we remain a community, and we have survived bigger challenges before. And we have even survived a more extensive mask mandate last year. So we will survive this controversy also. My job is to ensure that everyone is heard, but also that everyone is respected. And keep in mind that word respect. No one has worked harder during COVID or with more dedication or concern about everyone's health than Lisa Stefanowski and her team. She heads at the Ottawa County Health Department. Because of similar controversies over smallpox and the flu epidemics, the Michigan State Legislature has vested exclusive authority to make the mask mandate decision in the local health office pursuant to Michigan Civil Law 333.2453. The Ottawa County Board of Commissioners has no authority to reverse that decision or to fire her because of this decision that she has made or deny funding to the health department because she has made this decision. That case law was established by the Michigan Supreme Court in a case out of Ottawa County in 1903 in the middle of the smallpox epidemic, when the Board of Commissioners challenged the health officer's decision making, and the Supreme Court sided with the health official. Yesterday, the United States Circuit Court of Appeals, in a published decision, upheld the legal authority of the Health Department of Michigan to issue these mandates against all challenges, finding there is no religious exemption to mask mandates in schools. Pursuant to existing board rules, I will take no motions from the floor of the commission today. Any public speakers must address me, may not use vulgarities, and may not personally attack commissioners or the health officer. I will not tolerate any clapping because clapping is disrespectful to those who feel differently than the speaker. It's been reported by a website, Ottawa Impact, that I made the following statement. Sometimes government needs to make your decisions for you, and that's what we are doing. That so-called statement was never made by me. Somehow someone manipulated my words and used them to make it appear as though I made that statement. I would never say that, and I did not say that. My fellow commissioners have had some of their words twisted and manipulated also. Many of us, along with healthcare workers, have been threatened. This should be unacceptable by everyone in attendance here today. Today, I am asking all of you to show respect and civility towards those who may not agree with you. Some of these folks could be your neighbors, friends, or even family. Remember also that we will not respond to comments or questions that are presented to us. After your comments, we ask you to please leave the boardroom. And if the lobby is crowded, we ask you to leave the building and to go out into the parking lot. Thank you for your attention to this. With that, we have a presentation from Public Health, I believe. Is that correct?
Yes, it is. Thank you, Chairman Bergman and board, and thank you for having me here today. I want to start with a statement. I just want to say that I have been listening very closely to the comments and concerns of parents on both sides of this issue. I've heard the concerns of those who do not want their children masked in school and believe that masks could be harmful. I've also heard from countless people who do want the protection of a mask for their children. I believe that the state of Michigan should be the one deciding this issue for all children in our state, but for unstated reasons, it has been decided that this year they will defer the decision to each local health officer. I want you all to know that I agonized over this decision. I consulted my staff, who are amazing professionals in the field of public health. I also consulted with health officers across the state of Michigan. And we all understand that COVID-19 mitigation strategies are unpopular, especially after feeling the weight of these restrictions over the past year and a half. We sincerely hoped that we would not need to issue this order. However, the infection rates we are seeing in the southern and now the Midwestern states are alarming. Because it is my duty when there's an imminent health threat to act, I felt I had no choice but to issue an order. When writing the order, we gave consideration to parents' concerns, all the concerns that we've heard throughout the summer, and most recently related to reaction to the order. We try to impose the least restrictive measures to protect the children who currently are without access to vaccine. The mask protects not only them, but the classmates, teachers, parents, and grandparents. It enables us to reduce the quarantine circle from 6 feet to 3 feet and keep children in school where they can have the full benefit of social, emotional, and academic support. I know that many oppose this order, and we may never be able to reach consensus on this issue, but I want you to know that I am not motivated by any conspiracy or any political platform. I am motivated solely and completely by protecting the health of our children. I am confident that I am making the right decision and will not waver because of political pressure or compromise my professional integrity. If you disagree with everything I'm doing, I hope you will at least respect my conscience and my genuine respect for my duty as a health officer. We prepared a presentation today. We've heard from many of you asking for data. And we also have 2 pediatric infectious disease experts that work for DeVos Children's Hospital, with us today. And I would like to start by asking them, Dr. Kuhn and Dr. Olivero, to comment and help us really understand the risk of COVID-19 for our children and what we're seeing and why it is important and safe and effective to use a mask as an extra layer of protection against COVID-19 for children. So I'm not sure which one of you want to start, but if you would, maybe let's have Dr. Olivero start and just introduce yourself and help us to understand what's really happening.
Thank you so much for giving me the opportunity to be here with you all today. So my name is Rosemary Olivero. I'm a physician and I'm a pediatric infectious diseases physician at Helen DeVos Children's Hospital of Spectrum Health. And I'm also the division chief of medical specialties here. But just as importantly, I'm the mother of 3 children, all elementary school aged, and they're all attending public school. So, we have learned a lot over the past year and a half, and I do have to say with full transparency that when we were embarking on the 2020 to 2021 school year, and, in the summer of last year, I had quite a bit of skepticism that the many mitigation strategies that were being shown in Europe to be effective could be effective in the United States for a lot of reasons. But the most important of all, I just did not know for sure that our children would be able to adhere to mask mandates in the schooling environment. And however, the recommendations came out on the state level and our school districts got in line and we went through the school year and we anxiously awaited real-time data and experiences from our own local environments, but also across the country. And as early as September of 2020 and up to this very week, we continue to get more and more data and experiences from the United States regarding the effectiveness of various mitigation strategies on preventing the spread of COVID-19 within schools. I'll also say that in the state of Michigan, we, as well as a handful of other states, continued to stay in school throughout even the worst parts of the pandemic in the winter of 2020 and then in the spring of 2021. When community transmission rates were really just extensive. And we would expect that without any sort of mitigation strategies in the schooling environment, with the prolonged indoor contact that children have in an indoor schooling environment, that schools would just immediately be shut down. And we really saw the opposite. That with the attentiveness to the detail and adherence to those mitigation strategies, we had an extremely successful school year, many of which for many of our children was in an in-person schooling environment. And so it's really our job and our duty as pediatric infectious disease physicians to independently review and analyze the data that is published by other scientists in what we call peer-reviewed journals, and come to decisions on our own. And we take a lot of pride in doing that. And this is what we've continued to do through the course of the pandemic. It's extremely important to us as pediatric providers to not only prevent the spread of COVID-19 and keep schools open and operational, but to keep children in schooling environments as best as we absolutely can. So we have plenty of data to share on the effectiveness of masks in classrooms and preventing the spread of COVID-19 throughout the school, even when countless children were bringing COVID into the actual schools. And this is so important, not only for keeping the schools open, but for limiting the amount of spread in our communities. Now, as we're going into this school year, unfortunately, we knew about the Delta variant. We knew that it was causing a lot of problems on the other side of the world. And we knew it was a matter of time till it came to the United States. But given the vaccine access in the United States, we all were hopeful that we would not see surges of cases of COVID-19 leading up to the school year. And unfortunately, just the opposite has happened. And I'll let Dr. Kuhn speak a little bit about what is being observed in our southern states that have gone back to school, but then also have been experiencing the Delta variant and COVID-19 surges longer than we have here in the state of Michigan. And I would love to start the school year without having as many mitigation strategies in place. But we have sound science and good common sense that shows us that our mitigation strategies that were successful for 2021 should at a minimum help in this academic school year. We know that the Delta variant is not exactly the same as the 2 prior variants that came through the state of Michigan, but I think given the even more contagiousness of this Delta variant, it is certainly not our time to let down our guard. We certainly do not want to gamble with the health and well-being of our children, teachers, staffs, and other community members. So that's my opening perspective and remarks on where we are currently with the COVID-19 pandemic in schools.
Hi, I am Dalia Kuhn. I am a pediatric infectious disease doctor also at Helen DeVos Children's Hospital, and I am also the medical director for infection prevention at Helen DeVos as well. Rosie has actually said much of what I would highlight as well. I am likewise a mother, in addition to being a pediatric infectious disease doctor. One of my daughter just started her 4th grade year, and my son is still in preschool. We have both not just scientific data, but anecdotal information as well, which I think is equally as powerful because it feels very personal, something that we can see on a daily basis that I think speaks to us in a lot of ways. I think that speaking to the data in general, while there's very compelling scientific data for masks, much of it is in conjunction with other mitigation strategies. And so it is very difficult to tease out from that masks are, in students specifically, are the only mitigation strategy that is effective. I think it is a matter of looking at all of the mitigation strategies as a whole, and that includes masks, as they are both a common sense and a scientifically proven barrier for preventing infection. And we can get into the data more later. The second thing that I would want to say is that the real-time data from Florida, Texas, Mississippi, Tennessee, Arkansas, Missouri, et cetera, all of these states have shown us exactly what happens when there is no mask mandate as students go back to school. Unfortunately, much of this part of the country has vaccination rates well below 50%. And that, of course, includes kids who are under the age of 12 who are completely unvaccinated. And as a result of both community vaccination rates and low vaccination rates in children, what we are seeing is that, unfortunately, there are very high rates of infection of school children in these states. And while most children are mildly affected, unfortunately, it's a numbers problem. Even if only 1% are severely affected, if you have vast numbers of children being infected, then those children are going to end up and burden the hospital systems to the point that they are full and are overburdened and overtaxed. So we know that there, in many parts of the southern states, that there are no ICU beds available. For example, in Mississippi, there are no ICU beds for children available. And that means if you need an ICU bed for other reasons that are not related to COVID, then it's going to be a challenge to provide that kind of medical care. And that, as pediatricians, as physicians, is what we are really worried about, is making sure that we are able to take care of not just COVID positive patients, but all patients in our area. In addition to this, I would also comment that there are indirect benefits of masking. And those include that the fact that I, for one, haven't had a cold in the past 18 months, which is beyond amazing to me. And I know that many others have had similar experiences, far fewer illnesses. And while that's certainly convenient and I feel much better from a health perspective, there's also the fact that I haven't had to get tested for COVID. I haven't had to quarantine or isolate because of those things. And that's also true of our children. The more that they are the healthier they are, the less they have these symptoms, the less they have to miss out on school activities and sports, et cetera, for this. In addition to this, there are post-COVID syndromes that occur, such as our multi-system inflammatory syndrome in children that occur 2 to 8 weeks after an infection. Often these kids are mildly affected or asymptomatic, so you don't even know that you might have had the infection. And then you end up with a very severe illness where you have a rash and fever and other systemic symptoms that require hospitalization and close monitoring in the hospital. And we have seen that repeatedly following our spikes here in our own community. We see many patients who are admitted to the hospital requiring our our multi-specialty care and our ICUs as well. And then finally, I just want to say that masks won't be forever. We suspect that the Delta variant will continue to act here in Michigan the way it has in other parts of the country. We have no reason to believe that it won't, but it might not. We might have high enough vaccination rates that it won't get to that point. If there's something that we've learned, it's that we can't always exactly predict what's going to happen. But as Dr. Olivero mentioned, we don't want to gamble with our children's future. We don't want to gamble with our community's well-being, and we don't want to overtax our very burdened healthcare system, our workers who are trying so hard to make sure that everyone gets the care that they need. So if, as vaccines roll out for our younger age groups, as rates go down and the school year starts up and we're seeing transmission rates that are not what they are elsewhere, we can back away. But that's a much easier ask than on the front end, not masking and potentially risking a very dangerous scenario. And I will also add that every teacher I have talked to about masking and about how children do with it, kids just take it in stride. They are masking in large numbers. They don't see it as a big deal. And overall, and I'm not talking about the exceptions here, but overall, our children are handling it very well and are loving being back in school and being able to be fully present and learning, which I think we can all agree is a huge goal of ours as we enter into the school year. And then as well, we're not seeing the hypoxia and other concerns about large scale masking. We are not seeing kids in our offices and ICUs and ERs who have had oxygen problems because they're wearing masks. And I think that speaks to the low risk and high efficacy of masks. So thank you for having me here and letting me talk. And I look forward to your questions.
Thank you so much to both Drs. Cohen and Olivero. I know that they have a limited amount of time. Maybe commissioners have a few questions that they'd like to ask.
Any questions?
I guess Lisa, Commissioner Dannenberg. I wanted to know what the metrics were, but the thing what you handed out clarified it pretty clear. And it more or less states it is once we get into the low transmission, then we can get rid of the mask.
Right. Yep.
So is that going to be on the Health Department's webpage and the Ottawa County page?
Absolutely. And Commissioner Dannenberg, we're going to continue the presentation and go through some of the more specific data points that our medical professionals shared with us. Darrell's going to go over a data report if you want us to do that. And I was going to go over some of the tenets of the actual order just to make sure that everybody's clear on that.
Okay. Thank you.
Any other questions? Thanks, Lisa.
You bet. But thank you so much again, Dr. Olivero and Dr. Cohen. We greatly appreciate your voice, your expertise, your perspective, and all that you're doing to help protect the children of our West Michigan area. So thank you for joining us today.
Thank you, ladies.
Thank you.
Thank you.
So just to continue, I'm going to share my screen. Commissioner Bergman, would you like to have us continue with the data portion of the presentation? I know that you've got a big agenda today.
What's your?
Yes.
Yes, please.
Yes.
Yes.
Yes, thank you.
All righty. Let's see here. Pardon my lack of technology skills here. All right. So I want to just start with what the order looks like. It applies to children only pre-K through 6th grade. Now, again, this is based on the fact that this age group, without orders requiring them preventative measures, may be going back to school without any level of protection because they don't have access to the vaccine just yet. So it applies in all educational institutions. It requires the educational institution to ensure all children properly wear a mask or face covering, while inside only any enclosed building or structure of the institution. It also requires that the educational institution ensures that all persons, regardless of vaccination status, who are providing services to any persons in pre-K properly and consistently wear a mask. It does not apply to children over the age or over grade 6. However, I just want to emphasize that it is our strong recommendation that these children continue to mask for their protection and the protection of others. I want to mention too that we've had lots of questions that this is an attempt to get closer to mandating vaccinations and other more strict mitigation strategies. I want to assure everybody that is absolutely not the case. We did not add any mandates for surveillance testing or any mandates for vaccine. All parents in the state of Michigan right now by law have the right to choose whether or not to vaccinate their child. And we are certainly an organization that follows the rule of law, and we will continue to do that, and we will continue to respect parents' decisions regarding that. The order does not apply to outdoor activities. So children in the early L grades that still have recess will have a break from their mask wearing. There are other exceptions while they're eating and drinking. It does not apply to children under 4 years old. It does not apply when developmental conditions where a face mask may inhibit access to learning or are on an IEP where it calls for speech and language and things like that. Vaccinated teachers with students who are hard of hearing or developmental conditions needing facial cues are also exempted, and medical reasons that are confirmed in writing by an MD and DO licensed to practice in the state of Michigan. We've had lots of questions about kids with anxiety and children with asthma. If our physicians were still on the line, they would probably be able to answer this more accurately, but we have been told that, especially for kids with asthma, that it can, in many cases, be very important for them to wear a mask because they are more vulnerable to severe COVID disease, considering that it is a lung issue. So I'm going to keep moving here, and I'm going to turn the floor over to Jarrell. Oh, this is really important. Sorry, I almost forgot. This is not a lifetime sentence. I know that people have fatigue from all the restrictions of last year. I have fatigue from the restrictions of last year. We had absolutely no authority. We had nothing to do with those orders other than that we were required by law to support and enforce those orders. Now that these are local orders, we have more flexibility. We're looking at local data. We're making local decisions based on local risks, and we can ebb and flow as we see the conditions change in our community. So this order will be lifted 60 days after the COVID-19 vaccine is available to grades pre-kindergarten through 6, or when community transmission for Ottawa County reaches the CDC's low level category for at least 7 consecutive days, or by notice of the health officer. And that doesn't mean that the health officer is looking for ways to make it more strict, which I know people have accused me of. That's not it. It's to look for conditions in our community that may be indicating that the risk isn't as high as we thought it would be, or that we were seeing in the South, where we could lift the order sooner. We are doing surveillance every day. We are watching for these things. Our sole purpose, as I mentioned before, is to protect the well-being of all children in Ottawa County. So I'm going to turn it over to Jarrell now, and he's going to provide some of the data that people have been asking for.
Lisa, if I could ask a couple of questions.
Oh, sure.
I'm assured that you're in communication with all the superintendents in the area.
Yes, absolutely. Marcia's here too, and we sort of divided up our organization. I've been handling certain segments of the population. Marcia has been working very closely with the school personnel, and so I'm going to have her speak to that real quick and talk about our roadmap for decision making.
My question, Lisa, is the health department making recommendations as to what type of masks our students, ought to be wearing in school? Is it the N95? Is it just the regular the blue and white one? And are masks being provided by schools?
Great question. We will make recommendations. We have a whole school team of communicable disease nurses that work with a school liaison at every single school to answer common questions that parents and school personnel are having. They do talk about the right kind of mask to wear. We have been working with the ISD and the state of Michigan to ensure that masks are available to students, and we will be providing them to each school for dissemination to their student population.
Thank you.
Good afternoon, commissioners. I'd just like to take you briefly down the road that led us from the end of school in June to the issuing of a public health order last Friday. I've been working very closely with many community partners throughout the pandemic, but largely working with our school leaders. So this slide is pretty dense with words. But as you could just see in the volume of words in each summer month represented here, that most of June was uneventful in Michigan. The risk to the community was low, and we were all enjoying the relaxation of strategies we have all used to slow the spread of COVID infection. By the end of June, though, we received our first report of a Delta variant sequencing result in an Ottawa County case. And we were seeing steeply rising cases in Florida and other states in our south and west. At all times, it's a core function of public health to be continually monitoring county health data, especially contagious diseases. So we are doing that at all times. It was happening throughout the summer. We spent the month of July increased to the moderate risk level. By the third week of July, most of our sequenced cases were resulting as Delta. Weekly meetings with every Michigan local health department continued, and the CDC and the American Academy of Pediatrics issued their guidance for returning to school. At the beginning of August, the health department began joining education leaders at weekly meetings to share with them the epidemiology of COVID in Ottawa County, hear feedback, share ideas, and answer their questions. These were meetings that were held all throughout last school year, and we took a pause for the summer. So we worked closely with them just as we had last year and appreciated that relationship. As we continued seeing a tide of rising cases moving from the south and west of our country toward Michigan, we experienced 2 risk threshold increases over a 3-day period starting on August 7th. We communicated with increasing urgency to our community and schools throughout this time through media releases and meetings. 2 days before issuing the August 20 public health order, we met with school leaders to let them know that we had drafted a framework for a face mask order and had been waiting to see if Ottawa County's metrics would settle out. Instead, we saw cases continue to rise and the first signs of a rise in hospitalized COVID cases in Ottawa County. We then held a live discussion with infectious disease specialists like the ones that you saw today and that joined us, and with pediatricians on Thursday, the day before. On Friday afternoon, still seeing no slowing of the trends we had been monitoring, we issued a face mask order for grades pre-K through 6. Darrell will join us now and take you through the specific data that we were watching and what that looks like.
Thank you, Marcia. So good afternoon, commissioners. It's a pleasure to be with you here today to talk about COVID-19 in our community. My name is Darrell Glasshauer. I'm an epidemiologist with the Ottawa County Department of Public Health. I'm here to share some of the latest COVID-19 data from Ottawa County, as well as data from across the country that supports taking action to protect children in schools. But before I start, it's important to note that over the last 7 weeks, the Delta variant has been the predominant COVID-19 strain in Ottawa County, as depicted in the blue on the screen in front of you. So if you look at that, it's very important because Delta is different. It's more contagious, has higher risk for hospitalization, and may be less susceptible to antibody treatment. So Delta is different. Over the last 7 weeks, COVID-19 weekly case numbers have increased to 10 times their midsummer level. COVID-19 hospitalizations, as shown in orange here, have also increased. Deaths, although low right now, typically don't show up until 2 to 4 weeks after cases start to surge. But we're likely to see an increase in deaths in the near future. The Delta variant is driving all of these recent increases. When we take a look at our positivity here in Ottawa County, we also see that we're increasing. In July, we had a positivity rate of about 3%, and now we're well over 10%. Our case rates, which are shown on the bottom here, are also showing an increase right down here. When we look at the case counts, and this is a dive into the data, not just overall, but into specific age groups. We want to take a look at especially the age groups that are affected by the masking order. In the gray graph above here, this is all ages in Ottawa County, similar to the graphs that you saw before. And you can see that there's an increase in the number of cases overall for all ages in Ottawa County. In the yellow graph here, you can see that school age cases aged 5 to 17 are also increasing. And then when we take a hard look at the data for those that are school aged but not yet eligible for vaccine, those numbers are also increasing in Ottawa County. So we're seeing not just an overall increase in the overall cases, but also increases in those that are affected by the mask mandate. In addition to local data, we're always looking to other places in the country and across the world to give us signs of what we may be anticipating in the near future. So to get an idea of what Ottawa County may be facing this fall, we have been reviewing national hospitalization data among other metrics, but hospitalizations in particular is displayed on this screen. This graph shows the COVID-19 hospitalization rates in the United States that have been increasing, but they have not surpassed previous highs. You can see this precipitous increase overall in hospitalizations. Please keep that in mind as I go to the next slide. Notice that this has not passed previous peaks. When we dive into the data for hospitalizations across the United States for the pediatric population, so just children 0 to 17 years of age, the hospitalization rates have surpassed previous weeks and are not showing any signs of slowing down. This is concerning for us. When we look at states that have seen tremendous surges in COVID-19, Florida on the left, Georgia on the right, you can also see that rates of hospitalization have continued to increase. Florida may be turning over, but Georgia's continued to go up. When we look at these numbers, one thing that I want to point out is that if we were to experience pediatric case rates similar to Florida, at the peak, that could be a different child hospitalized every 2 days. So this is at the peak.
Darrell, can I ask you to stop just a minute?
Sure.
I understand that the people outside can't hear him. Is there a way we can fix that? Can you somehow put a microphone by one of the speakers, or any ideas? Sorry, we just found this out that they can't hear it out there. Okay.
Got as loud as it can go on Zoom too, so it's not on our end.
Commissioner Bergman, I can try to get closer as well.
Okay, go ahead. Go ahead.
Good. I'll do my best to speak up. So thank you for letting me know.
Okay.
Just wrapping up here, talking about what states in the South are experiencing. And I just wanted to let everyone know that this is part of the data that we're looking at because we may be seeing a surge in the Delta variant here in Michigan this fall. When we look at Midwestern states like Indiana and especially Michigan, so getting closer to home, we can also see that pediatric hospitalizations are increasing. So when we look at our sister state to the south, Indiana, their pediatric hospitalization rate has been going up precipitously over the last few weeks. Michigan is a little bit more choppy, but we're also seeing an average rise in rates. When we look at COVID-19, we also want to keep in mind that children can be at risk for poor outcomes. And oftentimes what we think when we're talking about kids, we make the assumption that just because they're children, that if they get sick, they must have some sort of underlying condition. The best data that we have from CDC indicates that 46% of children who are hospitalized for COVID-19 don't have any underlying conditions. Just making it really important to understand that any kid could be hospitalized for an infection due to COVID-19. We also want to be talking and thinking about other pediatric outcomes. One of the ones that were mentioned by Dr. Julio is the number of MIS-C cases. And across the nation, there have been over 4,000 of them. MIS-C is a condition where there's an inflammation, often of the organs. It can happen after even a mild or asymptomatic COVID infection and can often result in hospitalization. So this is a poor outcome that can happen with children who are infected with COVID-19. Deaths are also something to keep in mind. There's often comparisons between influenza and COVID-19, and I just want to point out the figure here indicating that over the last 2 influenza seasons, there were 200 influenza-associated pediatric deaths. And that's for a similar period compared to 471 deaths among children, and that's only in a 15-month period. So I just want to summarize the evidence that I've presented here that has inspired our action. The Delta variant is very infectious, and kids under 12 are not yet eligible for vaccines and are therefore unprotected. Outcomes of Delta in other states are concerning, especially pediatric hospitalization. Children are going to be back in school this fall in person without many of the prevention strategies from last year. Without masks or regular testing, at least one modeling study shows that up to 90% of susceptible students may become infected by December. The American Academy of Pediatrics, CDC, and MDHHS say masks are safe and effective. Ottawa has accelerated through the CDC risk thresholds, as Marcia mentioned, from substantial to moderate to high in less than 1 week. There's a signal in our data showing an increase in hospitalizations in Ottawa County, and children can be susceptible to severe outcomes of COVID-19, including hospitalization, MIS-C, and death. It's our duty to prevent an imminent health threat to our children and the community. I'm going to pass it back to Marcia.
Okay, thank you, Jarrell. On the slide before you are some commonly asked questions, and I've received so many emails, so many that I can't keep up with them. Some have been with comments like, you at the health department, you're all heroes and we thank you. We can't thank you enough for doing this. Others are, we're disappointed in you and we don't want our children to be masked and we're concerned about things and we have a million questions. And so what we've done is we've gone through and filtered all of the common questions out, and some of those you see on the screen today, and we are right now going to be putting together a Q&A. We'll be posting it to our website in an attempt to answer all of the questions and concerns that we've heard from our community. We thank you. We want to be transparent. We want to be able to provide you a level of assurance about how we've made decisions, why we've made decisions, that our decisions are valid, they're scientifically sound, we have the support of medical professionals, and we want to share information so that you feel a level of confidence for you and your family moving forward.
Any questions for?
So on that note.
Okay, go ahead. I'm sorry.
No, I was just going to say we're going to be putting up frequently asked questions. We'll be adding the research that Jarrell presented today in his presentation and any legal opinions that, you know, like were mentioned earlier through the Sixth Circuit Court or any other things that are relevant to the temporary mask mandate that has been put in place in Ottawa County. So on that note, if there are any questions, I would be happy to entertain those.
Yes.
My only question is, Lisa, this pamphlet that you gave us, that's very helpful. Could we get it in email form to us? So
Absolutely.
else that they want to know questions, I can email this to them. So
good.
Perfect. I will make sure that we get that to you.
Thank you.
Randy?
Mr. Chairman, yes. Lisa, I have a question for you that maybe you can, the number that is, just so I understand, the blue transmission low number of 5% is based on 100,000 persons in total cases in the last 7 days. What is our, can you put that in a number of people, our based on our population? As I'm assuming it's all ages on the case rate, has to be under 5%, correct? Not just K through 6?
Yeah. I'm going to defer to Jarrell and Marcia on this one. You guys have a.
Yes, because I'm trying to drill this down to a number.
You got it probably, right?
It's easier to understand. If it's 500 people and there's 5 cases per day and it's 8 days, well, that's only 40 cases, so then we're under. I'm just using this as an example. If you could drill it down, please, Darrell, and kind of let us know.
You bet. I think this is a really good question. And it's a good question because not many people in the public think about COVID-19 in the sense of rates. And so it can be really hard because those metrics are based on some sort of like population metric. I can't calculate those in my head for you right now, but I can assure you that we'll make sure that those are available for people to see, to offer some sort of indication about what number of cases per day might put us into that, substantial, moderate, and low risk levels. And there's also information on the MI Safe Start map that can help get an idea of where we are in our community risk levels. They've offered not just the risk levels for the state of Michigan, MDHHS's risk levels, they've also created a converter map so you can see at any time where Ottawa County stands and also see the thresholds and watch them come down. But if you are a visitor of the Ottawa County COVID-19 data dashboard, and follow the numbers by day, we'll make sure that there's data available to give you an idea of where we are just based on the number per day.
Okay.
Yeah, Lisa, I got a couple questions, if I may. Past 18 months, this Board of Commissioners has been very supportive of the Health Department. We've always had your back. We've supported you without question. And I'm going to work as hard as I can to make sure that we can always support you and the work you're doing. You guys are doing good work in a lot of different areas. But many times over the last 12, 18 months, in particular, we asked you, the mandates that came from Lansing, we had to comply with those mandates. We had to enforce those mandates and follow those mandates. We looked the people of Ottawa County in the eye and said, this Board of Commissioners is not going to make mandates, and the Health Department is not going to make mandates. I'm not critical. I'm very supportive, and I'm not going to deviate from support the good work that the men and women are doing in the Health Department. Why did we, Ottawa County, Kent County, maybe Allegan County, why did we decide to go on our own and do this without looking for guidance from Lansing? Lansing pulled us by the nose for the last 12 months and said, here's what we're going to do. You've got to do this. You've got to do that. You've got to wear these masks. Okay. And all of a sudden, their mandates went away and we decided to pick up the ball. And now we look the people of Ottawa County in the eyes and say to them, we told you that we don't do mandates. Okay. That this board doesn't do mandates. What caused this at either Ottawa County level or state level, why somebody decided that we're going to pick up the ball at this point in time and put mandates in place?
Sure. And I'm sure that is on the mind of many people in the room, and I appreciate you bringing that up. I think it's a complex answer. As I mentioned earlier, I do believe that the state should be the one making the mandate at this point to protect the children of Michigan. Almost the entire state of Michigan is in the category of high transmission right now. When we started the pandemic, the mitigation strategies needed to apply to the entire state of Michigan because at that time we didn't really know what we were dealing with. We've learned a lot over the course of the past year. We know more, but we don't know everything yet. We let the restrictions go when the governor, or it was actually MDHHS, let their restriction or rescinded their orders. We did not put anything in place. We were monitoring the data continuously. We are always doing surveillance. And again, when there is an imminent health threat, I have a duty to act. And those health officers in Kalamazoo, Allegan, Kent, and Ottawa worked very closely together. We all feel that without a mandate, many children are going to go to school unprotected against the spread of the Delta variant. Again, the threat of the Delta variant, as Darrell mentioned, is different than the Alpha variant, which is what we were working on last year. To speak to the restrictions that were put in place by the governor, I have my own thoughts and opinions on that. I guess I would have hoped that they would have been more based on a start and a finish, that there would have been more metrics attached to those so that our population didn't feel that they were stuck in a restriction for the, the rest of time. We are doing every single thing that we can right now to issue the least restrictive orders that are based on a very targeted approach with a beginning and an end, so that people clearly understand that there's rationale behind what we're doing, and that there's a metric for when we'll be out of the threat. The public health code does provide authority, and maybe Doug can speak to this, authority to local health officers and state officials. The perspective, I'm sure, is different. I've never been a state public health professional, so I can only imagine they look at some of the same things, but different things. How does it impact the entire population of the state? I'm only looking at how orders and disease patterns impact what's happening in my own jurisdiction. I don't know if I'm actually answering your question, but I'm trying to the best of my ability. I think it's multifaceted. We did say that, I don't know that we never said, or that we said that we would never issue orders. I can't imagine that I would say that, because we have to issue orders on all kinds of things all the time on other things. I know that that isn't part of your role as county commissioners, but it is unfortunately what I'm bound to by the public health code in my role as the Ottawa County Department of Public Health Health Officer. I take it very seriously. I'm not trying to infringe on anybody's rights. I'm just trying to protect our children.
And if I want to respect everybody's time here, if I can have just a short follow-up, yes or no question, maybe, unless you want to expand. The four counties that we're talking about, Muskegon, Kent, Ottawa, Allegan, as you guys decided to put this mandate together, did anybody look to Lansing for guidance on this? Or this is something we just took as our own initiative and did this?
We look to Lansing for most things. There's a sort of a hierarchy to public health. There's the Centers for Disease Control, which helps guide actions across the whole United States. They provide input to the states, and then we consult with the states on most things. And so, yes, we are always talking to the state. We also communicated up to state partners through our local association, which is the Michigan Association of Local Public Health, to gain support and traction around, what's happening across the state. How can we act together? How can we be consistent? How can we best meet the important needs, health needs of our population? How can we communicate transparently? All of these things are always discussed with our state partners. And I can't answer why they have decided not to act. I'm guessing it maybe, I don't know, politics. I'm not a political being. I'm a health officer. And so I don't really want to speculate.
Thank you.
Mr. Chairman, I have a question. Lisa, I know that one of our neighboring counties, Board of Commissioners, actually passed a resolution. Are we to understand that those students went to school today without a mask?
No. And again, this is probably a legal question that Doug may answer better, but a Board of Commissioners do not have the authority to rescind an order by the public health officer. That authority is provided to the local public health officer by the state of Michigan. I believe you're speaking of Allegan, and my understanding is that they did pass a resolution that they wanted the health officer to rescind that order. Unless she rescinds that order stands, and is my understanding that that order will not be rescinded and it stands.
Okay, I have a couple more questions.
Hold on just a minute.
Yes.
You know what? We have some business before the commission that we want to be able to accomplish today. And we've got a lot of distraction that's happening in our vestibule there. And unless that calms down, I'm going to ask that they be removed from the hallway there. And I think I have the authority to do that. So, and I'm going to ask the police, the Sheriff's Department to help with that, clearing that vestibule area because it's too noisy. We can't hardly hear what's going on, and we have business to accomplish here today. So I don't know how you guys feel, but officers,
I think we muddle through. I think we muddle through.
I think we need
We do live in an, as much as I don't like it, we live in a nation that we have freedoms and we have to muddle through. Okay.
all right. Okay, Lisa, go ahead.
Yeah, Lisa, I want to continue with my questions. As of yesterday, the FDA has approved the Pfizer vaccine, if I'm correct.
Correct.
I would assume that a way for us to get these numbers down to where a low again, but that one way that we can do that is have as many adults and kids up to 16 to get vaccinated. And the sooner we're able to do that, maybe the sooner if we can have our kids back in school without a mask. Is that correct?
Yes, in fact, a lot of information is coming out that the best way to protect our kids is for have all of the adults around them to get vaccinated. We have to get the community transmission rate down into the low category. And yes, absolutely. And I really appreciate you bringing that up. Vaccination is the best way to do that. Now we are, just so that you know, since that happened, we are opening up some additional clinics that will be run through our department. The pharmacies are still running vaccination clinics, and I know there are appointments available. So please, I ask people watch our websites for opportunities to get vaccinated.
Okay. And I want to say to you and Marcia that and your team, I appreciate what you folks are doing.
Thank you so much.
Thanks. Anyone else? Thank you, Lisa.
Thank you all very much.
All right. Next thing on our agenda is public comment. We're going to call them off as they have put down their names, one at a time. I'm going to ask one of you, 2 or 3, to keep time. We're going to give them 2 minutes each, 2 minutes to speak. Come to the microphone, speak into the microphone clearly, and give us your name and address. And when you're done, exit the boardroom so that others can come in. Thank you. Go ahead, call the first one.
Yes, Casey Koopmans, and after him is Robert Davidson.
Okay.
Casey Koopman, 7345 Brewer Drive, Hudsonville. Some of you listening may know my 7-year-old son, Sam, who has cerebral palsy, autism, epilepsy, all the result of a common virus at 8 months old. At the age of 4, the only way to control his seizures was to have a quarter of his brain removed and any shot at independence. Today, he is academically at grade level, and independence in adulthood is a real possibility. The key to his epilepsy being controlled, something a COVID infection puts at great risk. Being in a class unmasked, unvaccinated puts kids at large risk. One that is magnitude smaller when others wear masks, a temporary tool that we can all help out with. Despite a more contagious variant, our district lacked the fortitude to implement a mandate, with the vaccine still being months away for kids like him. So what choice does my family have? Just keep him home, they say. That is your problem, not ours. Is that community? I don't have the answer to that choice. His long-term health on one hand, or his need to be in school to climb the developmental mountains that he faces. One thing I do know is that we could use a community. This may be impossible to understand, as most have not walked in the shoes of a parent with a medically fragile child. But I know several families like mine who've walked miles in the PICU in those shoes and could use a community. More broadly, I'm saddened by what seems to be the secularization of what I thought was a moral community, one that looked out and cared for others. To quote the late Jonathan Sachs, a respected religious leader, societal freedom cannot be sustained by market economics and democratic politics. It needs a third element, morality, a concern for the welfare of others, a commitment to compassion, and a willingness to not just ask what's good for me, but what is good for others. Later, he writes what the health department seems to understand. We should promote the greatest happiness for the greatest number, but what if the greatest number find the greatest happiness in things that are plain wrong? Sometimes we have to do the right thing, even if it makes people unhappy. Lastly, he acknowledges 3 ways to get individuals to act in a way that is beneficial to others. One is power. We force them. The second is wealth.
Heal.
Thanks.
We pay them. The third way, read your email. I've emailed all of you. Thank you.
Robert Davidson. David Barnowski is next.
Hey, I'm Dr. Rob Davidson, 15524 Oak Ridge in Spring Lake. I'm an emergency physician for 23 years of my life, 20 of them here in West Michigan in a county, a few counties up from here. Also, I'm a graduate student in public health at the University of Michigan, but not to offend anyone, I did go to medical school at Michigan State. I came here with a bunch of numbers and statistics, but our health department folks did a great job, and the 2 pediatric specialists from DeVos, and I appreciate that. I'm just going to let you all know what this thing has been like as a practicing physician on the front lines, both in December, January when we had a big wave, and then in March. I work in a small community hospital, much like Zeeland Hospital, much like North Ottawa Community Hospital, and a little bit smaller than Holland Hospital. We don't admit pediatric patients. We had people sitting in our ER for 24 hours at a time waiting for ambulances to take them all over West Michigan looking for beds because we didn't have beds within an hour and a half. We had to transfer people down to Hastings at times from way up in north of here. We can do it again. I don't know if the system can do it again. Our own EMS system up in our county lost 6 practitioners because they were driving around doing 24-hour shifts, making 17, 18 bucks an hour, wearing every gear they could possibly get with COVID patients, putting themselves at risk, and 6 of them quit out of a small crew. We've had nurses leave, the chronic shortage exacerbated by the pandemic. If we have to do this again, now with kids, with the Delta variant showing in other states that kids are much more susceptible. I've had to watch about a dozen kids in my career since I was a resident die in front of me, not because of my fault, but because of a disease that took them, either trauma or neglect or infectious diseases. We have a means, a simple mask that isn't 100%, but it's not 0% either. It does have an effect. It will help save a few kids' lives. And if we have 1 or 2 kids in this county that don't die, it's going to save those medical teams that would have to pronounce them dead and live with that the rest of their lives and not be able to sleep at night when they think about those kids. I can still remember the name of the first kid that I saw die in front of me as a resident. And if we don't do this, you guys will all have to live with that if we don't support the public health department here in Ottawa County. So thanks.
David Barnowski and then Brian Van Dusen.
If you guys would exit if you're done, please.
Can I go out the door you guys came in? I was going to ask that too.
Go ahead. Come on.
Community. We need community.
You want to share this with them all?
You have to do that outside. Okay. Excuse me, ma'am.
Sir, come on up.
My name is David Barnowski. I live at
I served in the military for this. This is when I'm disappointed.
Are we ready?
Yes, go ahead.
My name is David Barnowski. I live at 14477 Shady Hollow in West Olive. I'm here to advocate for masks being required in schools. I'm here to advocate that you support your public health officers. Parents obviously know what is best for their own children. That's not the question that Ottawa County or you should be asked to decide. The correct question is, who knows best how to protect all of us? You know who. This county hired them. They brief you every meeting. The powers given to public health officials to combat an outbreak of disease do not pass through this board. They are delegated by the legislature directly to the state health department and to the county's district health department. There's good reason for that. Governments are instituted among men and women to secure the rights to life, liberty, and the pursuit of happiness. In that phrase, as in the real world, life necessarily comes before liberty. The rights of all of us to have our lives protected should supersede anyone overruling the people who have spent a lifetime studying public health and who are best equipped to protect us all. I ask this board not to interfere in the efforts of the public health officials to protect all of us. But I also ask that once that is decided, you do everything in your power to alleviate the pain of those most directly suffering from the effects of this necessary decision. I've watched a lot of your meetings. I see them come and ask you to take away their pain. I lost my place. I believe the solution they propose, letting each parent decide for themselves and their children, is absolutely wrong. I have no doubt that their pain is real and that more could be done to lessen it. Let's see if I can find the phrase I missed. That'll do it. Is there any chance we're going to reconsider that back door?
Thanks, Dave.
I'll help you out.
All right. Yeah.
Brian Van Dusen, and then Ryan, I apologize, Smarsky. I'm not sure on the last name.
Hold on just a minute. Are you,
Ready to go again?
so they're looking for safety to get out.
Right now.
That's embarrassing.
Okay, go ahead.
You're a full-grown adult. That's embarrassing.
We're ready?
Brian Van Dusen, 7621 Adams Street, Zeeland, Michigan. We just stood up and recited the Pledge of Allegiance. Maybe we should do it again. How some of us quickly forget, with liberty and justice for all. What is liberty? It is the state of being free in a society from oppressive restriction imposed by authority on one's way of life, behavior, or political views. Is this not what Republicans believe? Is this not what our founding fathers died for? More and more Michigan citizens are fed up with our legislators and local elected officials, and now I feel the Republican Party is dead. Ottawa County was one of the most beloved constitutional Christian conservative counties in the state. We're not only fighting our daily sinful flesh and temptations from the devil, but now we must fight against government overreach. I'm 44 and I have 4 children. They've been in the public school system in Zeeland. We're tired of the mandates, whether masks or vaccines. We're tired of being shamed because we want a choice. We're tired of feeling guilty because we're so-called selfish. Do it for the greater good, they said. At the beginning of this adventure, they said no masks, then new science, and then they said we need masks. Over the last 30 days in Michigan, 23% of the positive China virus cases in Michigan are those that were vaccinated. Trust the science, they say. This isn't about science, but power. For the so-called president of the United States to call on private businesses for mandated vaccines is communism. I trust neither masks, vaccines, or government. I had COVID this past spring. Headache, low fever, sinus pressure were my symptoms. It lasted 3 days. Didn't lose my taste or smell. I wasn't quarantined to one room in my house. My wife and my kids were also quarantined, and not one of them got sick. Thanks for your time.
Thanks. Who's next?
Ryan Smarsky.
Your name and address.
Hi, my name is Ryan from Hudsonville. I wanted to just really briefly ask a quick question. Have you asked the health people how they're actually testing that the Delta variant exists? If they've been pulling things off of the market
Speak into your microphone, please.
if they've been pulling things off the market to be able to test appropriately for actual COVID, how in the world do they have the ability to test for a variant of Delta? Ask that question. That's a legitimate question. I understand where a lot of you are. You guys are in a difficult spot. You don't want to be divisive. I believe that you want to do what is right. From a political standpoint, you think masks don't have a downside. The problem is it's wrong. They do have a downside. They have a massive downside. Politicians don't do what is right. They do what is easy. And one of the things I just realized at the end of this hearing, you guys are going to be voting on $2.1 million to be able to go over to the health department to get 17 new positions. Maybe that's the reason that they're doing this. Maybe that's the reason that they want to come down. They've been told from up above that if they do this, they'll get the money. The $2 million going to their, oh, that's a great idea. They don't tell you the stuff behind the scenes. I'm just telling you, if you all have great kids and grandkids, you need to see it like your kids or your grandkids are being told what to do in their homes. If you don't want the people to tell you what and what not to wear, what and what not to eat, you gotta vote on this the correct way. I know that you don't have a resolution before you at the moment. You need to get a resolution. This needs to be rescinded somehow because this is unfair for every parent. We need personal choice. Freedom is not free. We need to understand. You had a really good point. Why are they doing this? Look deeper. Dig. Find the corruption that's in here. You know it's here. Thank you for your time.
Thank you.
And try to get an industrial hygienist in here so that you will know what actually to do.
All right. Next on the agenda is we'll wait just a minute for him to leave. And right. Next thing on the agenda is approval of agenda. Can I get a motion,
So
please?
moved.
It's been moved and supported. Comments or questions? All in favor, say aye.
Aye.
Opposed, same sign. Thank you. Actions and reports. Consent resolutions, Mr. Fensky.
Thank you, Mr. Chair. I will make the motion to accept consent resolutions 1 through 3.
1 through 2. Hearing is 2. Do you have 3?
It's 3. The number 3 is still 2.
1, 2.
Okay, all
3.
right. Okay, sorry. All right. Is there a second for that?
Okay.
I just lost my roll call. I just lost your name.
Rachel, will you call the
Rachel.
roll, please?
No worries.
Rachel, will you call the roll, please?
Yes, Mr. Holtlohr,
Yes.
Mr. Garcia,
Yes.
Mr. Danielsberg,
Yes.
Mr. Dion,
Yes.
Yeah.
Mr. Terpstra,
Yes.
Mr. Meppeling,
Yes.
Mr. Baumann,
Yes.
Mr. Fensky,
Yes.
Mr. Bergman.
I'm sorry, Rachel. Yes.
Motion passes.
Okay, public hearing. Mr. Zylstra, would you make that motion to open and then to close as well?
Sure, I'd like to make a motion, Mr. Chair, to open the public hearing to receive comments on the Mary Free Bed Rehabilitation Hospital refunding bonds.
Second.
Moved and seconded. Comments or questions? All in favor, say aye.
Aye.
Same sign. Is there anyone that would like to address the council or commission regarding this issue? If not, we do.
Oh.
Okay, we do.
I just wanted to introduce myself. Good afternoon. My name is Sean Rucker. I am an attorney here on behalf of Mary Free Bed and just here to answer any questions that you all might have.
All right. Any questions of Sean? If not, thank you.
Thank you.
You want to make a motion to close, Doug?
Yes, Mr. Chair, I'd like to make a motion to close the public hearing to receive comments on the Mary Free Bed Rehabilitation Hospital refunding bonds.
Support.
We moved and supported. Any comments? All in favor, say aye.
Aye.
Opposed, same sign. Thank you. Under action items from planning and policy, Mr. DeYoung.
Did we skip the
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 administration.
administration one? You want me to take that too?
Administration.
You know what? I have a different agenda than you do, I think.
Okay, you want me to take them all?
Yeah.
All right. Thank you. Regarding the David Van Ginhoven Memorial, I moved to name the paved loop through the forest southwest of the Nature Center at Hemlock Crossing County Park in honor of Dave Van Ginhoven, including the installation of an appropriate permanent sign.
Support.
Supported, comments or questions?
Mr. Chairman, I knew David quite a while, and I think he would be very honored that he got his name on this. So I worked with him in the city of Zeeland through the school and with parts and the foundation too. So anyway, I do appreciate this for him. Thank you.
Mr. Chairman?
Yes.
I also worked with David Van Ginhoven in the Parks Department. Just a wonderful man. He worked diligently, hard. He was extremely excited about the work that the Ottawa County Parks is doing. And I also, again, like I say, I think this is a great opportunity.
Roll, please.
Sure. Mr. Garcia,
Yes.
Mr. Fensky,
Yes.
Mr. Zylstra,
Yes.
Mr. Dannenberg,
Yes.
Mr. Terpstra,
Yes.
Mr. Meppelink,
Yes.
Mr. Holtfloor,
Yes.
Mr. Baumann, Mr. DeYoung,
Yes.
Mr. Bergman,
Yes.
motion passes.
Thank you.
Regarding the Grand River Collaboration Resolution, I move to approve and authorize the board chairperson and clerk register to sign the Ottawa County Grand River Collaboration Resolution.
Comments or questions? Rachel, would you call the roll, please?
Mr. Dannenberg,
Yes.
Mr. Baumann,
Yes.
Mr. Fensky,
Yes.
Mr. Meppelink,
Yes.
Mr. Terpstra,
Yes.
Mr. Garcia,
Yes.
Mr. DeYoung,
Yes.
Mr. Holtfloor,
Yes.
Mr. Zylstra,
Yes.
Mr. Bergman,
Yes.
motion passes.
Next, regarding the Land Bank Authority bylaws, I move to approve and amend the bylaws of the Ottawa County Land Bank Authority.
Support.
Comments or questions? Call the roll, please.
Mr. Holtfloor,
Yes.
Yes.
Mr. Terpstra,
Yes.
Mr. Garcia,
Yes.
Mr. Zylstra,
Yes.
Mr. Fensky,
Yes.
Mr. Dannenberg,
Yes.
Mr. DeYoung,
Yes.
Mr. Baumann,
Yes.
Mr. Bergman,
Yes.
motion passes.
Regarding the Stearns Bayou Connector easement, I move to approve and authorize the board chairperson and clerk register to sign the Riverside Storage LLC easement as required for construction of the Grand River Greenway Idamas Explorer Trail in the amount of $1,000 from the Parks millage.
Moved and supported. Comments or questions? Rachel, would you call the roll, please?
Mr. Fensky,
Yes.
Mr. Zylstra,
Yes.
Mr. Garcia,
Yes.
Mr. Holtfloor,
Yes.
Mr. Baumann,
Yes.
Mr. DeYoung,
Yes.
Mr. Meppelink,
Yes.
Mr. Dannenberg,
Yes.
Mr. Terpstra,
Yes.
Mr. Bergman, motion passes.
Next, regarding the creation of the Port Sheldon Closing Planning Committee, I move to approve the creation of a permanent Port Sheldon Closures Planning Committee consisting of representatives of the county, other taxing units, and economic development organizations.
Support.
Moved and supported. Comments or questions? Rachel, would you call the roll, please?
Mr. Zylstra, Mr. Fensky,
Yes.
Mr. Baumann,
Yes.
Mr. Garcia,
Yes.
Mr. Meppelink,
Yes.
Mr. Dannenberg,
Yes.
Mr. DeYoung,
Yes.
Mr. Holtfloor,
Yes.
Mr. Terpstra,
Yes.
Mr. Bergman,
Yes.
motion passes.
Finance and Administration, Mr. Baumann.
Thank you, Mr. Chairman. Regarding the fiscal year 2021 budget adjustments, I make a motion to approve the 2021 budget adjustments per the attached schedule.
Support.
Moved and supported. Comments or questions? Rachel, would you call the roll, please?
Mr. Baumann,
Yes.
Mr. Garcia,
Yes.
Mr. Meppelink,
Yes.
Mr. Holtfloor,
Yes.
Mr. DeYoung,
Yes.
Mr. Zylstra,
Yes.
Mr. Terpstra,
Yes.
Mr. Dannenberg,
Yes.
Mr. Fensky, Mr. Bergman,
Yes.
motion passes.
Regarding the fiscal year 2022 capital improvement plan, I make a motion to approve the fiscal year 2022 to 2027 capital improvement plan.
Moved and supported. Comments or questions? Rachel, would you call the roll, please?
Mr. Terpstra,
Yes.
Mr. Holtvluwer,
Yes.
Mr. Zylstra,
Yes.
Mr. DeYoung,
Yes.
Mr. Eppelink,
Yes.
Mr. Baumann,
Yes.
Mr. Fensky,
Yes.
Mr. Dannenberg,
Yes.
Mr. Garcia,
Yes.
Mr. Bergman,
Yes.
motion passes.
The Tower Management Consulting Services, I make a motion to approve and authorize the board chairperson and clerk register to sign the contract with Telrad Incorporated for Tower Management Consulting Services at a total cost of $12,500.
Moved and supported. Comments or questions? Rachel, would you call the roll, please?
Mr. Holtvluwer,
Yes.
Mr. Garcia,
Yes.
Mr. Dannenberg,
Yes.
Mr. DeYoung,
Yes.
Mr. Zylstra,
Yes.
Mr. Terpstra,
Yes.
Mr. Meppelink,
Yes.
Mr. Baumann,
Yes.
Mr. Fensky,
Yes.
Mr. Bergman,
Yes.
motion passes.
Regarding the executive recruitment consulting services, I make a motion to approve and authorize the board chairperson and clerk register to sign the contract with GovHR for executive recruitment services to assist in hiring a county administrator at a cost of $22,500 and to appoint a county administrator search committee consisting of Chair Bergman, Vice Chair Fensky, Commissioner Dannenberg, Jose Gomez, Jennifer Owens, Michelle Fair, and Monica Verplank.
Support.
Supported. Comments or questions?
Chair, I do have one quick question for Al. I don't remember Michelle Fair's name being in here when we went through committee.
Yeah, I think she's been there the whole time.
Was indeed.
Yeah.
Yeah. Yeah.
Yes.
Okay.
I only know that because she's on housing with me and I was really pleased to see her name on
Okay.
there. So.
She's on our
Okay.
housing commission and she was a longtime chamber and DDA director for Hudsonville. So,
Okay.
Yeah.
Okay. No, that's fine.
Any comments or questions? Roll.
Mr. Garcia,
Yes.
Mr. Fensky,
Yes.
Mr. Zylstra,
Yes.
Mr. Dannenberg,
Yes.
Mr. Terpstra,
Yes.
Mr. Meppelink,
Yes.
Mr. Holtvluwer,
Yes.
Mr. Baumann,
Yes.
Mr. DeYoung,
Yes.
Mr. Bergman,
Yes.
motion passes.
Regarding the GCSI retainer agreement, I make a motion to approve and authorize the board chairperson and clerk register to sign the retainer agreement between Governmental Consultant Services Incorporated and Ottawa County for a cost of $48,000 per year.
Supported. Comments or questions? Rachel, would you call the roll, please?
Mr. Dannenberg,
Yes.
Mr. Baumann,
Yes.
Mr. Fensky,
Yes.
Mr. Meppelink,
Yes.
Mr. Terpstra,
Yes.
Mr. Garcia,
Yes.
Mr. DeYoung,
Yes.
Mr. Holtvluwer,
Yes.
Mr. Zylstra,
Yes.
Mr. Bergman,
Yes.
and passes.
Sorry, Bob, you had to sit through all that to wait and see if we would approve your contract, right? All right, go ahead.
Regarding the community mental health personnel request, I make a motion to approve the request from CMH to increase one part-time non-benefited mental health clerk to full-time benefited and upgrade one mental health specialist to a mental health clinician at a total cost of $56,658.26 per year paid for with Medicare and Lakeshore Regional Entity funds.
Support.
Moved and supported. Comments or questions? Rachel, would you call the roll, please?
Mr. Holtvluwer,
Yes.
Mr. Meppelink,
Yes.
Mr. Terpstra,
Yes.
Mr. Garcia,
Yes.
Mr. Zylstra,
Yes.
Mr. Fensky,
Yes.
Mr. Dannenberg,
Yes.
Mr. DeYoung,
Yes.
Mr. Baumann,
Yes.
Mr. Bergman,
Yes.
motion passes.
Regarding the second community mental health personnel request, I make a motion to approve the request from CMH to add 14 full-time benefited positions at a total cost of $985,729.13 to be paid for with SAMHSA and CCBHC grant funding.
Supported.
It's been moved and supported. Comments or questions? Jill?
Fensky,
Yes.
Mr. Zylstra,
Yes.
Mr. Garcia,
Yes.
Mr. Holtvluwer,
Yes.
Mr. Baumann,
Yes.
Mr. DeYoung,
Yes.
Mr. Meppelink,
Yes.
Mr. Dannenberg,
Yes.
Mr. Terpstra,
Yes.
Mr. Bergman,
Yes.
motion passes.
The public health personnel request, I make a motion to approve the request from public health to add 17 full-time benefited positions and 25 part-time non-benefited positions at a total cost of $2,179,153 to be paid for with federal and state grant funding.
Moved and supported. Comments or questions?
Mr. Chairman, I have a comment.
Yep.
Al, this money here, this grant money, how soon do we need to act on that?
Well, these are already people who are here that I prior had the authority. So these 17 positions have been here a long time. And under the emergency order, you allowed me to keep these going by administrative rule. So these positions are present and working now. And since that authority runs out at the end of September, this is really for a renewal so we can keep those people on the job.
If we don't act on it today, will we lose that grant money?
We won't lose the grant money, but we won't have money to pay people, so they'll have to leave the jobs they've had for over a year that are dealing with COVID right now.
I've been asked by people, and again, it's an upside down world out there, so bear with me. But I've been asked by people if some of these people will be in our middle schools, looking for people with masks and stuff. Is that?
No, throughout the pandemic, we have never sent people out looking for problems to write people up for. We have responded to complaints, which we are legally required to do. And so if we did get a complaint from a parent or a teacher at a middle school, then we would respond. But if we don't get complaints, none of these positions are going out and looking for things to write people up for. They are all busy at work dealing with the pandemic.
This is basically just a continuation.
Right.
To be able to pay for these people.
Right.
Commissioner DeYoung, this is a little bit like what we're in right now. It's hard to back up the truck when we're already paying for these people, so.
And when the money goes away, the positions go away.
I'm struggling with this, with all the mechanics that have gone on in the last week. I'm struggling. It just seems like I have so much respect for the health department. I have so much respect for all those people working at the health department. I personally feel betrayed by what happened here in the past week after I did approve this at the finance committee. Okay. And I thought it was a good thing on Tuesday. I still think it's a good thing today. I feel betrayed by the health department this past week. And it seems to me, I'm struggling because it seems to me like we're rewarding today bad behavior. And I don't want to take this out on anybody. I don't want this to be misconstrued. I wish that we could hold this for 2 weeks and sit down with the health department and say, health department, we want to approve this, but we also want to work with you in good faith on the mandate that you put in place. Is there anything else that we can do on our mandate, okay, to compromise that everybody gets what they want? Truthfully, I'm very supportive.
I can honestly tell you that if you pull 17 positions out tomorrow, which is what we will do without the funds to pay them, then they will be crippled in their ability to deal with this. They are overwhelmed, hundreds and thousands of emails, phone calls, texts. So I recommend against that course of action.
Well, so it's in my understanding, here, I already forgot your name.
Al, I'm Al. Good to meet you, friend.
Goodbye. It's in my understanding that these 17 people are the same people right now who are collecting the data administering tests for COVID, that they are involved in the COVID battle right now. And if we were to not fund these, then we're going to lose a step or two in this process.
We will. They will be overwhelmed.
Get back to that low number.
Yes,
Okay.
I believe that.
I appreciate and understand that these folks are getting messages and comments and texts and emails from the general public right now. And I understand that they got their hands full because of the actions last Friday. But this Board of Commissioners didn't cause that action.
Yeah, and please let me be clear that they were at that point before that action was taken. We do not have excess staff sitting around at the health department
looking at what to do. We have added to the level of what we need. And even then, they're overburdened and stressed. So that was before last week's action. Now it's even worse.
And Al, I respect that, okay, and I believe that wholeheartedly. And I just need personally to take a deep breath here, because so many of my colleagues here that I like and trust have got their hind ends kicked this week, you know, over and over again. Sunday night, a lady called me on the phone Sunday night, and same thing that's probably going on at the health department here. And she said, Greg, if you vote for masks, I hope you burn in hell. And my stomach's been in knots for 4 days, like most of my colleagues here that I like and respect. And I'm just I'm mad as a hornet that we're in this position, because these guys did nothing wrong here. Nothing. None of these guys on this board had one say-so on this decision, and we're getting our asses kicked by hundreds of people for something we didn't do. And I'm going to support this, Al, because I believe in you and what you're saying, and I want to make sure that nobody loses their jobs. But I want people to know that I'm hurt, I'm angry, my heart bleeds for 11 commissioners on this board for something that we didn't do. I don't think it had to be like this. I believe the ball should have been punted back to Lansing. Thank you for letting me vent. I've never experienced or expressed my feelings like this, and I feel better about it. Thank you.
Mr. Chair, Al, just talking what you said, that these people were working already. I was supportive of this.
Al, speak into your microphone so that we
Okay.
can hear, okay?
Okay. Last week, Friday, when we were all getting a lot of phone calls, I got one from a young man who was extremely frustrated. It had nothing to do with the mask. His wife lost all of her immunity, and she had to get all new vaccines. And so to save money, they went through the health department. Well, there was a little bit of a snafu with his insurance company, I think it's Priority, and the health department. And they wouldn't answer his phone. So he went down there on Friday, and he did get upset. He said the F word, and he apologized. He says 2 minutes later, there's a police officer behind him escorting him out. He says, I can't get the health department to do it. So I did. He said, because everybody was on the phone, but they had 3 people sitting there. He was frustrated. I am dealing with Lisa, but we're not there yet. We're still got to follow up on this. But now when you say they've been working already, then I struggle. I'm thinking, well, where are all these people? What are they doing? One guy can't get through because of his vaccines for his wife. So I'm with Commissioner DeYoung. I'm struggling all of a sudden with this too. But I think going forward, we probably will all vote for it. Thank you.
And I did want to mention too that I did authorize an emergency call center agreement on Friday for that very reason, because we do have people that have legitimate clinic needs and other needs that have not been able to access the service as readily because of some of the other demands. And so we will have a different way of dealing with triaging and dealing with phone calls to take some of that pressure off.
Mr. Chairman, also,
Go ahead.
thank you. I agree with what Commissioner DeYoung said, but I also have some other concerns as well. I do believe that, as we said, for the last year and a half, we touted and we said we had to do what the state of Michigan said. And now we're going alone, separate from the state of Michigan. And I know we're asking Lansing for help. I'm not against this, but I'm not for it at this time. I will be voting no as a vote of no confidence right now in our health department leadership. And until that changes, I can be changed. I know we need the funding, but at this time, I will not be voting for it. Thank you.
Call the roll, please.
Mr. Zylstra.
Yes.
Mr. Fensky.
Yes.
Mr. Baumann,
Yes.
Mr. Garcia,
Yes.
Mr. Meppelink,
No.
Mr. Dannenberg,
Yes.
Mr. DeYoung,
No.
Mr. Holtvluwer,
Yes.
Mr. Terpstra,
No.
Mr. Bergman.
Yes.
Motion passes.
Regarding the interim county administrator pay and temporary appointment, I make a motion to approve to pay interim county administrator John Shea at the unclassified U15 level of at $158,572 from August 30, 2021 to the conclusion of his duties as interim county administrator, and to appoint Mr. Shea to the boards listed in the agenda there.
It's been moved and seconded. That's okay. I understand. You don't want to read those. Okay, any comments or questions? Rachel?
Mr. Baumann,
Yes.
Mr. Garcia,
Yes.
Mr. Meppelink,
Yes.
Mr. Holtvluwer,
Yes.
Mr. DeYoung,
Yes.
Mr. Zylstra,
Yes.
Mr. Terpstra,
Yes.
Mr. Dannenberg,
Yes.
Mr. Fensky,
Yes.
Mr. Bergman.
Yes.
Motion passes.
Regarding the resolution in support of an additional circuit court judgeship, I make a motion to approve and authorize the board chairperson and clerk register to sign the resolution in support of an additional circuit court judgeship.
Support.
Been moved and supported. I'm going to ask, oh, he's already there. Okay, good.
Thank you,
I
Mr.
want you to
Chairman.
tell us why we need another judge. Do that, are you?
I certainly could, but it might take longer than you want to
Oh.
today.
We might give you 2 minutes.
All right, I'll see if I can do this quickly. I can show you all and provide all of you the data that shows changes in workload for all of our judges over the last several years. As a result of the changes in workload, the Michigan Supreme Court, in their biannual Judicial Resources Report, has recommended a Fifth Circuit judgeship for Ottawa County back as far as 2011. They recommended it again in 2015. They recommended it again in 2019, which is the last report that was done. At the request of Commissioner Zylstra at the finance meeting, I reached out to the State Court Administrative Office to see if they had plans to update that report or make any changes immediately. And I received a response back that they're not planning to do that, and that the recommendation that they have in the 2019 report stands. In addition to looking at that report, which is based not just on case statistics, because as Commissioner Zylstra pointed out at the finance meeting, there are some parts of our caseload that have actually gone down over that time period. But what they have done is worked with the National Center for State Courts to develop a weighted caseload study of all the judicial workloads in the state. It's not just Ottawa County, but they've applied this formula across all the states, all of the counties in Michigan. And as a result of that, they came out with the recommendation that we need additional judgeships. Using those same case weights, just in our own local analysis, we have shown over the last couple of years to be able to maintain the workload that is coming currently into the circuit court in Ottawa County. The judges have to work between 50 and 59 hours a week, which is what they have been doing to keep up with everything. The court's position is simply that has worked well. The judges have not complained about it, and they've kept the work going. And they've been able to stay up with the workload. Even during COVID, when a lot of courts shut down, our judges continued working. They continued coming to court every day and running a lot of Zoom hearings so that people's legal business could be taken care of. My concern as a court administrator is simply that this plan is not sustainable over time. And we're at a point now where We've had several years of the Supreme Court and the State Court Administrative Office recommending that there be an additional judgeship for Ottawa County. And shortly after the Finance Committee meeting last week, I was advised that in the legislature, House Bill 5259 was submitted. It was introduced by Representative Meerman and referred to the Committee on Judiciary in the House. And that would authorize a Fifth Circuit judgeship for Ottawa County that would take effect January 1 of 2023. So in effect, what the court is asking the Board of Commissioners for is a supportive resolution that we can share with the legislature. And it would further indicate that understanding that the costs of the judgeship, the direct costs of salary and benefits would be paid by the state, that there are some local costs, including the infrastructure and office and any related staff. And that's what we would be seeking support from the Board of Commissioners for.
Okay. Any questions of Kevin?
Quick. Yeah, Kevin, I appreciate your following up on that point.
Welcome.
I would have liked to see the SEAO report, but we don't have it and probably won't have one for another year or two at least, but thank you very much.
That's probably true, yes.
Anyone else?
You're very welcome. Thank you.
Rachel?
Mr. Terpstra?
Yes.
Mr. Holtlor?
Yes.
Mr. Zylstra?
No.
Mr. DeYoung?
Yes.
Mr. Meppelink?
Yes.
Mr. Baumann?
Yes.
Mr. Fensky?
Yes.
Mr. Dannenberg?
Yes.
Mr. Garcia?
Yes.
Mr. Bergman?
Yes.
Motion passes.
Regarding the setting of the public hearing for the fiscal year 22 budget, I make a motion to approve the setting of a public hearing on the fiscal year 2022 Ottawa County budget for Tuesday, September 14, 2021, to be held in the Ottawa County Boardroom in West Olive at 1:30 p.m.
Been moved and supported. Comments or questions? Call the roll, please.
Mr. Holtlor?
Yes.
Mr. Garcia?
Yes.
Mr. Dannenberg?
Yes.
Mr. DeYoung?
Yes.
Mr. Zylstra?
Yes.
Mr. Terpstra?
Yes.
Mr. Meppelink?
Yes.
Mr. Baumann?
Yes.
Mr. Fensky?
Yes.
Mr. Bergman?
Yes.
Motion passes.
Thank you.
Regarding the motion of setting a public hearing to close out the CARES Community Development Block Grant, I make a motion to the setting of a public hearing on the closeout of the CARES Community Development Block Grant for Tuesday, September 14, 2021, be held in the Ottawa County Boardroom in West Olive at 1:30 p.m.
Support.
Moved and supported. Al, would you just in a few words explain what this is about?
Yes. One of the, I think, 7 grants that we received last year was $500 and some thousand, which dollars? I'm sorry.
CARES Community Development Block.
Yeah, it was $500 and some thousand on from the CBDG grant for COVID-related purposes. A couple of things we bought were the robots to clean the jail. There are a whole number of items that we purchased with this money. And so per the grant requirements, we have to have a public hearing at the closeout with this one.
Okay.
We don't have to with a lot of our grants, but this one did come with that requirement.
Okay. All right. Any comments, questions? Rachel, would you call the roll, please?
Mr. Garcia?
Yes.
Mr. Fensky?
Yes.
Mr. Zylstra?
Yes.
Mr. Dannenberg?
Yes.
Mr. Terpstra?
Yes.
Mr. Meppelink?
Yes.
Mr. Holtlor?
Yes.
Mr. Baumann?
Yes.
Mr. DeYoung?
Yes.
Mr. Bergman? Yes. Motion passes.
Regarding the Ottawa County or the Ottawa Conservation District Agreement renewal, I make a motion to approve and authorize the board chairperson and clerk register to sign the agreement between the county and the Ottawa Conservation District in the amount of $100,000 per year for a 2-year term.
Support.
Moved and supported. Comments or questions? Rachel, would you call the roll, please?
Mr. Dannenberg?
Yes.
Mr. Baumann?
Yes.
Mr. Fensky?
Yes.
Mr. Meppelink?
Yes.
Mr. Terpstra?
Yes.
Mr. Garcia?
Yes.
Mr. DeYoung?
Yes.
Mr. Holtlor?
Yes.
Mr. Zylstra?
Yes.
Mr. Bergman? Yes. Motion passes.
Regarding the Mary Free Bed Rehabilitation Hospital refunding bonds, I make a motion to approve and authorize the board chairperson and clerk register to sign the bonding activity of the Kent County Hospital Finance Authority under the IRS Code Section 147F for funding that affects one Mary Free Bed Hospital facility in Ottawa County, as well as acceptance of Mary Free Bed's indemnification of Ottawa County for this action.
Support.
Moved and supported. Comments or questions? Rachel?
Mr. Holtvluwer.
Yes.
Mr. Meppelink.
Yes.
Mr. Terpstra.
Yes.
Mr. Garcia.
Yes.
Mr. Zylstra.
Yes.
Mr. Fensky.
Yes.
Mr. Dannenberg.
Yes.
Mr. DeYoung.
Yes.
Bauman.
Yes.
Mr. Bergman.
Yes.
Motion passes.
And finally, regarding the deferred compensation 457 employer match cap removal for unclassified employees, I make a motion to approve the restoration of the unclassified optional 457 deferred compensation plan employer cap to the IRS limit effective January 1, 2022.
It's been moved and supported. Comments or questions? Rachel, would you call the roll, please?
Fensky.
Yes.
Mr. Zylstra. Mr. Garcia.
Yes.
Mr. Holtvluwer.
Yes.
Mr. Bauman.
Yes.
Mr. DeYoung.
Yes.
Mr. Meppelink.
Yes.
Mr. Dannenberg.
Yes.
Mr. Terpstra.
Yes.
Mr. Bergman.
Yes.
Motion passes.
May take a 5-minute recess.
5 minutes.
Our agenda is a report by the county administrator. And as many of you know, Al, this is his last official commission meeting. And so I don't want to say it's your swan song, but
In like a lamb, out like a lion, I guess. I don't know.
Okay, all right.
I'll just say that I am going to do a digest article to all employees. And I'm also going to be doing I think Thursday, I have a virtual brown bag. So I'll refrain from many comments today with the press of business and everybody who's here.
Okay. So just like that, you're done, huh? Okay. With your county, report. Okay. General information, comments, or meetings attended.
Yes, Mr.
Commissioners?
Chairman.
Yes.
I would like to state, not this past Sunday, the Sunday before, I had the privilege of riding with the Marine Division on Lake Macatawa in Holland from 10 o'clock until 4 o'clock during the day. Very, very knowledgeable guys out there. They know what they're doing, and they certainly aren't there to make life miserable. I was overwhelmed at how they can type on a computer with the bolt going like this all the time. So very gifted. I have talked to Val and Steve, and they would like a lot of you guys to sign up for some of this ride-alongs on the Marine Division to get an idea of what's happening out there. So anyway, I enjoyed it. I couldn't say enough about the professionalism of those guys. So thank you.
Okay. Anyone else?
Mr. Chairman?
Yes.
I wrote a letter a couple days ago, and some of it I covered earlier during some of my other comments. And first of all, I want to apologize because I'm pretty passionate about what's going on today and respect for each other. So I'm not going to read the whole letter. I shared this letter with our township board last night, but I want to read the highlights. I feel in my heart that I want people to know where I stand, and it's only just a few sentences. So with that, who knows your child better than their parents, their guardian, or their child's pediatrician? Regarding wearing a mask, every parent should have the right to protect their child, and I support that. Equally, if you don't feel good about your child wearing a mask, you should have that right, and I also support that. Stop making this issue so divisive. Currently, the CDC only recommends masks. We need to continue to wash our hands. Don't cough or sneeze on someone. Stay at home if you're not feeling good. Respect those who don't have the same views or ideas as you. I believe in respecting parents' rights, no matter what their point of view is regarding this issue. We need to find middle ground, compromise, respect for each other, and show some common decency for each other. No matter what side of this debate you are passionate on, please continue to pray that we are making the right decisions for all of Ottawa County. Thank you, Mr. Chairman.
Thank you. Anyone else?
Mr. Chair, I have one too. I'd like to read.
Please.
Oh,
But go ahead.
oh, thank you. I appreciate your. Over the last few days, I have received over 700 emails. I want to thank everyone who reached out to me. I read them all, but I did not respond. Every issue has two sides, and the communications I received were split about half and half. Half were for masks and half were against masks. There are many different opinions on this issue, but threatening a health department employee crosses the line. This is a difficult call, but it wasn't my call. I didn't have the chance to vote for or against it. The health department made that call, and they have the right to do this under the Michigan Health Code. A resolution would not help because the health department does not need to listen to us when there's a situation involving a pandemic. This situation affects my family as well. I have 9 grandchildren who are all in school too. I would encourage you to try to stay healthy, wash your hands, get plenty of rest, take your vitamins, and get the vaccine so you don't spread the illness to others. We will be watching the numbers, and as they drop, we'll be able to get rid of the mask. Again, I thank you for reaching out, and I appreciate your thoughts and prayers.
Anyone else?
You know, Mr. Chairman, I don't have a written statement. On the day of 9/11, it was my first week as high school principal. Prior to that, I was a middle school principal. Every day, I had two objections from my students: provide a quality education and keep them safe. Every day, every night, that's what kept me up. We have our health department who are in the arena right now with blood and mud and tears and sweat for trying to keep all of our citizens and all of our students safe. And I applaud them. It's not an easy place to be at. It's not an easy task. There have been many missteps in this whole process, from the federal government down to the state government, down to even, possibly our local level. True, we have no say-so in this process, but the people who do are making the best decision they can with the information they have. As a matter of fact, I believe that the past month that our state legislators attempted to take that power even away from the DHSS under House Bill 4049, passed by the State House, passed by the State Senate, vetoed by the governor. If we're going to be mad at anyone, be mad at the governor, the people who have the authority to change this. If you want the county commissioners to have that power and authority, the law needs to be changed. But I, for one, will rely on the professionals.
Mr. Chairman,
Yep.
I would also like to just address on some of the emails and comments that have been coming in, and humanity, okay? Just humanity. I guess I'm going to use that as a word. We have a far right and we have a far left, and neither side is ever going to agree. And you know what? We're also America, and it's the greatest country in the earth, on this earth, but it's made up of opposing views, both sides. And in order for us to win and to beat this virus, we need all to come together. We don't need to fight each other. We need to come together. There are freedoms that are compromised. There are lots of views. We are not, in some of the emails I got, this is not Nazi Germany. You have no idea, unless you've read history books and you studied it, what those people went through. This is not that. This is the United States of America. Okay? And people, everyone that's on this board up here, everyone in the health department, everyone in the county, the ultimate goal, what they want is what's best for everybody. I get that. But we don't all have to agree on how we get there, because getting to that map or getting to that spot on the map there's many routes that get there. But the one thing we have to work on is humanity amongst each other. And people need to learn to be respectful to others, everybody. And that's all. I thank you for my time.
Anyone else? I just want to add a couple of things. First of all, next week, if you recall last year, when we had our first meeting of the year, we talked about setting up a rules committee to once a year look at our rules. And if you have any suggestions on rule changes or additional rules, please send those to myself or to John Shea between now and then. I think it's next week, Monday or Tuesday. I don't remember which day it is, but anyway. And then the last thing I'd like to say is that I met with many of you in this past few days, this weekend. I met with many of you, and I called each and every one of you individually. And I want to just express my gratitude for your support today and in the past few days. It's not been easy. We've all had these phone calls and threats. And like I stated at the beginning, I had this statement that was broadcast that supposedly I made that isn't true, but just respect for each and every one of you, because I thank you for just making my job easier. And so thank you. With that, I will open it up for public comment. We will take you in order that we have you on the list. We ask you to come forward to the microphone. Be sure to speak into the microphone. We give you 2 minutes. Please state your name and address and keep it civil, please.
I promise.
Thank you.
Well, my name is Linda Young and my address is 7816 Emberley Drive in Jenison. I'm here because I promised my grandchildren that I would stand up and fight for them. And that's what I'm doing here today. We're going to hear from many passionate people today, and I'm thankful for each and every one of them. I'm here to demand that the healthcare orders of August 6th regarding quarantines and August 20 requiring masks for case 6 to be rescinded. The quote unquote experts are telling us to follow the science and then ignore it. Children at low risk for either contracting COVID-19 or spreading it, despite all of the scary stories, what we need now is common sense policies. It's not common sense to have mandatory masking even outside of the playground. Although the risk of infection is virtually non-existent, especially for young children. Ask yourself, how can breathing their own CO2 instead of fresh air be healthy? Human beings were meant to be social creatures. That's how we're built. The impact of forced isolation and forced masks are impinging on the development of our children. How are young children supposed to learn the consonants and vowels without seeing their teachers' mouths enunciating all of the words? How do you expect children to determine what the facial cues of people with their emotions and the directives from their teachers? How are they to build friendships when they can't even recognize each other's faces? I'm sure you've heard of our bodies, our choice. This mantra is that others use to protect their right to
Thank you,
to
Linda.
protect their right.
Thank you,
Just
Linda.
one more little, I promise. My suggestion that each and every one of you read your history books, read your Bibles, do not be on the wrong side of history, and because you will stand in judgment for harming our children.
Thank you, Linda.
I pray that God will stir your hearts and you will unmask our children. And to the parents and grandparents, concerned
Linda,
citizens,
thank you,
stand
Linda.
down.
Kathy
Call the
Pearson.
next person.
My name is Kathy Pearson. I live at 1481 Sunflower Way in Hudsonville. That's Georgetown Township. And thank you, commissioners, for being here today. Appreciate your work in our communities, the communities of Ottawa County. But today I am here on behalf of my grandson, Austin. And he is medically unable to wear a mask, and yet he's being forced to wear a mask because his parents could not get an exemption for him. And he was born as a preemie triplet. He and his siblings came into the world 12 weeks early. He suffered 2 brain bleeds the day after birth, with subsequent hydrocephalus, needing a shunt in his brain. He has cerebral palsy as a result, and he is autistic. He has a variety of other problems, and he overheats very quickly. He needs the assistance sometimes to walk. This is a picture of my husband, his grandpa, helping him walk. And I don't say all of this to make you feel sorry for him, because he does not need your pity. He needs your help. He needs your help right now. He needs a medical exemption. And I understand that Ottawa County Health Department is not allowing any medical exemptions for kids like this. And I don't understand that. He just cannot wear a mask all day long. So I need your help. I'm reaching out to you to ask, to beg for an appeal for at least that part of this mask mandate. Our kids need to be, and I agree with what Linda said, they need to see each other's faces. They need to know that their teacher is seeing them. We just can't go on like this. We need your help. Austin knows and loves the Lord. He has God's help in his life. He is a young man growing into a young man that
Thanks, Kathy. But please have a seat. Don't leave until you're asked to leave, okay?
Okay, just want to say that I'm praying for all of you. I told Austin that I would fight for him. If I don't, who will?
Okay. Next.
Anima.
My name is Tara Anima, and I'm a registered nurse. I am a mother, and I am a concerned citizen. I stand here today to urge you to demand that the health department rescind the mask order. I would like to argue that masks are effective for the protection of these children. Then you must acknowledge one thing: masks do not work if they're not worn correctly. I am a registered nurse, and I have taken care of asymptomatic patients and extremely ill patients with COVID in the emergency department and various other areas of the hospital. And as a provider, we were educated specifically on how to put masks on and off correctly in order to not infect ourselves with COVID-19. Wearing a mask for protection must be done correctly, otherwise it will not meet the intended goal of protection. It is a foolish notion to believe that children could possibly be capable of wearing a mask correctly all day long in a school setting. Ask any elementary school teacher and they could tell you stories of in the way children wear masks. They whip them around like they're toys. They fall on the ground. They step on them, and then they proceed to put them back on their face. This is not protection, and this is not effective. It is a false hope to believe that these masks can provide protection. There are so many negative impacts of mask wearing, from emotional and mental negative impacts. Everyone in this room has seen the reports of emotional and mental devastation that has occurred in the last 14 months. Mental illness and suicide are at an all-time high for our young people. I am here today to boldly request that this board demand that the health department rescind the mask order, return the control back to the elected school board members. We, the people of this county, are holding you accountable for the decisions that are being made against our will. Orders are being set in place regarding the health and well-being of our children by people we didn't even vote into office. But you, we are trusting you. We voted you in for you to work for us and expecting you to stand with us and protect our children.
Who's next?
This order puts children at risk for mental and physical, emotional damage. And I implore you, do not hide behind the health department. You have the power to protect our children.
Go ahead.
Good afternoon. My name's, excuse me, Rivka Hodgkinson. And I'm an Ottawa County resident and mom of 4 beautiful children. And I am so appreciative that we have masks protecting our kids in school. We are all in this together, whether we like that or not some days. And we all breathe the same air, and we all have to help each other through this process. And I know there's been a lot of debate whether you have the authority or can or should have the authority to deal with the mask mandate itself. So I'm actually not here to inundate you with more statistics and information, but to suggest that we really listen to some of the objections that are being made by those who are against masks in ways that we can help. We can provide extra resources in school for mental health. We can provide extra aids in classrooms, especially young classrooms, to help with proper masking and sanitizing. We can provide public health education, just like we have for every other thing from seatbelts to car seats to anti-smoking, about the importance of wearing masks and how to do it correctly. We can provide training for teachers about how to communicate more effectively with their eyes, their hands, and other tools they have, just like we have for students who are blind or who have other limitations. We can address additional administrative resources here to help people who do have legitimate medical restrictions navigate the system so that they can get those exemptions for their children when it is necessary. And maybe even have aides available in the classroom to help those children be able to still distance or have other mitigation measures. So there are many, many, many things that we can do that Ottawa County Board does have control over that are within the purview of your budgetary priorities and applying grant money to help protect all of our kids. Thank you.
Thank you. Who's next?
Rodea.
Okay.
That's the next group of people.
Oh, yeah.
Is she here? Okay. All right. You want to take those individuals out and then bring the next 5 or 6 in? Or 7 or 8?
Mr. Chairman, maybe we should address again the 3 minutes and then it's go whatever the time, 2 or 3, and it's cut off at that point, 2 minutes, okay? Just say it one more time.
Yep.
No more praise.
There's that loud kid in here. I can shut him up.
Okay, who's next?
Sylvia Rodea.
Okay, Sylvia, and whoever's after that, I'm going to give you a reminder. You have 2 minutes. I'm going to cut you off at 2 minutes, okay? And you need to go sit down and wait to be exited until you all can go out at the same time, okay? Thank you.
My name is Ray Moss. I reside at 6925 Pinestead Court in Allendale. I want to start out by saying thank you to the thousands of Ottawa County citizens who came here to support freedom. But I don't want to end my thanks there. I'd like to say thank you for reminding us all how valuable our freedom is. I'd like to say thank you to the commissioners for reminding us what petty tyrants look like. I'd like to say thank you to the commissioners for reminding us what it looks like to have freedom taken away. I'd like to say thank you for giving thousands of people the motivation they needed to sign up for Ottawa Impact in the past 72 hours. So thank you. Thank you for giving us a chance to practice what we preach. We're told to love our enemy. And a hallmark of love is long suffering. And we will, for as long as it takes to dethrone you, the petty tyrants of Ottawa County, who are repeating the same history that the American experiment has been going since the beginning of time when Jesus created us. So thank you for reminding us all how precious our freedom is and for exposing who you really are. And thank you to the many thousands who have signed up for Ottawa Impact at ottawaimpact.com.
Thanks. Who's next?
Sylvia Rodea. Oh, okay. Allison Miedema.
Hi, my name is Allison Miedema. I live at 2208 Winnan Street, Northwest in Grand Rapids. I am a Christ follower, a wife, a mom, and up until yesterday, an employed teacher. Yesterday, I made a very hard decision to leave a job I love. There's currently no freedom here in Ottawa County being given to honor deep-rooted spiritual convictions in regards to wearing a mask. It saddens and grieves me that I had to step away because it violates my conscience. As a teacher, I'm a mandated child abuse reporter. For me personally, a mandate on kids to put a mask on their face is child abuse. Child abuse covers physical abuse, mental and emotional abuse, neglect, and sexual abuse. I cannot, in good conscience, work in an environment that does not allow the freedom to choose. I feel strongly that now is the time here in America to stand up for personal freedoms while we still have them. In my heart and mind, I believe we're on a course that's putting more and more power in the government when our founders took the time to give the power to the people with limits on the government. If we are allowed freedoms as individuals, our nation actually experiences more freedom, prosperity, and honestly, the ability to enjoy the life God has given to each of us. I'm asking each of you to please help do what you can to restore these freedoms of choice. Thank you for listening.
Thanks, Allison. Who's
Tammy
next?
Clark.
My name is Tammy Clark, 6718 Juneview Drive. I brought a container of Lysol wipes with me today because I'm trying to prove my point. As an occupational and environmental health, safety, and compliance professional, it is those in my career field that train doctors, nurses, and healthcare workers on how to properly don and doff their masks, how to properly implement PPE. Not one person who was wearing a mask who came up here and took their mask off and put it on this podium sanitized. So I'm going to do that right now because this is a very unsanitary podium because not one person has been properly trained on how to wear a mask. And had the doctors or healthcare workers who came up here understood the proper way to utilize PPE, they would not have done so. It is those in my profession who sit on pandemic preparedness boards, emergency response boards. It is those in my profession who train doctors and healthcare workers on how to properly don and doff their PPE, on work rest cycles, on storage, use, limitations, and training. We do not ever, in a time of a pandemic, mask a mass population, ever. But during COVID-19, those in my profession of industrial hygiene, environmental, and occupational safety and health were not consulted. We abandoned the typical multidisciplinary approach to pandemic response. And in favor of a multidisciplinary approach with those like me who helped to write pandemic response plans and emergency response plans with government officials, we listened to two doctors, Dr. Fauci and Dr. Birx, neither of whom are credentialed to speak on respiratory or infectious disease control. You see, doctors treat and doctors heal. Those in my career fields protect. Even environmental health and safety professionals work with epidemiologists, virologists, infectious disease specialists. Those people understand how viruses work. We understand how to protect the community from viruses.
Kristen Megan.
Thank you.
I will provide my address in writing, not verbally due to security risks. My name is Kristen Megan Kelly. I spent 9 years on active duty in the United States Air Force working in bioenvironmental engineering. I am a senior industrial hygienist. I've been in this career field for 19 years. 12 of it was pandemic preparedness, planning and response, and managing the entire decontamination site in the city of Chicago. Masks don't work. That's the science. Masks do not work because they do not fit tight on your face. And any mechanistic study, any op-ed, any opinion piece are all co-founded. I have been against the CDC in court. I've been crossed by the CDC. They had no science to present. Do you know what they're using as their science? A hair salon study. Well, I too have observation studies from Florida and from other industrial hygienists around this country who've actually conducted baseline surveys. What does that mean to you? Okay, I understand. You're hearing from the experts, but are you trained to understand who the experts are? Because it's not a doctor, it's not a nurse. No disrespect to their profession, we work with them. I have to make sure they work safely, and I would never put a healthcare worker even in an N95 respirator. I've managed the respiratory protection program for over 76,000 people. That's a lot for an industrial hygienist. In the city of Chicago, when I worked in a VA hospital, not one person did I put in an N95 respirator that could work around infectious disease patients. They were powered air purifying respirators and controlled air purifying respirators. And do you want to know why? Because I could have gone to jail for putting them in the wrong level of protection. Where are our engineering controls? Where are the systems that can kill, like I-wave air, installing a device in our schools that kills viruses, mold, and bacteria? Why are we not doing that? Because in my profession, if I don't follow that hierarchy of controls and I just throw people in a mask or respirator, I get fined by OSHA. So how can our government do it? And you say you can't do anything to put a resolution together like Allegan County is? As a veteran, I uphold my oath, and I will hold you all accountable in an administrative setting. Do your job and actually consult the experts, and I will send you all emails and give you the science because it's a lot. But please understand, for the person earlier that said children are handing this in stride,
Thanks,
why are they
Kristen.
killing themselves at 9 years old?
Thank you, Kristen.
Michelle Grzybowski?
Will you put that, that timer closer to your microphone so I can hear it too?
Sure.
Do you have a way to put it closer to the microphone? That would be good. Thanks.
May I start?
Yes.
My name's Michelle Grzybowski. I'm from Allendale, Michigan. I'm a mama to 9, none of which have been in the school system, and Lord willing, never will. But I have grandkids in the school system, and that's one reason why I'm here today, to fight with them. They do have health issues that were developed over the last year because of all that's going on. So I'm here to fight for them. And 2, I feel like I'm on a call here. 1, from the a mandate from the Lord. I do want to point out one fact. We were sharing information from here on Florida and Indiana stats, but I just wanted to point out on the Ottawa County website that there have been 0 deaths in children under 20, and 2 deaths of all people under 40. There are 152 active cases in a population of nearly 300,000 people. Only 4 are in the hospital right now. I wanted to go ahead and read a scripture. O Lord God, our God of fathers, are you not God in heaven, and do you not rule over all the kingdoms of the nations? And in your hand is there not power and might, so that no one is able to withstand you? If disaster comes upon us, sword, judgment, pestilence, famine, we will stand before this temple and in your presence and cry out to you in our affliction, and you will hear and save. And I call on the name of the Father, in the name of Jesus Christ, his Son, and I ask you to rescue your people from this demonic agenda. I ask you to rescue the children from this tyranny, Lord. I ask you to bring your kingdom to this earth. I thank you, Lord, in Jesus' name. Amen.
Thanks, Michelle.
Rachel Atwood. Then Melissa Meist.
I'm Rachel Atwood from Jenison, Michigan. This is my son, Timmy. Nothing in life is one size fits all, and I highly doubt that any of you would fit in my shoes or desire to wear them for that matter. Some medications, generally regarded as safe like penicillin, are deadly to some, like my mother-in-law. No medical treatment or device is appropriate for every individual, and a mandate assuming as such is created by those who are either completely indoctrinated or maliciously seeking power at the expense of others. Masks are not one size fits all for kids. My son Timmy has autism, speech delays, a sensory processing disorder, developmental delays, and the cutest little smile you have ever seen. When he was younger, we didn't know if he was hearing impaired or just ignoring us, and unfortunately that doesn't change for many parents, even if you don't have a disabled child. We couldn't even have his hearing checked successfully without him being put under full anesthesia in the hospital. My child cannot and should not mask for so many reasons, and yet my own original primary care physician, knowing all these things, would not give me a medical exemption for my son for fear of being targeted by the health department. Vaccines are not one size fits all. We watched my son suffer a severe adverse reaction firsthand to the varicella vaccine, and it was terrifying. After much investigation on my part, we came to find out that myself and my husband both have the MTHFR genetic mutation that we both passed on to our kids. And yes, MTHFR does look like a certain expletive phrase with the vowels removed. People with this genetic mutation lack the ability to detox vaccine ingredients such as aluminum, polysorbate 80, and formaldehyde. We're prone to adverse reactions or death from these shots. And unfortunately, most people don't know they have this mutation until they personally experience injury. Vaccine injury isn't rare, it's just rarely reported. And when we speak about it, we get silenced, censored, or in my case, Facebook jail. I'll be looking forward to serving my next sentence after today, I'm sure. What world are we living in where we need a waiver or a permission slip to breathe or say no to an experimental gene therapy with no liability if we are injured or die? My children and I are medically exempt, religiously exempt, and constitutionally exempt from every mandate. Please act to oppose these mandates. We do not want unelected bureaucrats running our lives, or in your case, elected ones. Please join OttawaImpact.com and the Education PAC. The only thing in life that is one size fits all is the gospel of Jesus Christ. Amen.
Melissa Meist.
Melissa Meisty from Zeeland, Michigan. I am a parent of 2 boys, 3rd and 5th graders, and I am a licensed physical therapist. Nutrition, exercise, water, sunshine, temperance, abstaining from drugs and alcohol, fresh air, sleep, and trusting God. The New Start principles of health is what I believe in. And as a parent, I am the one who is responsible for the health of my children, not the health department. The health department is focused on disease prevention. Oh, and if I want to get a bunch of free condoms. Science is math. I would have not graduated from my program if I had used any of the statistics that were provided today by the Ottawa County Health Department. Based on their numbers, there is 0.1 out of 100,000 people, the rates for kids, which we have not 100, we don't have 300,000 kids in our county, meaning we have a third of a kid in the hospital. They report that there's been 335 unfortunate deaths for kids under 18 in the United States from COVID. Do you know what that statistic is? 0.0000001% chance. My kids have a greater chance of dying from the flu than they do from COVID. And I did email some of those numbers as well. As a parent, my kids probably shouldn't be driven to school because they have a greater chance of dying in the car than they do from COVID. You know, I as an adult am at much greater risk of being infected or being sick from COVID than my kids are. They're healthy, they're active, there's all these things. And yet I as an adult have the right to vaccinate or not. I have the right to wear a mask or not. Their rights are being taken away from them, and that's the part that's killing me. We're attacking the youngest among us and the ones that have the least amount of choice or voice. You know, the 5th commandment says, honor thy father and thy mother. And it is my God-given right to parent my kids.
Thanks, Melissa.
Rachel Nephew.
My name is Rachel from Holland, Michigan. Lisa, the health department representative, asked us to respect her conscience. What about the conscience of the thousands upon thousands of parents in Ottawa County sending their kids to school in masks, knowing that it isn't healthy for them, both physically and psychologically? You are not respecting our conscience. You continue to show me studies that my kids are just fine wearing a mask 5 days a week for 7 hours a day. But I see my kids every day and your studies are wrong. My kids are stressed about wearing masks. They feel sick when they have to wear a mask and are overall melancholy when they have to wear a mask. Health, by definition, is the state of complete physical, mental, and social well-being, not merely the absence of disease and infirmity. Is the Ottawa County Health Department concerned about the overall health of our kids? By definition, I would argue no. Our kids are more isolated and depressed than ever. The thing that makes God loving and caring is that he gives us a choice, the right to choose. It is my God-given right to choose how to best care for the health of my kids. Every parent here knows best for their unique child, not the government. When COVID first started, it was 2 weeks to flatten the curve. Then it was kids had to wear masks to school to protect their parents and caregivers until the vaccine was available. Now the vaccine is available. Now K through 6 has to wear a mask until 60 days after the vaccine is available. This is not temporary if we don't stop it. I am asking you to please make it stop. For those of you pushing for the government to mandate masks, taking away our right to choose, history shows that eventually the government is going to mandate something that you don't believe in, and you will not have the right to choose. Thank you.
Thanks, Rachel. Who's next?
Treemstra.
Valerie Treemstra. I live in Hudsonville. When we have a PPE expert in our midst, like Tammy Clark, who knows that masks are ineffective against the spread of the COVID virus, why would we ignore her recommendations, her truth, and force our children to wear masks? When the survival rate from COVID for children ages 0 to 14 is 99.9998%, why would we force our children to wear masks? You must never be fearful about what you are doing when it is right. A quote from Rosa Parks. She fought against a different kind of injustice. We as parents and grandparents are doing the right thing, being here to fight the injustice of forced mask mandates. Our voices must be heard. Thank you.
Thanks, Valerie.
Angela Lorith.
Hello, my name is Angela Loreth, and I live in Allendale, Michigan. I've been attending these meetings since May, either on Zoom or in person, and I have to say I'm extremely disappointed in our elected officials. You are not listening to the people of Ottawa County. I have an issue with one of the commissioners lying to the people of Ottawa County on record and has said 70% of his emails are from people begging for the mask mandates. And then that same commissioner is reaching out and asking people, and I quote, "Please consider asking friends and family to email and support. We are being inundated by the anti-mask folks." Anti-mask folks. That's how you talk about your constituents? How about referring to us as concerned parents? Parents that are done complying with these ludicrous mandates. Masks do not work. We know, and the CDC has confirmed that the flu is more of a health danger to healthy kids than COVID. The data is extremely clear that masking is unnecessary for children. It is child abuse. It is about compliance and control. The same commissioner that I just talked about also stated, sometimes the government needs to make the decisions for you, and that is what we're doing. That statement should scare all of you. It scares me. We do not need the government telling us what is best for our children. Parents have that right. God gave us that right as their parents to make those decisions for our children, and we will not have them taken away. It is time for you, our elected county commissioners, to take action. Your hands are not tied. You can demand that the administrator rescind the health orders that were just put in place. You can fire the health department, the directors of the health department. That is within your legal authority. If you do not act, the people will be forced to remove you.
Krista Yetzke.
Oh, is it already? Okay. Is Krista here?
She's in the next group.
Oh, outside? Okay, all right. So Regina, you're gonna get the next group in, okay?
You are crushed. You will be recalled. We will recall you.
You want me to call the next one?
Yes.
Krista Yetzke.
Krista. And please have a seat. Don't leave afterward, okay?
Krista Yetzke from Allendale. Senator Victory told me that when it comes to mask mandates or vaccine passports, he has never and will never support something of that nature. He co-sponsored a bill package that would prohibit MDHHS from creating such mandates. Along with our state reps, He wrote a letter on August 17 to Lisa Stefanowski of our health department. It read in part, "The role of any government agency should be minimized to the greatest extent in exchange for allowing families to make the best decisions for their school-aged children. We are urging you to resist," this is still his letter, "we are urging you to resist instituting any mandates from your office. We ask instead that you leave the decisions that need to be made with local school officials in consultation with parents in those districts and your department. As legislatures, we have focused on getting decision-making at the level that is closest to the people, and we ask you to do the same philosophy as it relates to the education of the kids. Excuse me. Thank you." These elected officials are listening to we parents, but most of you are not. By allowing these mandates, you are not representing the people who elected you. Masking a child is child abuse. It is within your legal authority to put an end to it by rescinding the orders or firing those who are behind it. Please do so. Thank you.
Thanks, Krista. Who's next?
Angie Yetzke.
Angie?
I'm Angie Yetzke from Jenison. Thomas Jefferson said, "There is no justification for taking away individuals' freedoms in the guise of public safety." This is not an issue of compassion or morality, as stated by the first gentleman you heard from today. Masks are ineffective and the health department's science is selective. On July 19, the MDHHS posted on their website that Michigan is experiencing an increase in Legionnaire's disease, a respiratory infection with symptoms that include fever, cough, and pneumonia. The increase in cases since 2020 is 569%. It was strange to me the article did not question what might have changed in our breathing during this last year and a half. On June 30, the Journal of the American Medical Association published a peer-reviewed article stating masked children were breathing in 6 times higher the legal limit of carbon dioxide during a 3-minute period. Children wear masks in school for a mean of 270 minutes. On July 16, this peer-reviewed study was retracted. The author of the study, researcher of virology, stands by his research. On June 16, 6 parents in Gainesville, Florida, submitted their children's masks to a lab for analysis. The report found 5 masks were contaminated with bacteria, parasites, and fungi, including 3 with pathogenic and pneumonia-causing bacteria. Not surprising, no viruses were detected on the mask, although their test is capable of detecting viruses. And now here in Ottawa County, parents of children with breathing issues are begging their pediatricians for medical mask exemptions, and these pediatricians are refusing because their medical licenses have been threatened. Children have a 99.997% recovery rate from COVID-19. How can the CDC and health department only listen to those who agree? How can they be censoring the doctors and virologists who dare question? Masks do not work, they're harmful. I will not co-parent with the government.
Angie Bronkema.
Good afternoon.
My name is Angie Bronkema, and our family has 3 kiddos in the Jenison Public School System. I currently work at Pinewood Elementary School as a kitchen aide. I have worked with Jim Hopler at the Georgetown Township Hall, and I know he is a man of integrity and he loves his community. I am asking him and his fellow commissioners to fight for our children, to have a voice for freedom, a freedom to have a choice in what goes on in our kids' faces each day, a freedom to choose a mask or not. Please let it be a choice given back to families. Let the children see their friends' smiles in class and hear their teachers' unmuffled words when they speak. Please use your position to help our kiddos. Thank you for your time, and God bless Registered Voter Precinct 4, District 7. Thank you.
Thanks, Angie.
Janice Walters.
Hello, my name is Jonas Walters and I live in Jenison.
To the Ottawa County Commissioners and Health Department officials who are currently enjoying the option of working from home or in these offices in the comfort of the air conditioning and assuming mask-free as well, I would like you to spend a week in any elementary school that is not air conditioned inside a classroom with your computer and work for 7 hours there each day in a mask for the whole week. After that, perhaps you can take a vote once you have observed the children and been in the physical environment, whether or not you think that this is the best interest of their health, both physically and mentally. Keep in mind that every time that you touch your mask, you should take it off and put on a new one because that makes it contaminated. I would suggest you bring a large box of masks for yourself. I would also like you to take notes and keep track of how many times kids' masks become contaminated because of this while assessing whether this repetitive and overreaching mandate is justified. You can also keep track of how many times a teacher has to address mask wearing instead of teaching our children. The burden of proof falls on you to show present number of serious cases of children, hospitalizations, and deaths to justify these hasty actions, which to the community are seen as force. I'm sure the health department would advise us to look to Florida and these southern states where they say these cases are rising. However, ironically enough, my 7-year-old daughter attended 4 weeks of summer school this year, Monday through Thursday, without a mask at school, without a mask on the bus. She also attended vacation Bible school. My 18-year-old son was a camp counselor. Those kids were with a slew of other kids in chapel, in cabins. My daughter was in swim class, on the swim team. Masks were not required this summer, and we did not see an elevation of cases. This has to stop. We demand mask choice, and for your future reference as to our children, we also demand vaccine choice.
Alyssa Lubbers. Hello all, I'm Alyssa Lubbers. I'm from Zealand. I'm exhausted, frustrated, and tired, but I will not give up the fight to have choice for my kids. I'm a mom of 3 boys. The fact that the health department is targeting pre-K through 6th grade children when they are least vulnerable doesn't make sense to me. Mask should be a parent's choice, just like childhood vaccinations, as well as bringing them to the doctor when they don't feel well. The government has never controlled these decisions for me in the past, so why should they start now? This virus will have different variants every year, just like the flu has different strains. Enough is enough. Whether you are for or against the recent mask mandate, we all have to agree on one thing. Our governor should be working with our legislator to make her decisions, just like our health department should be working with you all to make their decisions. I am asking you, who we the people voted in, to put pressure on the health department to reconsider their mask mandate order and leave it to us parents to decide what is best for our children. Thank you.
Thanks, Melissa.
Casey Prinz.
Hi, ready? My name is Casey and I live in Holland. Let me just start by saying we keep hearing that we need to respect each other regardless of where we stand on masks. And I, for one, do, very much so. If someone chooses to wear a mask, by all means, I hope they wear it. I just ask for the same respect in return if I choose not to. We are not against masks. We are against mask mandates. You know, I don't even really know what to say anymore. It feels like our voices are not being heard, and any effort we put in falls on deaf ears. Have you seen all the people out here and in the overflow room? We are here to tell you that we do not co-parent with the government, period. We are facing an onslaught of attack on parental rights. This is a form of persecution, make no mistake. But what we need to understand is that God uses difficulty and opposition to wake us up. We have been too comfortable for too long. As a believer, I am called to obey God as the ultimate authority. And according to his word, parents are the ones who are called to raise their children. We are called to protect them. We make the decisions that we believe are best for them. No one else, not the government, not the health department, but we the parents. We won't stop fighting. We'll keep standing up. We keep showing up. This is not a battle against flesh and blood. This is a battle between good and evil. My word of encouragement for everyone listening today is this. The word of God tells us that in this world we will have trouble, but take heart because he has overcome the world. We need to pray like our lives depend on it, like our children's lives depend on it, because they do. And sometimes when I don't even know how to pray anymore, I just start singing. So if I may, I invite anyone who would like to stand up with me to sing the chorus of God Bless America for the remaining of my time. God bless America, land that I love, beside her.
Thanks, Casey. Who's next?
Vanderveen, Barb Vanderveen.
Okay.
Hi,
Hi, Barb.
I live in Allendale. I think most of you know me. How many of you know what Michigan School Code 380.1307B says? Any restraint that negatively impacts the breathing and is a problem even during an emergency is not legal. So just think about that as you allow our health department to do what they have just done. I'm here as a Nana Bear because you have done something that affects a lot of my grandkids. And it's not about the masks. I've heard a lot of comments. Everybody can have their own opinions about the masks. But for me, it's about our freedoms. And you are trampling, you are allowing the health department to trample all over our freedoms. And if we don't stand up, what's the next thing that a health department or the commissioners or the township board, I'm a local township board member, we have to be so careful that government stays in its place. And I feel like the health department in Ottawa County has stepped way over the line and taken away the rights of all of our parents and nanas to decide what's best for our kids, to exercise our God-given rights to use a mask or to not use a mask, depending on what you personally decide together with your husband for your children. Thank you. I appreciate you all. I pray for you. I apologize for those that have been extremely rude to you, but you have to understand this is a very, 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 as you can see by the people that are here today, a very important issue to a lot of us in Ottawa County. And I implore you to deal with the health county and ask them to rescind this. We're serious. I hope it doesn't come to lawsuits. And that's not a threat. It's just that our rights cannot be trampled on. Thank you.
Thanks, Barb. Who's next?
Ken Lupica.
Hello, my name is Ken Lepaka, live in Hudsonville, Michigan. Thanks for letting me be here today. Kind of hate being here for this kind of stuff, but the good part about this stuff happening, it lets us see firsthand the kind of corruption that's taking place. Today, we see something pass the last minute so we can get a grant from the United States for something we really don't give a hoot about. I'd rather not even see us have discussions about stuff that nobody out here wants to enlarge the health department. Next thing is I guess that, of course, I want masks to be not mandatory. I want it to be an option. If people want it, great. If they don't have to. The people that you put on at the beginning, we had a doctor that talked about it, and she talked about the science of it. And when she talked about the science of it, she said it was peer reviewed. Whenever I've listened to a doctor, had a doctor explain things to me that are peer reviewed, that kind of give an example of what the peer review is, who it consists of, where it was done. We didn't get any of that kind of stuff. I think it's because there really is nothing out there. From everything I read, I just don't see it. Next, we had a gal that talked to us about, boy, it makes her feel good. That's an option for somebody like that. Most people do not feel good wearing it. They're breathing stuff that came off of their face. Talk to people, when you breathe into something all day long, breath is going to stink, and they're forced to take and smell that all darn day. We don't want to smell somebody else's butt, and yet here we are having them, the second dirtiest part of our body, sit there and have to breathe in what they exhale all day. Next, in terms of kids, we already talked about the fidgeting and moving them around. Hell, I've had kids come home that have changed them with their fellow classmates because of the fact that theirs was cooler. Yeah, that's a really good way to take and not spread germs. The next thing is, I've worked and spent most of my time in construction, and they have OSHA rules for silica so that you don't get it inside your lungs. Silica is an awful lot larger than any virus or bacteria that exists out there. And,
Thanks, Ken.
Okay, well, I have one last thing.
Thanks,
this is a
Ken.
God-given right, and
Thanks,
I
Ken.
will be taking my taxes and putting them in escrow until such time
Paul
as we
Kick.
do it right.
Paul?
Hello, my name is Paul Keck. I live in Hudsonville. The order from the health department puts our children's physical, emotional, mental health at risk. These are our children, not the health department. According to the CDC, children 5 to 14 years old have a greater chance of dying from any of the following than from COVID. 50% chance of dying from the flu or pneumonia, 150% greater chance from drowning, 200% greater chance from cardiovascular disease, 250% greater chance than from a homicide, 650% greater chance than from suicide, 850% greater chance from a car accident, 950% greater chance from cancer. I think the priorities of the health department are wrong by a mile. Let's talk about mask efficacy. March 8, 2020, Fauci stated people should not be walking around wearing masks. Masks do not provide the protection people think they do. U.S. Surgeon General Jerome Adams, masks are not effective in preventing the general public from catching coronavirus. New England Journal of Medicine, we know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. CDC, there is no scientific evidence for healthy people wearing masks. According to the study co-authored by Fauci himself, the predominant cause of deaths from the 1918 Spanish flu was not from the flu itself, but from bacterial pneumonia, which was contributed to by wearing masks. A recent report by the AMA stated that in a test of 45 children ages 6 to 17, the parts per million of carbon dioxide inhaled by wearing a mask for only 3 minutes is over 550% higher than when we're not wearing a mask. This is over 6 times higher than what is considered safe. The warning on a cloth mask box, read it yourself. This will not provide any protection against COVID-19 or other viruses or contaminants. Wearing an air loop mask does not produce
Thank you, Paul.
the risk of contracting any disease or infection.
Paul.
Ashton Foreman.
Hello, my name is Ashton Foreman, and I am a teacher in Ottawa County. When my students are on their phones in my classroom, I tell them it's a middle finger to me. Put your phones down and listen to what we have to say. I will start by saying that everyone has picked their sides on this, and no one is moving, no matter what is said today. That being said, please let us be responsible for our own children. I could get doctors up here that literally say the opposite of what your doctors have said. I am my child's parent, not you. How dare you think otherwise? How dare you think you know what is best for my children? You can't possibly know every child and their needs. That's why there are parents. Get off your phone, sir. Oh my goodness. Do you know how hard it is to get a medical exemption? I called 14 doctors dozens of times. All of them said, I'm sorry, ma'am, I cannot get you one. My license will be revoked. You said earlier you were going to follow the legislature, but now that they're not on your side, you're not going to follow them anymore? You said this is not Nazi Germany, but how did that start? By people not standing up. Please modify this. You say you can't, but that can't be true because that's what Allegan County and Barry County and Kent County have done. This was decided by non-elected officials. This is not America. We have heard your lies before and we are not buying it. Do you know how many times you've touched your mask, sir? You've been on the screens over 100 times. That mask is worthless. Thank you.
Sherry Wabecki.
My name is Sherry Wabeck. I'm a resident of Blendon Township. In God we trust. I am not in control either. That is what God taught me in October of 2019 when my 6-year-old suffered a fall that resulted in emergency brain surgery, fractured skull, and a significant brain bleed. But her injuries were not evident right away. I later learned that the doctor on duty in ER nearly sent her home because her symptoms didn't require a CT scan. That doctor simply had a gut feeling to run the scan anyway. In 2020, I pulled my children from the school system to homeschool because I had a gut feeling the masks would do more harm than good. When I later took my 4-year-old to urgent care for an ear infection, I watched as the nurse taking her vitals quickly removed my daughter's mask as we watched her oxygen levels decrease. With the mask off, the nurse instructed my daughter to take a couple deep breaths, allowing her oxygen level to return. She had only been masked about 15 minutes. My gut feeling was right, but the science, that data was never recorded. I don't believe the mask's injuries will be evident immediately. But if the ER doctor had followed the science instead of her gut, my first daughter may have died from her brain bleed. I believe you commissioners have a gut feeling that those masks are hot, uncomfortable, and that they're hard to breathe in, likely doing more harm than good to our health. So I implore you, you direct the health department to remove the mask mandate. Give us back our liberty to make our own decisions for our health and for our families. It is in God that I put my trust, not a mask, not a vaccine, not another human being. I'm here today because you have control over the health department, but God is in control of life and health. And for some of us, in God, we still trust. Thank you.
Thanks, Sherry. Okay, all right. I'm going to.
Scheidema, sorry.
That's me.
Sorry.
Hey, guys, I'm going to have to bend down the whole time because, well, here we are. My name is Jared. I live in Allendale, Michigan. I do not have any kids in school right now because of these mandates. It is not your job to keep my family safe. You cite case law from 1903 that your hands are tied. Governor Whitmer tried the same thing with the 1945 emergency law. That was overruled because the people demanded it. Do you need a recall? Other county commissioners are listening to their constituents. Why won't you? Clearly, there are hundreds and now thousands of people out there that you are not listening and that know that you are not listening to them. You're sitting here allowing the government to co-parent when clearly you can't even govern yourselves. When has the oppressor ever in the history of humankind been on the right side of history? Will you be on the right side of history this time? It doesn't seem like it. When or will you actually ever stand up for the people you represent? We are here to fight for the freedom of choice for the parents to have the choice to parent their children how they see fit. This will not stop until you listen to the people. You are elected. You are required to listen to your constituents. You are not listening, and if you can't, please step aside so someone else will. Your lack of action, the county health department's tyranny does not override our constitutional rights ever, and nor will it ever. To honor tyrants is tyranny against the King of Kings. Remember that with your decision. Half of you are sleeping. I can tell. It's okay. I'll part with this. Leave it to the parents or leave your office. I'm done.
Rachel Gallegos.
My name is Rachel Gallegos. I reside on Thornberry Way in Zeeland, Michigan. I'm a lifelong Ottawa County resident, a local real estate agent, and a mother to 3 elementary-aged children in the Zeeland Public School District. I'm not here today to plead my case with you about whether masks work, don't work, or the data to prove or disprove any of it. I'm here today to remind each and every one of you that you were voted in by the people in this building and that you took an oath to represent them. Not just the people that want masks mandatory for our children and not just the people who want the freedom to choose, but both. You were not voted in to do what you think is best. You were voted in to represent your constituents and advocate for their convictions. 6 weeks ago, I sat in the office of one of my colleagues who also happens to be one of the sitting commissioners. We discussed a recent Holland Sentinel article that quoted myself from a ZPS Board of Education meeting where I was respectfully advocating for parents to have the right to choose whether masking their children was in the best interest of their family. In our discussion, They made a comment to me that they would not feel comfortable if their grandchildren were sent to school without a mask mandate in place because they were concerned that their grandchildren could possibly get COVID and bring it home to their family. As a grandparent, this person is entitled to their fears and opinions regarding the spread of COVID and masks. But as an elected commissioner that I voted for, they should not have the right to disregard the constituents who feel differently and think that masks are not a one-size-fits-all approach for our children. I ask all of you, if your child or grandchild came home every day with severe headaches because of masks, would you feel differently? If they came home showing signs of depression or threatening suicide because of no longer being able to see faces or the lack of facial cues was affecting their social and emotional development, would you feel differently? These things are happening to thousands of your constituents. So although it may not be your experience, we ask that you acknowledge and advocate for the families facing these challenges. I've seen multiple leaked emails this week from different commissioners. Thank you.
Thank you.
Tara Anima.
Oh, he spoke already.
Okay.
Sarah Oberst.
I'm Sarah Oberst. I live in West Olive, Michigan. I have 3 children who are enrolled in the Zeeland Public School System. I'm a Bible-believing freedom fighter. I stand before you today as an advocate for our teachers, our students, our bus drivers, and employees of any district. I implore you to think about what you're doing. You're asking people to forfeit their beliefs, the beliefs that are founded on our nation under God. We have a God-given freedom to choose what is best for our individual. Any mother or parent or grandparent or guardian has the right to choose for their family, not the government, not the school, not the health department. We will not stop. We will not back down. We will fight. You can fight with us or you can be against us. But just remember, in the end, God wins. We are losing teachers, bus drivers, employees. Our kids spend 8 hours a day with these people. Do we really want to lose the people who are closest to them, that are helping them through this? But you're forcing them to make, these teachers to make decisions. And in the end, this is an adult issue. This is not a kid issue, but these kids are the ones that are impacted. And that's not right, nor is it fair. I respect anybody who has opposing beliefs. I may not choose to wear a mask, and I may not choose to have a vaccine, but those who do choose to have a mask and get the vaccine, I love and respect for their decision of whatever makes them feel safe and secure. I expect to be given that same right because that is my God-given freedom. And as those sitting on the board, I implore you to do the same. We should be given the choice to choose, not to be forced to choose. I really don't have much to say other than that. I thank you for your time. I know that everybody is stressed and this isn't an easy situation for anybody. And I really give you credit for the credit where credit is deserved, because nobody's in an easy spot. We're all fighting. We're fighting for our kids because we love them. And I hope that you do the same. Fight for us. Be on our side. Make this right. Give us the choice. Don't choose for us.
Vicky Nice.
I live on Pinecone Court in West Olive.
Give us your name, please.
I'm sorry?
Give us your name also,
Vicky
please.
Nice,
Okay.
N-E-I-S. So I have 4 kids in Zeeland School District, and I love the school district. It's amazing. We have amazing teachers, bus drivers, everybody. And I commend you for wanting to protect our children. You say to protect our children with hand washing, vaccine, masks. That's awesome. But do any of you work for the school district? Any of you? I do. These are the masks that are provided to us on our school buses. I'm a school bus driver. This right here is the box. Specifically on the box, it has directions. In the directions, it says single use only. If you have trouble breathing, get a new mask. Some of these kids that get on my bus have wet masks. Most of them do. They suck on them. They're good for trading because Joey's mask is cuter than Tommy's. They're good for parachuting, testing gravity, see if what you have stays in the mask. They're good for pencil parachutes. They're good for slingshots. They're good for everything, except wearing. According to the WHO and March 2020, masks shouldn't be used for more than 4 hours. Why is that? Because an adult tolerance for a mask for 4 hours, they can't handle it. They start touching the mask, spreading the masks. Kids, what do you think they can last? 10 minutes, maybe? Maybe 10 minutes. This is my youngest son, Connor. He's 9 years old. He's in the 3rd grade. He's 112 pounds and 52 inches tall. He is not an average kid, okay? An average kid is much smaller. He's very husky. However, this is the adult mask that the schools and the buses are providing for our children. These are the masks, adult masks, which it does clearly say adult use only. The average kid that is 3 to 4 years old weighs 30 pounds, maybe 40.
Thanks, Vicki.
Lisa Baumers.
Hello, my name is Lisa Bummers. I'm a wife, mom of 3 boys, 2 of which are at Zeeland schools, and a nurse with experience in an emergency room setting for 23 years. The health department has decided that our kids should go to school all day, every day, muzzled in a mask, like they are carrying some kind of morbid disease. I have listened to their arguments and noticed they are missing some information, like evidence, science, data, common sense, and basic human decency. There have been no facts presented, so here are a few. COVID almost poses 0 risk to our kids at all. 4.2 million children have tested positive for COVID. 0.0008% have died. What about the flu? CDC estimated 480 kids died in 2019, more than those who have died from COVID in the last year and a half. Did anyone then point out or suggest our kids wear a mask? And the flu is more dangerous to our kids than COVID. That's a fact. Do you know what it's called to force a child to wear a mask for fear of a virus? It's called child abuse. Look up the disease, Munchausen syndrome by proxy. That's what that is. Analogy I heard that I think we can understand is, what would you say about a parent that forced their child to wear a helmet every day, all day for fear of falling coconuts and meteors? A kid is almost as likely to die from that rock falling from the sky as COVID. Yet one would say that is abusive for a parent to have their child participate in that insane charade to satisfy his delusional hypochondria. What type of psychological damage are we doing to kids when they have to cover their face, teaching them that the air that they breathe is toxic and everyone around them is sick? Have you thought about what the health effects of children forced to breathe through sweat and spit and dirt-soaked rags and rebreathing their carbon dioxide for 8 hours every day? What about kids learning to read and can't see the teacher's enunciation of the words, or a child needing to see facial expression for social interaction? What does it do to a child's developing immune system if they have to wear a mask all day, every day? Are you satisfied to place this burden on children anyway? And we know it's not safe it's not to keep them safe. They are safe. It's not to keep the adults safe.
Chris Smith.
I don't even know what to say. Honestly, thank you, the 3 of you who voted against this money for the health department. Seriously. I'm just flabbergasted. We're supposed to believe in the science. We're supposed to get this one-sided view of this entire thing based on data that's changed over and over and over and over again. But you expect us to believe it wholeheartedly. We're also expected to believe that 2 to 1, there's been so many calls for masking our children and everything else. Yet, have you seen the number of people that have come through those doors and are sitting in that other room? There are hundreds of people out there. If what you're saying is true, and we should all just buy this hook, line, and sinker, where'd they all come from? Seriously question what's going on here. We expect you to work on our behalf. Our freedoms are being trampled and you don't care? If you don't care, get out of the seats. There's plenty of people here who do.
Thanks, Chris. Who's next?
Marie Karsmeyer.
Hello, Marie Karsmeyer, 7499 Brower Lane, a mother of 5, 2 of which are affected by this mask mandate. I found it interesting that one of the factual findings given on the current mandate was the rising hospitalization rates of American children. The national average is currently 0.41 per 100,000 of the population. For Ottawa County, a population of about 300,000, that would mean we are at risk of 1 child being admitted to the hospital. So on the chance that 1 child could possibly go to the hospital with COVID, and have over a 99.9% chance of surviving, you are going to guarantee that hundreds, if not thousands of kids in Ottawa County will without a doubt continue to suffer physically, mentally, emotionally, and spiritually from masks. You are willing to hinder the learning development of every elementary child and dampen the teaching ability of every elementary teacher in this county for the sake of one child possibly needing hospital care. And by the way, Ottawa hospitals are currently under 50% capacity. I could stand here and cite all the research and studies surrounding masks and the effects on kids, but no matter what data is given to you, if it doesn't come from Lisa in the health department, you don't listen. Yesterday, one of you actually has been quoted as saying, sometimes the government needs to make your decisions for you, and that's what we are doing. That is the most anti-American statement any government official could ever make. Well, that may not be the opinion of every commissioner. It must be the opinion of the majority of you, because otherwise you would not have passed that funding bill earlier. We the people want our freedoms and liberties back for our children. We the people will have our voices heard. We will remember how you voted today. Thank you.
Thanks, Marie.
Jillian Van Solkema.
Do that. You have 2 minutes. Okay.
Yep. Hi, my name is Jill Van Zalkum. I have two boys who attend Allendale Public Schools, and I am an aide for the Young Fives classroom at Allendale Early Childhood Center. My boys and I were so thankful that mask and vaccination status were going to be left to each family to choose what was best for them, as well as all choices were expected to be respected and treated kindly. What a novel concept in these times. When I had to tell my sixth grader that masks were once again going to be required, his first words were, "I want to do online school and I don't want to have to wear a mask again." I know that life does bring with it things we'd rather not do, and we have to learn to adapt, and I know he would adapt to it again, but I don't believe he should have to. COVID hit my house in April, and my husband, 10th grader, and myself all had it. My sixth grader had no symptoms ever, despite the fact that I still cooked meals and hugged him goodnight every day. I'm certain at schools he will have no closer exposure than what he had when he lived with people who had it day and night. As I said, I worked in the Young Fives setting last year, and I can tell you without a doubt that masks on kids at that age only bring more germs to them. Masks are chewed on, worn below the nose, and constantly touched. I'm fairly certain that any protection offered from wearing a cloth mask is gone when that mask is in the student's mouth or constantly touched by dirty hands. Our country was formed by immigrants with many different backgrounds, traditions, etc. That's why America is often called the melting pot. With our different backgrounds, beliefs, and walks of life, we make up one great country. The diversity is part of what makes us great, and this situation is no different. My path is not the same as yours, so our personal choices may not be the same, but we both deserve the right to make those choices. I am asking as a parent and as a school employee that the Ottawa County mask mandate be overturned, and I be given the right to make my own choices. I believe that no one can make a better choice about what is right for my family than my family. I will fully respect people, whether they choose to wear a mask or not, or vaccinate or not. I ask that we all be given the decency to make that choice for ourselves and choose what is best for us.
Thanks, Jill.
Roger Belknap.
Thank you. Grand Haven, wife, kids, a caretaker for my elderly father, cancer survivor.
Your name and address, please.
Roger Belknap, 15325 Cove Street, Grand Haven.
Okay.
Thank you. I'm a dad, husband, caretaker for my elderly father, cancer survivor, had a stem cell transplant. All of that aside, first and foremost, I'm an American, and I believe in our history. I believe in this process. After studying it, my wife and I went through Grand Valley State University. This past week, we had to send our diplomas back in protest for the mandating of vaccine for students. I'm just simply here to say, I believe that forcing vaccines, masks, whatever, mandating it to be a part of the system is an overreach. And is to the extent possible, I will not participate in that. And I just want to say that I'm grateful for all the people and the voices. As nervous as I am, I've never been more proud of the people of Ottawa County. And thank you for your time.
Thanks, Roger.
Mitch Disselcone.
My name is Mitch Disselcone. I live at 2078 Woodlark Drive, Holland, Michigan. I am a precinct delegate in Ottawa County in Park Township. I am a father of 4 and husband of 1. I am speaking in opposition of Ottawa County's current mask mandates as it is discriminatory and violates our religious freedoms by declaring the following. I and my family are followers of Jesus Christ. Our sincerely held religious belief is that our bodies are not our own. Our bodies are a temple of God. 1 Corinthians 6:19 through 20 says, "Don't you realize that your body is the holy temple of the Holy Spirit who lives in you and was given to you by God? You do not belong to yourself, for God bought you at a very high price. So you must honor God with your body." End quote. As for me and my family, our bodies belong to God. Our bodies certainly do not belong to the government. Discrimination against me and my family and forbidding us the right to move freely in society based on our religious beliefs is illegal and unconstitutional. Likewise, it is illegal and unconstitutional to forbid one from engaging freely in society based on race or gender or skin color. Am I correct? Our rights and freedoms are not suspended during crisis, war, declared emergencies, or a pandemic. Therefore, if a mask mandate is not rescinded, we will be submitting religious exemptions to the mask mandate to our schools and our health departments as a courtesy. We will not be submitting them to seek permission or approval.
Thank you, Rich.
Colin Disselcone.
My name is Colin. I am 11 years old. Commissioners, you are not thinking of kids because you are making kids like me wear masks. How would you like to wear a mask 35 or more hours a week? I was going to be an HE squared, but because of you said kids had to wear masks K through 6, my mom and dad now have to choose to homeschool me or move me to a different county because right now I want to go to full-time school. Also, I know some of my friends that are crying because of you. Also, you announced we had to wear the mask less than 1 week before school started. So I gave the parents no time to make plans for the year. Give me and my parents some proof that the masks work. Why do we have to wear masks for over 1.5 years? At the start, they said it would be 2 weeks in the lockdown. But do masks work anyway? Do you even know if the vaccine works? If it does, give me the data. If you don't have any data, tell the kids and parents that you are wrong, that people have a choice. So think about everyone, not just half, but all people, and give them a choice to wear masks or not, just like people have a choice to follow Jesus or not.
Thanks, Colin.
Amy Disselcone.
Hi, I'm Amy Disselcone, and I live in Holland, Michigan. That's one of my 4 kids. I'm a mother of 4, and I have a master's degree of education, specializing in English language learning and language acquisition. I will be speaking from both of those perspectives. Peer-reviewed studies from around the globe have documented that children wearing masks is harmful. They have found developmental delays, not only including cognitive impairment, but language delay.
They've also had reading delays for children, not being able to see facial cues, as well as low oxygen levels and toxic carbon dioxide levels. In essence, masks lead to brain injury. This is child abuse. Is the health department going to take responsibility for all of these damages to the children? Who is going to be found liable for all of the injuries that these masks are producing? Are you? Last year, I homeschooled all 4 of my children due to mask mandates, and I am prepared to do so again. Children should not need a mask waiver to enter a school building. This is discrimination at its finest. In 1954, the Supreme Court interpreted the Equal Protection Clause's requirements in the Brown versus Board of Education, which stated, "We conclude that in the field of public education, the doctrine of separate but equal has no place." You are creating a society of discrimination based on masks. My heart has always been towards fighting for those without a voice. Never in my life did I envision that I would be fighting and advocating for my children to go to school with the right to breathe oxygen. And I have fought, and I will continue to fight this. But here's the thing, you work for us. The government is for the people and by the people. We do not cower in fear. We unite and we fight back harder because we believe in a loving God who fights for his people. He fights for our children because they bear his image, and they will not wear a mask and cover their face as image bearers of the one true God. I will not comply.
Thanks, Amy. Who's next?
Brian Doktev.
Brian?
Christy Lacey.
Hi, I'm Christy Lacey from Zeeland, Michigan. This is Mac. And I am absolutely not for the mask mandate. I'm for giving parents a choice. And I'm going to come at it at a different angle. Mac is 35. He can't medically wear a mask. And that's where I feel a lot of parents are frustrated with these exemptions. And that's what I'm going to come at. The medical exemption. This is his third because he drools. He medically cannot wear a mask. And anyway, I got the Bill of Rights, our First Amendments. Congress shall make no law respecting an establishment of religion or prohibiting the free exercise thereof or abridging the freedom of speech or of press or the right of the people peacefully to assemble and to petition the government for redress of grievances. And I'm asking that you would resend the mandate that you put out on August 20. But I also have the Bible because to me, masking is just point blank evil. It's from the enemy. And my Bible tells me in 2 Kings 17, verse 35, says, "You shall not fear other gods." A mask can be a god. "Nor bow down yourselves to them, nor serve them, nor sacrifice your child's health to them." And so I have to live by a higher calling. And the religious exemption that you will not let anybody have, I don't understand because my God tells me I have those freedoms, and so does my First Amendment rights under the Bill of Rights, the Constitution. So I want to ask you, how do you get away with this?
Thanks, Christy. Who's next?
Jen Rosman.
Jen?
Is there Jenny Shepherd?
No. New group.
Okay.
I want to remind you, you got 2 minutes, and please take your seat back again, okay?
Good afternoon. My name is Jamie Lemieux, 35 Mill Street in Coopersville. I have 6 kids attending Coopersville schools. First, let me be clear. I believe COVID is dangerous, 100%. I had the option and took the choice to get vaccinated. However, unless they have an underlying medical condition, it poses little to no threat to our children. The common flu is a bigger threat to our children than COVID, but we never forced masks on them before now, so why now? When COVID first started, we were all afraid. We wore masks to flatten the curve, and so the hospitals didn't get inundated. Then we kept wearing them to slow the spread. We finally had a hint of our freedom back this summer. My family has traveled to Missouri, Arkansas, and Oklahoma. We've been to amusement parks, pools, hotels, churches, Craig's Cruisers, grocery shopping, clothes shopping, etc. Our house has been a revolving door of friends. None of us have been sick once. How can I tell my children, how can you tell my children that it is safe to go to Craig's Cruisers and touch games and rides and the ninja course or laser tag that hundreds, literally hundreds of strangers have just touched? But school with our friends is too dangerous. 3 of my children are autistic. Imagine being a child who already struggles with social cues, being forced to sit in a room of people wearing masks. Imagine being a child who struggles to make friends and being unable to emotionally reset by seeing your one friend because your classes are cohorted. Imagine needing speech therapy and not only not being able to properly get the services you need because of the teacher's mask, but struggling to talk to your teacher because you are in a mask and she cannot understand what words you're trying to form. Imagine being a child with an oral fixation who chews on everything and having a mask on your face, being told you cannot take that down to chew the necklace you have specifically designed for soothing this. You chew the mask instead. These are the punishments that you are putting on these children to protect them from a virus that has a 0% death rate in Ottawa County.
Thank you.
Stephen Lemieux.
Good afternoon. I have a number here that's got from the CDC. I just converted it into a percentage. The chance of my child dying from COVID. That's an imminent health threat. Not in my book. I put my kids in sports. I drive them to school. I do all these things that could pose some kind of threat to them, but yet we do it because it's life. We got to keep living. I don't see how this is imminent threat. If this wasn't attached to the word COVID, you guys it wouldn't even cross our radar right now. This isn't even a number. Yes, people have died from this. What I want is for my kids to aspire to be not afraid in this world, to stand up and do things and aspire to be someone like a police officer or a Marine who you went to go with. I'm sure those Marines did not think that that was an imminent threat, let alone the freedom of it all. This is our country. This is our freedom. Our kids. This is breaking my family up. It's breaking a lot of people up, relationships over what? It really hurts. My wife has been, I'm sure everybody's blood pressure has gone up a little bit. It's just too much. And I don't want my kids to be afraid of walking outside, seeing their friends. What are we teaching them? What are we showing them? Because that's how they learn, by us, what we show them. I can't say how disappointed I am in Ottawa County. This is where I was born and raised. This has been a huge letdown.
Thanks, Stephen. Who's next?
Sally Cronkright.
Hello, commissioners. This is a really hard thing for all of us to do. As I was walking in, a beautiful little girl says to me, "You're going to do okay." Anyway, I just want you to know I'm number 42 and my friend is 114 and there are a lot more people after her. So it's going to be a very long night tonight. That being said, I have only heard maybe 5 people that are for mask mandates. Everybody else is for freedom. We want our freedom for our children. You are allowing the health department to abuse our kids, and we've had enough. My grandson said to me the other day, "So Grandma, are you telling me if I don't wear a mask, then I'm not going to die?" This is my 7-year-old grandson. We are putting these burdens upon children. And you stand there so stone-faced. I can't even believe it. So I had a big speech to say, but my phone died. And I am just saying you guys are on notice. You are not going to be sitting in those chairs anymore because there are people out there far more qualified. They understand our Constitution, they understand our Bill of Rights, and they understand that it is the people who rule this country, not you.
Gail Roloffs.
Hi, I'm Gail Roloffs. I live at 10146 64th Avenue in Allendale. I'm going to start out with you, the Ottawa County Commissioners work for us, we the people. And when it comes to mask and vaccine mandates for our children or grandchildren, it's the parents' decision, not government's decision. The health department can suggest, but they cannot mandate. Mandates are not laws. I want to ask you, and I would want to ask everyone, Dr. Fauci, whoever, show us the scientific documentation that masks work in preventing COVID. You had a bus driver from Zealand show the masks that are there. If you read on the label, it says, this product is an ear loop mask. This product is not a respirator and will not provide any protection against COVID-19. So there. Have you looked at the psychological and health effects that are in children that are wearing masks? They are depressed, they are confused, and they have health issues. If you ever listen to the mama bears from Iowa, they will let you have it. We need to stop mandating masks and vaccines by government officials now, or we will end up like the people in Australia, where the government has taken their guns and now they are seizing their children and taking them to a quarantine camp at a stadium in Melbourne without their parents' approval, and they're vaccinating them. This is wrong. Get in the game, guys.
Thanks, Gail.
Joel Studebaker.
Hello, Joel Studebaker. I live in Hudsonville. So we pray before this meeting. You guys pray before this meeting in the name of Jesus. I want to read from Ephesians 5. Carefully determine what pleases the Lord. Take no part in the worthless deeds of evil and darkness. Instead, expose them. It is shameful even to talk about the things that ungodly people do in secret, but their evil intentions will be exposed when the light shines on them. For the light makes everything visible. This is why it is said, "Awake, O sleeper. Rise up from the dead, and Christ will give you the light." So be careful how you live. Don't live like fools, but live like those who are wise. Make the most of every opportunity in these evil days. Do not act thoughtlessly, but understand what the Lord wants you to do. Guys, let's peel the layers of the onion back all the way. I have a data analytics background. We are mandating masks. You're wearing one right now. You're wearing a mask for a disease that they can't even isolate. There are Stanford professors, other Ivy League professors, suing the CDC. Does that make the news? Of course not. But you're wearing a mask for a disease that cannot be isolated. You're wearing a mask and asking children to wear a mask for PCR tests. PCR tests that the CDC in the middle of the night a month and a half ago came out with information that said, they don't work. Of course not. The Stanford professor, the Stanford lab, it proved they can't isolate it. They sent them samples from the CDC. What were they all? Influenza A, influenza B. All this is a variant of the flu. Okay, look at the real numbers. The sum of the parts must equal the whole. Okay, how many deaths in 2020 versus how many deaths in 2019? Barely changed. And by the way, the CDC still says they're researching it. They don't actually publish the numbers. So you have to read into that. But it's no different than the change from 14 to 15, 15 to 16, so on. It's a small percentage change, which is, by the way, predicted out to 2034 by the World Health Organization and the United Nations. So there's nothing going on here. It's a fake virus. It's faked by the government. We can conjecture all day why, but we're asking children to wear masks for what reason? Come
Thanks,
on,
Joel.
guys.
Who's next?
Philip Merrill.
My name is Phil Merrill, and I have 3 small children at Allendale Christian. I'll spare you further details about the folly of masking children, but rather mention the cowardly manner in which the health department has issued this order. A last-minute unchecked mandate using politically selected fear-generating data sets that are questionable at best, effectively preventing any legal or political recourse is grounds for discipline. It's my understanding that this board has fiduciary responsibility over the health department, including controlling certain financial ramifications up to and including removal of personnel with a vote of no confidence. With testimony that has been and will be presented today, I respectfully request that this board demand this order to be rescinded immediately. Should the health department deny that demand, I request they be removed through a vote of no confidence. If you think this mandate will end after the vaccine is approved for children, I ask you to remember that 2 weeks to flatten the curve to save our hospitals has quickly turned into, we'll fire all our hospital personnel if they don't get the shot. This leads directly to a demand that everyone take the shot. We will all be required to show our papers to participate in society. Don't believe me? Look at New York City, look at Toronto, look at Melbourne, look at Sydney, look at Paris, look at our own U.S. military, and now look at Spring Lake Township. We hold these truths to be self-evident that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and pursuit of happiness. That to secure these rights, governments are instituted among men, deriving their just powers from the consent of the governed, that whenever any form of government becomes destructive to these ends, it is the right of the people to alter or abolish it, to institute new government, laying its foundation on such principles and organizing its powers in such form as to them shall seem most likely to affect their safety and happiness. Experience hath shown that mankind are more disposed to suffer while evils are sufferable than to right themselves by abolishing the forms to which they are accustomed. That when a long train of abuses and usurpations pursuing invariably the same object evinces a design to reduce them under absolute despotism, it is their right, it is their duty to throw off such government and to provide new guards for their future security. You 11 board members are duty bound to uphold the Constitution of the United States of America by using your power to throw off overreaching mandates in an initial step to preserve the rights of your constituents. This does not end until we decide it ends. Also, police, I say this respectively, I was just doing my job, is not an excuse to participate in
Phil,
tyranny.
you're done.
Gianna Galvin.
Deanna?
My name is Gianna and I live in Hudsonville. I'm 11. I have come to a meeting just so that I can breathe air and not my own carbon waste. My great-grandfather was a Marine. He did not fight and sacrifice his life. Just watch his friends die and comrades fall before his own eyes. He fought for freedom, just for our freedom to breathe, a human need to be taken away. My younger brother has been medically diagnosed with autism, ADHD, sensory processing disorder, and he has an IEP, and he still cannot get a mask exemption because doctors are being threatened their jobs. I've seen a lot of adults come up here, and I am not an adult. I'm a 6th grader, and the moment I walked into school on the first day, I was asked what grade I'm in, then told to wear a mask. We took a school tour and went outside, and as soon as we were allowed to, all the kids ripped off their masks saying freedom and fresh air. The masks have been proven to be ineffective. Today I went to school and it was only a half day, but all day I felt so lightheaded and I was having trouble breathing. Imagine what a full day would be like. According to the Weather Channel, it feels like 98 degrees. My school doesn't have an air conditioning. I and at least 300 other students had to go through 4 hours of school with no air conditioning and wearing masks. I am 11 and I have come here to this podium to speak out on the fact that you need to give us the freedom to breathe fresh air. This is torture, child abuse, and not right.
Thanks, Tina. Who's next?
Baba Skoltety. Skoltety.
ABA? No? Audrey Black?
My name is Audrey Black. I am an Ottawa County resident and taxpayer. First, I'd like to address the issues of law. Yesterday afternoon, I received correspondence on OCHD Council letterhead signed by Douglas Van Essen, which read, "In my opinion, the answer to your question is no. There is no religious exemption to your order." I ask, what legislation gives the local health department dominion over my religious freedoms and my child's right to a free and equal education despite our beliefs? Secondly, I'd like to address bordering counties. Allegan County commissioners boldly took a stance when they stood against the recent mask mandate put into place by their health department. In addition, I received verification from multiple families just last night that 3 different Kent County schools are accepting parent-signed mask exemptions, religious or medical. Why do we have these inconsistencies? If Allegan and Kent County residents are allowed these freedoms as loving parents, why aren't we? Thirdly, testimonies from friends working in local medical field all work for prestigious, well-known hospitals in our area, but have asked that I specifically not tell you which ones for their own protection. As a quick side note, why do they feel like they need protection for speaking their experiences? And why have they been told that they are not allowed to provide these medical exemptions for patients for any reason? NP for 11 years. A mask mandate for children in the school setting is not following the science as claimed. Medical treatments and health public recommendations are supposed to be based on risk versus benefit, which can only be hypothesized after being fully studied with repeated randomized controlled trials with high-level data. There has not been a single study that has looked at randomly assigned classrooms to different masking strategies and measured transmission rates. In addition to this, the severity of a disease should be taken into consideration when making
Audrey.
public orders. It
Thank
has
you,
been well
Audrey.
documented
Thank you,
that
Audrey. You're
influenza
done.
is significantly more deadly to children under the age
Barbara
of 17.
Ruzelek?
Barbara?
Ruzelek? No, Margaret? Oh, sorry.
I'm sorry. Hi, I'm Margaret Roslanek, and I live in Jenison. And I'm going to share a little bit more that Audrey Black had written, since we weren't allowed very much time. But before I do that, I wanted to just take a second here and just smile at all of you, because my late mother said that my smile lights up the room. And I'm a true believer that it's nothing to do with me. It's actually the Holy Spirit living inside of me that allows me to project what I do when I smile. And I want my children that have inherited that from me and been given that gift from God to be able to go to their peers and brighten their day with their smile, for them to be able to see their teachers smile, and the love that you can give and share with just a simple smile. So there's so much that I could say about the fact that our masks are not proven to be safe, to be proven to keep this virus from spreading, and that our God-given immune systems need the oxygen to be able to function optimally. But I do want to say that there's so much more to it. And one of those is just that development and the trust that children have with their peers and with their teachers and their loved ones that they need to be able to see through a smile with no mask. So to end with what Audrey had written, since there isn't very much time, she did have lots of different doctors and nurses that had shared their experiences of the terrors that masks have been creating. But there's one quote that she wanted to end with. It didn't start with gas chambers. It started with one party controlling the media, which is what we're seeing. One party controlling the message, which is what we're seeing. One party deciding what is truth, which is what we're seeing. One party censoring speech and silencing opposition, which is what we're seeing. One party dividing citizens into us and them and calling on their supporters to harass them, which is what we're seeing. Please stand up and don't be a part of that.
That's the end of that group.
Okay, so I'm going to call a recess for just a few minutes, okay?
Okay.
So why don't you wait with bringing the next group in? You want to wait just a few minutes? All right. get this meeting going again?
Toby Hildebrand.
Okay, Toby?
My name has already been stated, so I won't repeat that. I am a Coopersville parent and a kindergarten reading interventionist there. I have been told that our comments here fall on deaf ears, and I had hoped not to believe that, but from what I have witnessed today, it has changed my mind. And it was confirmed as I walked in this room and overheard one of the commissioners on the phone saying, "We're just sitting here taking it." I'm not only here to fight current mandates, they're just the precursor to losing our freedom. Why are we masking our kids? Come on, y'all know. They're being pawns. They're being used by the government. Why is it just pre-K through 6th? That's the only age group that the vaccine isn't mandated for yet. Have you heard of Pradaxa? Anybody? I expect a email from you. Honestly, have you heard of it before I speak of it today? It's a blood thinner. The first and only FDA-approved blood thinner for children 3 months to 12 years of age. Do you think that has anything to do with the push for FDA approval of the vaccine? Think about it. How can this shot even get FDA approved? Do your research. Biotech, the company out of Germany that manufactured this COVID vaccine, their safety studies are not even due to be completed until 2024. If the vaccine is so safe, why did Spectrum Health recently grant an exemption to all women of childbearing age and those currently pregnant? One commissioner spoke earlier about, come on guys, this isn't communism. A local factory here, whom I have a dear friend who works there, they have been mandated now to wear a button with a yellow star on it. Sound familiar? If they're vaccinated. Lots of questions for you to think about. I challenge you to not let it fall.
Tanya Harris.
Hi, Tanya Harris, 1142 Prairie, Allendale, Michigan. I could just say ditto for the last 40 speakers and the next 200 after me, but I do want to speak my words. As you may remember, I was here a few months ago back asking to go back to somewhat of normalcy. Based on that, the children are suffering mentally, emotionally, and psychologically. As I stated 4 months ago, my daughter attempted suicide based on these mandates. I am here again to please stop this craziness. I request the following 3 things. First, please rescind the 2 orders of August 6 and August 2021. Also, please request that Marcia and Lisa of the Health Department either resign and/or they shall be removed. If the above 2 things do not happen, I can guarantee with the people out there, we will be recalling some of you commissioners. And that is not a threat, that's a promise. My questions though, first, you say you can do nothing. However, who hires the employees of the health department? Second, you say it is a 50-50 split regarding wearing masks. However, I am the 53rd speaker and there was only 5 maskers up here. I can do the math. That does not seem 50-50. Please let me know how you're doing the math. Third, one of you said blame the governor. However, at this time, she's not mandating it. I know she's working the background, but the unelected officials of this county are creating these orders. Finally, I have 2 FOIAs for 2 of the commissioners that I am requesting that all emails, letters, memos regarding any masking and vaccinations be produced. I will forward it to this young lady next to me. Finally, this is not a law. Please stop these mandates.
Emily Underhill.
Emily?
Hi, I'm Emily Underhill from Allendale. I am not new to this podium at all. Just to fill everybody in via Zoom, there are thousands of people here today. I'm thanking every one of you for showing up today. to fill everybody in. We have been coming here for 4 months, parents from Ottawa County, pleading with you guys to listen to us. We have warned you all. Take the mask off our children. And don't look at me like I'm some crazy person, because I was in some other people's shoes before all of this. Fear, fear, fear from the media, okay? And for other people out there, I have a child who has respiratory issues. I was scared to death to go outside or be around my family for 6 months. I washed everything I owned until I started waking up. Everybody else here, keep coming back, okay? Because they are all aware of all the data that you have been telling them. And they're all backpedaling right now. I demand you to rescind these orders or fire the people from the health department. If not, I ask you to resign, or we are going to be recalling. And one more thing, it's not about me, it's about the kids, and God put me here, and God put all those people out there, and they will be coming back in droves constantly until our kids are freed from this. This is criminal, and you guys all know it. Think about it. You guys were all back there laughing 5 minutes ago with your mask down. You didn't even have a mask on a couple seconds ago talking to Bergman. This is a farce. We all know it. Is my time up? How much do I have left? I'm freaking sick of this. I've had scripts written down. I've been composed, but I'm freaking done. And everybody else is too. I respect your seats, but we voted you in, and I was respectful to begin with. Thank you, everybody, for coming.
Emily.
Daryl Hooker.
Daryl Hooker, 60th Avenue, Hudsonville. The arbitrary and discriminatory August 20, 2021 mask mandate looks at one particular aspect of our children's well-being, their physical health. Furthermore, it focuses solely on one very particular element of their physical health, based on a very specific set of data, and ignores a myriad of other aspects of our children's health. It completely ignores our children's emotional, social, spiritual, and mental health, and any and all data associated with those aspects of our children's holistic health needs. This narrow and limited approach demonstrates that our schools are far better equipped to serve and support our children's holistic health needs on both an individual and community level than the county health department. Our local school boards and administrators should be given the authority to work with families to make these determinations based on each child's overall needs. Further, MCL 380.1307B states that any restraint that negatively impacts breathing is prohibited under the circumstances, including emergency situations. It doesn't qualify that a negative impact is okay in specific circumstances. It doesn't quantify that a little bit of negative impact is okay. It says none, ever. If you can't restrict a student's breathing in any way as a disciplinary measure, then why are we doing it to healthy kids that are following the rules? And if a mask doesn't restrict their breathing, then what's the point of requiring it in the first place? According to Ottawa County's own website, there have been 0 deaths in residents aged 0 to 19 years old since the beginning of the pandemic. Not 100 or 50, not 10, 0. Some will use that argument that is because last year's public health mandates worked. However, last year's mandates included provisions for schools to have the ability to work with parents to exempt their children from wearing masks, to make decisions that are in the best interests of each child, and make accommodations that work for each classroom. Many families made that decision for a variety of reasons, and student-to-student transmission in the classroom was still negligible. In addition, many schools had policies in place prior to the August 20 mask mandate. I've waited 4 hours to speak. I'll take 10 seconds to finish. There are many other statistics that 2 minutes does not allow me to present, and I can assure you that none of you and no health department employee cares more about or is better equipped to address our children's holistic health needs than the parents before you today.
Okay,
Return the authority to make decisions impacting our children's holistic health needs to the schools and allow them to work with parents to make these decisions. Thank you.
89 references on that mask don't work, and they're harmful. My name is Harvey Nickel
from Jenison, Michigan. I do not understand why you have not blocked the mask mandate put out by the Ottawa County Health Department. Why are you not following the science and using some common sense? Masks do not work. Where is the scientific evidence that shows that masks are effective in stopping an airborne virus? Since there is so much evidence that wearing a mask all day causes physiological and psychological harm to a child, and since there have been no child deaths from COVID in Ottawa County, why are masks being mandated? Why are religious exemptions from wearing a mask not allowed? Why are medical doctors being threatened with the loss of their license if they write a medical exemption from wearing a mask even for asthma? How many actual cases and deaths have occurred in Ottawa County? That information is no longer available on the Health County website. However, their website is totally devoted to getting the vaccine. How can they claim the vaccine is safe and effective when a CDC VeriSite lists 13,066 deaths, 1,607 miscarriages, 5,882 heart attacks, 4,861 myocarditis, 17,228 permanently disabled, 4,681 Bell's palsy, 5,617 anaphylaxis events after the shots. Why are the citizens who are being enticed or coerced into taking the shot not given this information? If the health department actually cares about our health, why is ivermectin, hydroxychloroquine, and budesonide banned? Note the death rate in India decreased by 95% when they used ivermectin. You may be sitting there thinking that we're just a bunch of anti-mask idiots. Well, you don't really understand. This issue is not about masks. It's about choice and parental rights. We are fighting for our God-given rights to make our own choices with respect to health, and we are fighting for our children. Parents have the rights to decide what's best for the child, not the state. We do not live in a communist country, at least not yet. But with tyrannical leaders that do not listen to the voice of the people, I'm afraid we're going in that direction.
Who's next?
Christy Meppelink.
Okay.
Christy Meppelink, I'm from Zeeland, Michigan. I'd like to know since when did the health of our children become the work of the school board or the county commissioners? You say your hands are tied. Is it really because of the federal funding that's creating a stronghold? I recently shared a video on Facebook entitled, "How Federal Dollars Are Tied to Schools in 2021 and Beyond." It was censored. We can't even do our own research. We get one side of the narrative. Our decisions are should be based on our own research rather than from the narrative that's forced on us by the news, through social media, and also by you and through mandates and one-sided info that was presented just here today through the health department. I'm concerned about our freedoms being stripped away. Federal dollars are funneled to school by the CDC. It can be found right on the hhs.gov website. The purposes all sound reasonable, but the schools have to agree to masks, distancing, tracing, among other things. The next step would be mandated vaccines. Have you looked up green zones? It might sound far-fetched, but what's going to stop the next step and the next step? Since when did these and future mandates become a better tool than our own natural health? Why are federal funds being funneled into our schools to force compliance with the narrative? Where does it end? If we don't protect our freedoms now, we could lose so much more. We're looking to you to defend our public education system and our freedoms, not to create an indoctrination system. You say we're heard, but we need more. We know you have leverage you can use. We are trusting you to stand up and fight back. If you won't, then it's time to get out of the way. There are plenty of patriots that will, and we aren't backing down. It's time to free America. I check it out, timetofreeamerica.com. It's time to free Ottawa County. We collectively here have a lot of shared ancestry, and I know that our ancestors did not come to this country to see this happen. I know that my husband's grandparents came and did not speak English. They came to this country. They came to have freedom, and that's what we're asking for.
Amanda Semlo.
Hi, Amanda Semlo, Spring Lake, Michigan. I'm not a polished speaker, but I am a concerned mother. I'm a concerned parent of two children, one in first grade and one in eighth grade. And I will tell you a small piece of our story is that my son went to school last year in mask. And although we didn't believe in them at the time, we supported his decision. This year, when I told him that the district flipped and they had to wear masks, he said, "Mom, I won't do it again." And I said, "Okay, you won't be able to play football." And he said, "I don't care. That is not what's important to me." and we will protect his mental health at all costs. This is not about being with friends. This is not about that. It's about his mental health, and we will support that. We are able to move our daughter to a different district in a private school. We're able to move our son to homeschooling. Not every parent is allowed that. They're not allowed flexibility. They're not allowed the funds. We're blessed to pay for a private school. Not everyone can do that. So I'm here to speak for other parents who are not allowed to do those things because they can't. I'm here to stand up for them. I've watched every adult in this building make a choice today whether they wanted to wear a mask or not. Every employee in this building has gotten that choice. Why do our kids not deserve the same respect? And I'll let you know, I respect all the commissioners on this board who decided not to vote to give the health department money. And I will also tell you, there have been 250 Ottawa County parents and students who have chosen to move their kids to homeschooling. You do the math. $8,700 times 250 kids.
Thanks, Amanda.
There's your 2.2 million.
Carrie Bosma.
Hello, I'm Carrie Bosma. Some of you know me. Thank you for commissioners for having me. I am not only an elected precinct delegate, I'm also a township trustee. I am here. I ran because I wanted to be the voice for the voiceless. And I'm asking you to do the same. I'm asking you to listen to what your constituents have said. I'm emotional. This may be embarrassing to some, but I am out in the streets for my job. I'm out in the community. I have parents coming up to me. The stories I hear are heartbreaking. I urge you to find a way to represent your constituents, to figure out where you have the jurisdiction to do so. I know some of you have had some people coming and you have felt like it was a small population of Ottawa County. Obviously, today you've had a ton of your constituents come in. There's going to be more. In the few days of pressure that you have dealt with, that is what our children and our parents have been dealing with. I have been on a drop of a hat if I'm going to be able to go into work to help with my kids or if I will have a job. I also want to share this. I had a parent share this with me. Our seniors are the only grade in high school that have had a traditional school year. Seniors. So juniors, their last traditional year is 8th grade, sophomores 7th, freshmen 6th grade, 8th graders 5th, 7th graders 4th, 6th graders 3rd, 5th graders 2nd, 4th graders 1st, 3rd graders kindergarten. Our 2nd graders and below have never had a school year with traditional education patterns. They're hurting. I have seen kids with such emotional breakdowns. I have seen parents go through the ringers. Please, I urge you, let's figure out a way. How can I help you? Let's figure this out. There's more coming. Thank you.
Thanks, Carrie.
Jamie Overway.
Hi, my name is Jamie Overway. I would like to start off with saying the Lord's Prayer with me if you can. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as is in heaven. Give us this day our daily bread, and forgive us our debts as we forgive those debtors. Lead us not into temptation, but deliver us from evil. Amen. Please let this be parents' choice. These kids are hurting. These kids need you to step up. Please do. Thank you.
Thanks, Jamie.
Christina Visatham.
Sorry. My name's Christina Visatham. I'm from the city of Zealand, and I just want you to take a look at this picture. This was 5 days ago. My daughter has been homeschooled for the last 18 months. I am also a working parent. You see this little girl, she has dyslexia. She was in Spanish immersion, and we had given that up for homeschooling. I felt like as a parent that a child with dyslexia, I would give her an advantage in life. We spent 8 hours a day on online learning, and she could not understand it. And me, as not a bilingual parent, I had to work through that with her. This picture shows a calendar in English because she switched to English. I signed her up on the last day of enrollment, Thursday. She met her teacher. She set up her books, her desk. And the next day, I had to tell her she couldn't go to school because of a medical condition. Where is HIPAA? Why can't our doctors decide without their license being tarnished? I had to pay $195 for my 4-year-old son to get a mask waiver. My daughter was at camp the week that I got the waiver for him, so my daughter has to wait till October. And you know what she told me? I can wait that long, it's only a few more weeks. She doesn't get the reading support she needs. She doesn't get the math help that she needs, and she's totally transitioning to English. I pray that you will be the good. Please help my daughter and allow parents and doctors without their medical license being tarnished that you choose HIPAA. Choose HIPAA so that we have a choice. Allow parents to decide what a medical exemption is. Thank you.
Thank you.
End of this group.
We'll cut you off. Please give us your name and address when you approach the microphone, and please return to your seat afterwards.
Yelena Klawan.
Okay.
My name is Yelena Klavan. I live in Hudsonville, 4586 Hidden Ridge Drive. I am a legal immigrant, a refugee from Russia. I moved here in 2003, and I haven't not been back because I have nightmares of not being able to come back. But today, I feel like I'm living back where I came from, because my religious exemptions for my kids for wearing masks in school were not accepted by public school. They are denied their free education right now in America, 2021. In Russia, Christians weren't allowed a higher education. None of my family went to university because we did not belong to a communist party. What is happening here today? Why our religious exemptions are denied? Please tell me why. Please tell me why. Why did I make a huge sacrifice? Trip was, I came here to a free country of America, and I'm reliving the same nightmare. I believe that our body work was created by God. And I believe we have immunity that could fight this virus. I did have COVID-19 in August. My whole family had COVID-19 in actually, I'm sorry, not in August, in April, and we're fine because we have immune system. We can do it. And by the way, my kids were wearing masks last year, and I absolutely believe that we got COVID from them wearing masks inappropriately in school. My husband is a veteran and retired police officer. He was at the first riot in Grand Rapids. Why are we not allowed our freedoms right now in this country? Thank you.
Thanks, Yolanda.
Ben Smith.
Thank you. My name is Ben Smith and I live in Hudsonville. Let's take a step back and see what the real issue is for me. For me, this is about the health department who does not know me, does not know my child or my situation, taking away my God-given right to do what I think is best for my child. You're forcing my child to do something that I don't think is best for them and they don't want to do. That is in direct violation of my rights for life, liberty, and pursuit of happiness. Additionally, it's in violation of Michigan law, section 380.130B, section code H, that prohibits any restraint that negatively impacts breathing. These rights are not put in place when things are going well. These are put in place to make sure that my rights are not infringed upon in times of crisis. I'm reminded of the words of Thomas Sowell when he said, "There are no good and bad decisions, there are only trade-offs." According to the CDC, you are 8 times more likely to die from the flu cases 2012 to 2017, if you're under the age of 18. So my big issues are, nobody has proven the efficacy of masks. Please show me how the positive effects outweigh the negative consequences. Why are we treating COVID so differently when statistically you're much more likely to die from the flu? And bureaucrats, most importantly, are trying to divide us by forcing us to wear the mask. I think that all parents want what's best for their kids, whatever side they're on. We might not all be like-minded, but I hope we have the same spirit of wanting what's best for our kids. Give us that unity by giving us all the option to decide what is best for our children and my right to do what I think is best for my child. Thank you.
Thanks, Ben. Who's next?
Hillary DeYoung.
Hi, I am Hillary DeYoung, and I am from Hudsonville. I'm just here to share a story to show that mental health matters, and our kids matter, and their choices matter. I homeschooled beginning of last year until they couldn't handle it anymore. They miss their peers. They miss their teachers. They miss their school. They have an awesome school. So in March, I re-enrolled them, knowing they would have to wear a mask. And my fears became reality. I knew my son was going to have a hard time. So let me just start here. At Hudsonville Christian School, they have a chance to be Kid of the Week. They answer a series of questions and post pictures along with other fun facts. Under dislike, my son wrote, quote, face diapers, weird, and a hand-drawn picture of a mask. The teacher he had whited it out, and he had to pick a different dislike. Here I have pictures. Are the pictures show you my 8-year-old son was silenced. He was speaking out just to give an opinion different than what he was allowed. He had many days he was in trouble for simply breathing. He would pull his mask down under his nose to breathe. He has asthma. He was trying to go along to wear a mask, to be with his friends, to help others. But when his own needs were denied simply to gain air, we got him the waiver, and he no longer needed to be told you were in trouble. He no longer needed to do the think about it walks by himself at recess. He no longer needed to wear a mask. He proudly walked back into school mask-free. Many friends were jealous. Many parents came to me asking how. He wasn't the only one who needs help. That's why I'm here, to help give choices back. Our school was going to give choices, and that was taken away. Whether a person has a health reason or not, they are all allowed a choice. We live in America. Thanks.
Thanks, Hillary. Who's next?
Joshua Vanderclock. Christina Stickney.
Good afternoon, almost evening. I've been here since 1 o'clock. My name is Christina Stickney. I live at 8897 Buchanan Street in Allendale, Michigan. I live in a home with 8 people, 2 of them 70 or older. We all had COVID last October, went through the house slowly but surely. Everything came out fine. Everyone was okay. I want to read a quote from Daniel Webster. It is hardly too strong to say that the Constitution was made to guard the people against the dangers of good intentions. Good intentions. There are men in all ages who mean to govern well, But they mean to govern. They promise to be good masters, but they mean to be masters. They mean to be masters. I want you to think about that. I want you to think about all of these people. They've come out in droves. I've been here since 1 o'clock. My ride left at 3. I homeschool. I have from the get-go. I will continue. I love our country. Listen to the people. We should be the ones making these decisions, not governments, not mandates, not a governor that's not listening to the House or the Senate. Object to these rulings, fight back. We ask you to stand with us. Lead. Leaders are not the ones that go with the flow. They are the ones who stand. And we ask you to stand. That's all I have to say.
Thanks, Christina. Who's next?
Matt Demond.
Matt?
Pardon?
I said thank you.
Oh, thank you.
Matt Dumont, Georgetown Township, Jenison Schools. You know what my school board and my principal and my superintendent have been telling me for 3-4 days? Come here. And you know the first thing you led your meeting off with? You're going to do nothing. You're going to do nothing. That's who everybody tells me I got to come to. That's the system in this country. And you let it off saying, we're not going to do anything about this. You hadn't even heard from your own phony health department yet, let alone us. Nothing's going to change. It turns out you guys don't have the fortitude and the courage to do what you signed up for and what you agreed when we voted you in that you would do. And it's pretty disheartening in our whole system. But you know, in that respect, I kind of thank you because you've woke up the heart and soul of this county. The blue collar folks who are too busy working, raising their kids, coaching Little League, they haven't paid attention to who's sitting in these seats. We're paying attention now. And I can't wait to see those name tags change. I really can't. I see a lot of males sitting up here, but I don't see any men. We ought to get these moms out here in these seats. We'll get something done.
Jessica Noble. Karen DeVries.
Karen?
Hi, my name is Karen DeVries. I'm from Holland, Michigan. I listened recently to one of the videos put out by the Ottawa County Health Department dated June 8, 2021. Marcia Mansaray, Deputy Health Director of Ottawa County, made the following statement. The Ottawa way is to look out for the common good. We relinquish a small amount of personal liberty for the common good. Let me ask you this. What to you is a small amount of liberty? Is it 2 weeks to slow the spread? Wear a mask for others, if not for yourself. Stay home. Let grandma or grandpa die alone. Is relinquishing a small amount of personal liberty playing volleyball with a mask on that is sweating and you literally cannot suck in dry air because you are sucking wet, sweaty mask air into your lungs? That's my daughter, by the way. Is it graduation drive-bys? Is it quarantining the healthy for days and weeks? Is it don't open your churches? How about report your neighbors if they have more than a few people at their home? that are not related? Is it just shut down your business, for the common good? Is relinquishing a small amount of personal liberty burying a loved one without a funeral? Is it not being able to be at a hospital bedside to advocate for the health treatment of a family member who can't speak for themselves? Is relinquishing a small amount of liberty standing outside of a window of a retirement or nursing home and waving at your parent who is trapped inside? If any of what I just mentioned, and so much more that I know you're all thinking of, weddings, who knows what, if any of what you're thinking is labeled as the new normal, if people say, well, it's a new normal, it is offensive and terrifying. I refuse to accept the term new normal. I would label it as the new regime. Therefore, I stand firmly against mandatory masking of kindergarten through sixth graders, for crying out loud, let alone masking anyone.
Thanks, Karen.
Fire the health department if you can't do it yourself.
Ben Iwama.
Ben?
Christian.
Telehar?
Tischler. Yeah, it's Tichelar.
Yes, sorry.
No, you're fine.
What's your first name?
Christian.
Okay.
Christian Tischler from Grand Haven. I had a lot prepared here, but 2 minutes is not long enough, so we're just going to freestyle this. I'm a 36-year-old father of two precious children who've been entrusted to me by Almighty God. They don't belong to me, they belong to Him. And that is the truth. I'm here to be a caretaker and do the best I can, but they belong to Him. Born and raised on the south side of Chicago, it was a Coast Guard that brought me here 17 years ago. And I love this place. I've been blessed to be able to move back out here. I'm blessed to live in America, even though it's looking more and more less like America every day. I said I'm a father, I'm a veteran, most importantly, I'm a born-again, blood-bought saint, child of the Most High. Nothing, no struggle here is permanent, and I know that. There's nothing anyone here can do, the health department or anything, that can take that away. You can freeze my bank accounts, you can repossess my home, you can kill me, but I'm sealed, I'm saved, and that's the peace that I have. And I just want to say that every one of you in here, whether you believe it or not, is going to stand one day before Almighty God, and you're going to answer for every decision you made. You're going to answer for every single decision you made. Whether you believe it or not, it's going to happen. That's a thought that scares me. And I know from many passages in the Bible, the children, the Lord does not take it lightly. They're precious to Him. And I would not want to have to answer for doing anything that would harm them. And I come here to try to change your minds. Your minds are probably already made up. What I came here to do is tell you the truth and tell you that you will not have an excuse. You know the truth. You guys are all smarter than me. You're older than me. You're more connected than me. But you're all going to stand. You're all going to have to answer.
Thanks.
And thank you for the opportunity, and God bless.
Donna Mooney.
Donna?
Luca Felina. I'm not sure on this one. It's either Bart or Barb Spencer. Jody DeRue.
Jeremy. Oh, sorry. I'm just not fast because I'm in the
You're
back.
good. I'm Jody DeRue. I am from Allendale, Michigan. My kids go to school in Hudsonville Christian School. I am up here today just to ask you to please have this health department rescind this order. Allow kids to have their parents be the people to speak for their best interests. Let them be the ones to sign their exemptions. They are the ones that are closest to them, that love them the most. Our role as parents is not to be taken lightly. We all know the ramification of choices. We make them every day. There are rewards, there's consequences for each choice. When the choice is taken from us about our child, who is supposed to be protected and loved by us, and we see that that choice is very harmful to our kids, it is time we change that order. I am not sure how many of you have ever had kids with trauma, have raised foster kids, have had adopted kids in your home. These kids even can be our bio kids that suffer from trauma. Right now, there are kids that are experiencing trauma because of this order from last year. It changes the way their brain processes their surroundings, and it changes the way they see the world. Last year, there was a lot of kids that entered this group of trauma brain kiddos. Why? Because of the fear about the masks and COVID. We, the parents, the ones at home, train these kiddos up. We support them and encourage them to be kids, to climb trees, to play sports. We can socialize them. We can build healthy relationships with them, help them problem solve, help them be empathetic, and help them see the needs of those who need them to walk with them in friendships and encourage them to be as Christ to those around them. The mandates have now built into these kids the questions of, is this even safe? Is it life safe? Is it safe to play? What if my mask falls? What if they have germs? What if this person sneezes? What if this person coughs? Am I getting close to them? Am I going to kill my grandma? In our home, we had a son come home and tell us last year straight out that he wanted to end his life to end the masks.
Thanks, Jody.
This is serious.
Who's next?
We are responsible to take care
Jeremy
of these
Voorhees.
kids.
I'm Jeremy Voorhees. I'm going to dive right in. Well, we recognize that you may not have been involved with the health department order. We do not accept that there is nothing that you can do about it. You appointed each and every one of them. You control the power of the purse, and you can't stand idly by while a team that you appointed, none of which were voted upon nor approved by the people of this county that you represent, unilaterally undermines parental rights to care for their own children, unilaterally undermines schools' rights to care for the safety and full health of their own students, who has unilaterally made a healthcare decision for thousands of students in the county that you represent, with absolute and complete disregard for those students, for our children's emotional health, for those students, for our children's mental health, for those students, for our children's spiritual health. For what? For them to forcibly take part in an unproven scientific experiment that maybe will diminish the spread of a virus that has killed less children than the seasonal flu. The cost is too high. The cost is too high for our students. The cost is too high for our children. The cost is too high, and we all have too much skin in the game to be dictated without consult or consent. Parents hear their children and schools hear their parents. Schools are appropriately positioned and experienced to meet the health and wellness needs of their students, considering physical, mental, emotional, and spiritual health. We ask now that you stand with us, as you've been elected to do. Stand with us and go to bat for us and represent us. Use the power of appointment, use the power of the purse, get creative. We don't care. Use your resources, use your time, use your energy to stand with us, all of us. This order must be rescinded or at the very least be modified to permit parents to make sincere mental, emotional, spiritual objections on behalf of our unique and beautiful children. And we look to what Sparta County Commissioners, since I have more time here, we have Allegan County Commissioners. Look to see what they've done against their health departments, and don't tell me you can't do anything about it.
Linda Ford.
Linda?
My name is Linda, and I live in Jenison. This is my son, Rylan. And it was only until today that he was able to come with me. I pulled him out of the public school system in Jenison before you all passed this mask mandate. And yes, I say you, and he is, and I'm thankful that I did. And the reason I had actually pulled him was because they did not invite parent input at his school. And so he is with me today, but I am very thankful that I did because my doctor won't write a medical exemption for him. He has horrible allergies, he has asthma and other things, and they won't write one for him because they are afraid. So y'all need to please keep that in mind. But I would like to ask each of you to think of the townships and the villages that you're assigned area and ask yourself if you really know what is going on in that area. You each were elected, and I quote, to listen to county government related concerns of residents to help them obtain the services of a county agency or provide them with answers. That is a quote. Now, lately, some of you have either not answered or some of you have given a rote answers to issues that your constituents have repeatedly brought to your attention. According to the county website, you, as a commissioner, are supposed to be overseeing county services and administrators, which includes our health department. Yet, the most common answer when people ask about this newest mask mandate or order is that the health department did everything on their own. If this is the case, this means that you all should be asking why this happened, and then you need to work to fix this issue because you're the ones who are supposed to oversee it, therefore you dropped the ball. Secondly, I have multiple websites that are valid and filled with factual information, and they would actually prove the health department is wrong in masking elementary age children. Why are you, the elected officials, assigned to look out for the people not concerned in looking into this matter? My last point is this: government should never take away the freedoms of the people, and yet here in Ottawa County, that is exactly what has happened.
Thanks,
I
Linda.
would like for you to immediately
Next.
rescind
Jamie
this
Dirksey.
order.
Jamie Dirksey from West Olive. I'm here today to speak specifically about keeping our kids in school. It has been said that this is why we need masks. I'm here on behalf of the students who that are now going in other directions, such as homeschooling and virtual school, specifically due to mask mandates. These students are the ones we need to keep in mind. 30 students from 16 districts would be a total of 480 failed students. School is an escape and provides them a chance to be nothing more than a kid. In school, they are exposed to friendships. They have opportunities available to them to grow and become college, career, and life ready. These students need our voice. I'm asking you to urge our health department to make masks a recommendation. Mr. Garcia, you spent 12 years in Sheldon Woods Elementary at WO. Our classrooms are at their maximum number of students allowed, so I want you to put yourself in that classroom with no AC and 35th grade students. I believe strongly in public education. My own students will both be in the building come September 1 at WO, but I can't say the same for all of my fellow friends, volunteers, neighbors, athletic parents, students, and most importantly for the students that don't have a complete support system but are now being pulled to be homeschooled based on the fear that has been created that we are on a slippery slope of mandates. The data shows a recommendation works. West Ottawa Summer School had approximately 1,000 students. It resulted in 0 student cases, 1 staff case. All staff members were in masks unless they were vaccinated. For student masks were not mandated, they were recommended. Public education should not be feared by parents. We need to work together to keep as many kids in school as possible, no matter which side you're on. Looking at the whole picture, keeping the most students in school would be the result of a recommendation, not a mandate. Please keep your word with your voters and do not fail our students. Thank you.
Thanks, Jenny.
Jolynn Patmos.
My name is Jolynn Patmos, Ottawa County resident and mother of my 4 precious kids. I come to you today as a spokesperson for the mental, emotional, spiritual, and physical well-being of my children and thousands of others. You, as elected officials appointed to serve the people of this county, need to step up on behalf of the most innocent among us, our kids who can't defend themselves. They are the next generation and future of this society, and this mask mandate is slowly killing their spirit one day at a time. There are no proven, irrefutable scientific facts that state masking kids will slow the spread of this virus. Furthermore, there's no data that shows this virus is taking out kids left and right. The seasonal flu claims more lives than this virus. A mandate such as this is not a one-size-fits-all situation. As in any healthy relationship, be it marriage, friendship, or a school relationship with the families they serve, compromise is a vital key component. Allowing parents, the people who know their children better than anyone, the right to choose what is best for their family is the correct compromise. If parents have concerns about the virus, they are free to mask their child, no questions asked. If an adult staff member has concerns, they're free to wear a mask or get vaccinated, no questions asked. So it should also be, if a parent chooses not to mask their child, it should be their right and choice to do so, no questions asked. It is a compromise where everybody has their rights honored and freedom to choose based on their unique circumstances and beliefs. You, as our elected officials, need to stand up for the voice of the people you serve and hear a plea for freedom. Wasn't this country founded by people who were tired of having a government dictate their everyday lives? Have we taken that so for granted that we're circling back around to borderline dictatorship? And for what? Money? Power? Is that what truly serves the people as a whole? Taking the choice away from us as parents does not have our children's best interests in mind and quite frankly, our country's best interest in mind. It is just causing further division in an already tense and broken time. We humbly ask you today to fulfill your duty as elected officials in this free country.
Thank you.
Ashley Brower.
Hi, I am Ashley Brower. This honestly makes me like sick to my stomach to be up here, so I'll spare you. I won't puke on you or anything. I'm a mother of 3 and I'm a local township board member, and I thank you all for your service here on the board. I know you're all taking times away from your families and your lives to listen to all of us yell at you, which is not fair. Though mine have never been this well attended. I pray for you and the decisions that you have to make. As a township board member, I'm discouraged today, as it's a perfect example of why people say local government officials accomplish nothing, that we pass the buck, that we wash our hands of the matter and say it's not our problem. You and I all know better than that. You do have a say. You do have control. You are in this position for a reason. I encourage you to use it, to speak up for us, to fight for us. Our school administrators deserve better. Our teachers deserve better. Us parents deserve better. And most of all, our kids deserve better. It's not about the mask. It's about the improperly forced mandates. It's about standing up instead of standing by before all of our rights and freedoms are taken away from us. Stand up for something or fall for anything. Thank you.
Thanks, Ashley.
Amber Solinsky. My name is Amber Shashelski. I am a mother to 5 children. 2 of my little boys are affected by this mask mandate. I have been to these meetings since May. I heard you promise that no mandates would come out of this county. So now our state steps down and your health department steps up. You now want me to strap a piece of cloth on my boys' faces every day, one that they will chew on, suck on, and eventually come home at the end of the school day and it will be sopping wet and visibly dirty. I'm asking you to rein in your health department. Hold their funding if need be, and it's blatantly apparent that need be. They've drastically overstepped their boundaries. These are our kids. These are our schools. We did not agree to co-parent with the government. Right now, our health department is forcing us to mask the least vulnerable population physically, but the most vulnerable population emotionally. They're teaching our children to comply, to fear contact with their friends and their teachers. And you are asking us as parents to move out of the way, quiet down, let up on the harassment. Well, like Rosa Parks, when she didn't move to the back of that bus, we say no. Your health department is infringing on our children's God-given right to breathe freely. They are also infringing on our right as parents to make the medical decisions we deem best for their physical, mental, and emotional health. We want these mask mandates rescinded. We are more than ready to keep fighting this. We are more than ready to keep showing up. These are our children, our future, our everything. And we will never stop standing in the way of local government offices who are trampling the freedoms that our founding fathers fought for. And to the county commissioner who had the balls to say, sometimes the government needs to make your decisions for you, and that's what we're doing, perhaps you should consider relocating to Australia. It seems that political environment might be right where you fit in.
That's the end of that group.
Okay.
Liz Ramey? Okay.
I'm Liz Ramey. I live in Allendale with 2 kids. I, along with others, am not new to this podium, and I express the same frustrations that for 4 months, our concerns and comments were fully disregarded. The number of people that turned out today can simply not go ignored. Lisa claims kids are unaffected by masks and they handle it fine. Wrong. You did not see the look on my son's face when he found out about yet another mandate. He cried and he told me, "Mom, it's hard to focus. I have headaches every day. I can't make friends when I can't see their faces." Things that I have told all of you before. Those few who are for the mask and have applauded this mandate due to kids being medical fragile are not the only ones. I do as well. I have a 5-year-old with epilepsy, autism, and a significant speech delay. The difference is that they are victimizing their kids and living in fear, not empowering them. There is always a risk of some virus, a car accident. Do they let them on the bus since there isn't seatbelts? Since that seatbelt is an analogy compared to a mask that likes to be thrown around. Parents deserve a choice, and it is our God-given right to do so as parents. This board is trying really hard to pass the buck. It's a slippery slope when you start sacrificing freedom. All of us here recognize that and know that it's gone far enough. Demand this order to be rescinded, and if not, fire those responsible.
Thanks, Liz. Who's next?
Stacy Perkins.
Hello, my name is Stacy Perkins. I live in Hudsonville. I came here today to tell you that it is time to force the health department to rescind the mask mandate and the quarantine mandate. You have heard one person after another tell you that mask mandates are illegal, section 380.1307B, that masks do not work to stop the transmission of viruses, and masks are harmful and abusive to children. When are you going to stop trusting the one-sided, faulty data of lies from the health department? Professionals are not always to be trusted. There is ample data out there to show that our kids are going to be just fine unmasked, and to mask them is hurting them. And I don't want to hear any more excuses of, well, we don't control the health department. Oh, yes, you do. And you showed me today. You control their money. That is all the control you need. You can demand that they rescind these orders, or you cut half their budget. You do have that power. That's what hundreds and hundreds of people came here, people who elected you and asked you to do today. How disappointing to see you vote in $2 million more for them in spite of their lies. What is wrong here? I also want to mention the religious exemptions that the health department told my school they won't accept. They don't have that right. According to Title VII of the Civil Rights Act of 1964 and the Elliott Larson Civil Rights Act 453 of 1976, in Michigan, it is illegal to discriminate against anyone for their religion. And Title 18 of the U.S. Code, Section 241, specifies that such religious discrimination is a felony. Why are you supporting the health department breaking the laws and harming our children? Thank you.
Mindy Vandenhoevel.
My name is Mindy Vandenhuvel. I have students at Hudsonville. In fact, I am missing my child's first dive meet in high school because I'm here sharing all of this with you. You guys look so bored, so defeated by all of the support here. Kyle Terpstra, I want to say thank you. Thank you to you, the only one who has a backbone willing to get behind the constituents who elected him. Gregory, there might be hope for you. You spoke up. You might be hearing us. The rest of you, please resign immediately. Take a break, grab a water, a piece of paper, and resign. You do not represent us. You are not willing to listen. You are not actively working for your people. These children are committing suicide. Do you know what it would be like to find your son or daughter at home with a bullet wound? Do you know what that does to their friends? Do you know what that does to their community? This is a part of what you are instigating, and it is not okay. You tell me, Mr. Dannenberger or Francisco, I couldn't tell because I was out in the overflow due to the hundreds of people here, that you get all these emails. Show us, prove it, put them out in the commissioner's office, put them out somewhere so we can look at them. We can say there's 700 and there's 400 for this and 300 for this. I doubt it. Prove it. Prove the majority is behind you and masks. It's not okay. You don't speak for us. We're here speaking. How many have said we're for masks who are speaking? Less than 5. Listen. Actively take a role because it's going to be taken from you. None of you will return. We are here, we are speaking, and we will not go away. Another thing you should do is have, I dare you, I double dog dare you to have a meeting that's convenient for the public in a huge place like a stadium. Then you'll have thousands show up. 1:30 on a Tuesday is super inconvenient, especially for parents who work, parents who should be attending their daughter's dive meets. It's inconvenient for everyone.
Okay, who's next?
Elena Olson. Alana Olson. Sorry.
Hi, I'm Alana Olson. I am a precinct delegate in Wright Township. I live in rural Coopersville, Michigan. And I have a lot of random thoughts in my head from everything I've listened to and that. So I just thought I'd see how many of them I could get through in 2 minutes. First of all, personally, I have low vital lung capacity. I don't know if you've ever heard of that. I breathe very shallowly and there's not much I can do about it. So I easily get panicky with a mask on my face because I don't breathe that well without a mask. So I can't stand them on for more than a few minutes at a time. And I only wear them when I'm forced. So how do you know there's not a lot of kids with the same issue? I'm not the only person in the world with that issue. Okay. I also have sleep apnea, so I wear a mask all night long. The difference is that mask helps me breathe properly. It doesn't restrict my breathing. Random thoughts. Okay, here's another random thought. This virus came from China with the help of our very own NIH funding. They created it through gain of function research, which I see no good purpose for that whatsoever. So created there, managed to get it over here, and look what it's done for us. The masks come from China too, the paper ones. Everything I've read says there's fibers in them that aren't good for our health. So China is not our friend, in case you haven't noticed that. So they're happy to do anything they can to push us down and hurt us. Okay, let's see. Michigan school law. The revised school code excerpt from 380.1307B, whatever. It says, any restraint that negatively impacts breathing is prohibited in our schools. It's right there in the law. So having these mandates is against the law. Okay, thank you very much.
Thanks, Elena.
Ruth Van Hoven.
Ruth?
Hi, Commissioners. My name is Ruth Van Hoven. I'm from Coopersville. I was here a couple months ago and I gave you one of these. Does anybody remember the number that was on that? Commissioner DeYoung, was it 55, 57?
I don't remember.
This is 83. $83 people. 83 people of my Facebook friends or family have died after the second shot. 83 people. How many people do you know? And what percentage of those people have died from COVID or from the second shot? I have 1,800 or so Facebook friends. So the math of that is like really a huge percentage of people that got not just one shot, but 2 shots and died. Where is that in this calculation? And I sit here and I look at y'all and I'm like, seek to understand and then be understood. And I'm like, what is happening here? What really is going on in the council's mind, in the administrator's mind? Like, back to those Bible verses, test all things, hold fast to that which is true. We're humans. We don't always know the truth from the get-go. And then every day I wake up, I'm like, work out your own salvation with fear and trembling. How many people have to die that don't hit the news, that don't hit the data sets from the health department? How can you be open and curious to look at where is this data that's being censored? What is so harmful in looking at that data and going, wait a minute, Let's look at all this, take a step back, reevaluate the position I'm in. We all make mistakes. Sometimes we're right, sometimes we're wrong, sometimes we're in between. But the ability to see the power of the people here today, this group happened in less than 36 hours. It's crazy. And I thank you.
Thanks, Ruth.
Rhonda Young.
Hello, my name is Rhonda Young. I'm a Ottawa County resident, a licensed practical nurse, and a mother of 2 young elementary school age children, currently in the ZPS school district. I am deeply concerned and worried about the erosion of our local control and parental authority. Parents know their children best and what is best for their children. The choice to mask our young children should be left up to the parents and their school districts, not an unelected official with the county health department. There is no current state of emergency that expired. And the CDC and MDHHS is recommending masks for K through 12 schools, not requiring them. Penalizing the pre-K to 6th grade children makes 0 sense and has 0 science behind it. Let's follow the CDC and MDHHS and leave masking as a recommendation and a choice. I implore you to request that the Ottawa County Health Department rescind their mask order dated August 20th. And if they don't, do something else about it. Thank you.
Thanks, Rhonda. Who's next?
Lene Manera.
Good evening, Commissioners. Lene Monera from Allendale. Thank you to the 2 or 3 commissioners who actually publicly put in writing that you are opposed to the mandatory mask mandates for our young kids. One of you said that you will do everything under the law to fight this. Thank you for that. There actually is a law that allows you to fight this. Under Michigan statute, this board is the quote governing entity, end of quote, of the health department. Under Michigan statute, this board appoints the health officer, in this case, Lisa Stefanovsky, who has been issuing these orders. But don't believe me, look up the statute for yourself. MCLA 333.2406 and 2428. Or please ask Ottawa County Attorney, Mr. Van Essen. I'm sure he's familiar with these statutes. He perhaps has not told you. So if you're serious about fighting this, remove the health officer. If you have the ability to appoint her, you have the ability to unappoint her and appoint someone who is for parental rights. I have heard from Ottawa County for 17 months now that we have no choice but to follow the state law, the MDHHS orders. There are no MDHH orders to hide behind. This is the Ottawa County's order. And as the governing entity of the health department, commissioners, you own this. Ottawa County's attorney yesterday issued an opinion letter stating there's no religious exception to the August 2021 order. I spoke with an attorney from the Thomas More Law Center this morning. He's a constitutional attorney. He found Mr. Van Essen's opinion very interesting because somebody can have a sincerely held religious objection to mask wearing. It's just a matter of whether Ottawa County will recognize that. Here in Ottawa County, does it recognize freedom of religion?
Yes.
It used to. I'm not so sure anymore.
Thanks, Lene.
Thank you.
Chris Fisher.
Hello, my name is Chris Fisher. I'm from the Hudsonville area. Nice to see you all here tonight. It's been a long day. I grew up in this area. I have 6 kids, college, high school, elementary. I bought our first building to do some work here from Mr. DeYoung back there. I think he remembers that. Love this area. 2012, moved my family to Uganda. did work there for kids. A lot of corruption in Uganda. A lot of corruption. Saw it firsthand in the government offices, the way they treated kids there. Left Uganda, came back to Texas. Was missing our family with my 6 kids, wanted them to be around grandpas and grandmas and their cousins. So brought them back to Ottawa County, thinking, let's go bring them back to those values that I remember as a kid. Now I'm here in this room talking to you about a mask mandate. You've heard all the data, you've heard all the science from your doctors and from all of the others that came here with their science. I'm going to read a passage. Jesus said this to them. If God were your father, you would love me, for I have come here from God. I have not come on my own. God sent me. Why is my language not clear to you? Because you are unable to hear what I say. You belong to your father, the devil, and you want to carry out your father's desires. He was a murderer from the beginning, not holding to the truth, for there is no truth in him. When he lies, he speaks his native language, for he is the liar and the father of lies. That's the devil. He's a liar. We don't want to listen to him. What's awesome about the Bible is he's got stories of redemption. Saul was following the devil. Saul killed people, but then he saw the light and he became Paul. There's always time for redemption. There's always time to do the right thing. Please do it.
Ryan Schmidt.
Hello, my name is Ryan Scott. My wife Katie and I, we live in Jenison, Michigan. We have 4 children that are in the Hudsonville Public School District. We don't agree with the mask mandates passed down by your health department. It removes the rights of parents to decide what's best for their families. We are asking you to draw a resolution that rescinds the mask mandate or to throw your support behind a resolution that rescinds the mask mandate. Furthermore, if the Ottawa County Department of Health refuses to rescind the order, she must be fired immediately. We don't want your sympathy. We don't want your empathy. We don't need you to tell us that you understand how we're feeling. What we need you to do is to act and restore freedom in Ottawa County, or we will vote you out. Thank you.
Thanks, Ryan. Who's next?
Rachel Van Houten.
Good evening, gentlemen. Thank you guys so much for being here. I know it's been a long night for us all. I don't have a big speech laid out. This is coming from my heart. I need to know that there's compassion still in this world. To watch my 4-year-old daughter put on a mask and see the light drain out of her. The one that lights up a room, hides at a table, coloring. Her teacher will never know how she actually is because she's covered in a mask. That's not my kid. My 6-year-old comes home from kindergarten last year in tears because she doesn't understand what the teacher is saying. She got behind on things, and it's frustrating to watch her come home and emotional. She gets it honestly from her mom, but there's got to be more compassion in this world than what there is right now. There's a lot of hate. There's a lot of people fighting against each other when we need to be pulling together and doing what's right for these kids. Unmask them, please. To watch the light drain out of all of these kids is heartbreaking. It's hard. Please do what you can in your power to never let this happen to another set of school kids coming in next year. End it now while you still can. Thank you.
Candy Cracker.
Hey guys, you guys are having a rough day, but you know what? Doesn't compare to what's going on out there. Doesn't compare. You are torturing these families and you should be ashamed of yourself. Jesus said in the Bible, he says, if you harm a child, if you bully them, if you torture them, if you torment them, you're going to have a millstone hung around your neck and you're going to be thrown into the sea and destroyed. Do you remember that Bible verse? What you're doing is exactly that. You are hurting these families out there, and you should absolutely be ashamed of yourself. I've been told by one of the commissioners that your hands are tied because the health department made this decision without your approval, and it got out there, and oh, you guys are in such a bad position. What is going on here? Where is the leadership? What kind of a board is this? I've served on boards with some of you guys. This is ridiculous. This stuff is going out, and you don't even know. It's pathetic. Absolutely pathetic. This person, whoever it was, should be reprimanded big time and or fired. Al, you've done so much for this county. Love you to pieces, but I was also told that you let this information go without consent of the board, and you should be reprimanded, sir, and or fired. I've also been told that the attorney gave this advice by one of the commissioners. Oh, really? This is advice only. You guys have to use your minds to figure out if this is the right or wrong thing. This is advice only. He's a contracted person. Again, you're the board. Step up. I've also been told by two of you, that you think that this should be the parental right to choose. So would either one of the two of you, without pointing you out, just stand up right now and say, I would like to make a motion to rescind this, to have a discussion. Let's put it on the table and talk about it. Right now, one of you, maybe one of you could do it and one could support. Do I hear anything? Yeah, that's kind of what I thought.
Thanks. Who's next?
Carrie Hewitt? I can't tell if it's a Carrie? Is it Carrie or Casey? Kaylee?
Yes.
Oh, sorry.
That's okay.
Couldn't tell that letter.
That's okay. Goodness, okay. My name is Kaylee Kivit. I live in Jenison School District. I have 4 children, 1 in junior high, 3 in elementary. All were affected last year by this mask mandate. Well, it was hard for all of them. They had different experiences. It affected my elementary children the most, who were at the mercy of teachers and a principal who forgot what it was like to be a child. They cried themselves to sleep for about 2 months until we made the decision to pull them and found a private school where they could breathe freely. Let's talk about what coming together looks like. Coming together is not coming to a one-sided solution, such as a mask mandate. We are here today specifically about the mask mandate, but also for any future mandate that is on the brink of being rolled out. As you know, this is complicated. Masks bring security to some, also trauma to others. That's why choice is so absolutely critical. Perspectives are formed on information we take in and experiences that we have. To project our own experiences onto others is a form of manipulation and abuse, no matter what side you are on. At this point, I think it's safe to say that we've all seen or at least heard of scientific data that contradicts the other. This is not a one-size-fits-all. Today, I stand before you, recognizing that in this building, we have full unique experiences different from everyone else's. The most community-minded thing we can do, is to stop projecting our perspectives on each other. A mandate of any sort forces a specific perspective onto others. It is abusive and manipulative.
Thank you, Kylie.
We urge you to drop the mandate immediately. Thank you.
Was the last one in that group.
That's the last one? Okay.
That group.
We're going to take just a 10-minute break. again. Okay?
Matthew Jones.
Becky?
Matthew Jones.
Okay, Matthew.
Matthew Jones, Allendale, Michigan. Gentlemen of the County Commission Board, I appreciate you giving us the opportunity, and you have given us a lot of your time today, and we really appreciate that. I am not here as a public health expert, but as a retired Master Sergeant for the United States Army, I am here as an expert on two things, and that's tactics and leadership. First, I'm going to cover tactics. Battle Drill 4 covers a near ambush and how we are supposed to respond to a near ambush. Outside, there's a lot of passion, there's anger, and unfortunately that has been directed here at the board. Some of it is misplaced anger, and I will admit to that. But you have to know that Battle Drill 4 tells you when there's a near ambush, you face the enemy and you assault through. The actions of the health department last Friday to release this mandate the week before all of us go back to school was nothing short of a near ambush, leaving us parents and the school boards no other choice but to face the enemy and assault through. Now, I stopped short of calling anyone the enemy because we are all Americans. We are all on the same side. But this is the fight we're currently fighting. The other side that I'm an expert on is leadership. I've spent 15 years in peacetime and combat leading soldiers. And I can tell you that leadership takes courage. And sitting here today, facing this onslaught takes courage. We will admit to that first off. So thank you for having that courage to sit here and take what is coming. But also being a leader takes courage to fight against what doesn't make sense. Soldiers are not just trained to take orders. We're trained to understand when things don't make sense and to adjust appropriately. So I've sat in your seat just yesterday, listening to the people we represent come to us and say, why is this happening? So as I represent them, I'm coming to you because you represent us. I understand you didn't make that decision. However, as our elected officials, it is now on you to help us in this fight. We are not in the middle of a public health crisis. We're in the middle of a public trust crisis. And gaining that trust back is not incumbent on the constituents. That's incumbent on the government who lost it. Thank you for your time, and I pray that you fix this.
Joe Moss.
Hello, Commissioners. I'm Joe Moss. I live in Hudsonville. I am a husband and a dad of two beautiful kids. I'm a business owner, and I'm the president of Ottawa Impact. I am amazed at seeing how many people came out today. Looks like there was about 1,000 people out there, 140 giving public comment. This seems to me like a huge opportunity for you guys. An opportunity to lead and to bring our county and our community through a very divisive time. You've said your policy is about 50, or your constituents are about 50-50 on this forced masking issue. Well, your policy, or the policy of the health department that you directly oversee, is a 100-0 type of policy. It's not balanced. So I would implore you, take the huge political win and reset the balance to something that looks more like 50-50. Now, to everyone who came out today, I'm here with a different message for all of you. And that message is never give up. Do not stop fighting for your kids. Do not stop coming out. And do not stop letting your voice be heard. Because if you do, you know what status quo that you will get. Thank you. And thank you for giving us so much of your time today.
Who's next?
Sergey Petrenko.
Sergey Petrenko. I live in Jenison. I grew up in Soviet Union, and I remember life in Soviet Union very well. What you're doing today is a lot worse than what I experienced when I lived in Soviet Union. You guys royally screwed up today. You could have been heroes. Tyranny. You could have not funded this department that is being tyrannical to residents of Ottawa County. You are psychologically, narcissistically abusing our children. We won't let you do that anymore. You paid for tyranny. You guys are the ones destroying America. You crossed the line when you started messing with our children. We have gathered a petition through Ottawa Impact, and it started at 11 o'clock on Sunday, and we have 6,100 pissed off people. You do not deserve the seats you're sitting in, some of you. And we will be recalling you and replacing you with patriots. We will do things legally. Constitution is on our side. Constitutional sheriff is on our side. And we will throw those people out of these seats that do not uphold the Constitution. Do yourself a favor, do a shortcut and resign. It'll make your life easier. We will restore the Republic, and we'll take the seats away from those people that don't deserve them. Thank you.
Thank you.
Sandy Benton.
Hi guys, Sandy Benton, Spring Lake. As Sergey said, we started a petition yesterday. Today we have 6,000 signatures of people claiming and expressing that they don't want masks on our kids. And I come here, I just ask you, who do you serve? The health department, the governor, or the people? We're paying tax dollars now to schools we don't even want our kids to go to anymore. And we live in a county, one of what, 4 maybe, that is exercising tyranny over families and children. For a long time, we suspected that this Republican-led board aligned with the state, and this was confirmed by Ottawa County's attorney at the October 27th, 2020 meeting. Mr. Van Nessen told you commissioners that I have been in direct contact with the Attorney General's office and the governor's office, and they wanted you to know that we are well aware of the nature of the Ottawa County community, and they appreciate Ottawa County's willingness to stand with the rest of the state. End of quote. I'm going to go now into, I'm editing on the fly, and I want to go into the Republican preamble, the Republican Party preamble, because 10 of you are Republicans. And I'm going to just take excerpts to remind you. We believe in American exceptionalism. We affirm, as did the Declaration of Independence, that all are created equal, endowed by their Creator with inalienable rights of life, liberty, and the pursuit of happiness. We believe in the Constitution as our founding document. We believe our constitutional system, limited government, separation of powers, federalism, and the rights of the people must be preserved uncompromised for future generations. We believe that people are the ultimate resource. That's people are the ultimate resource, and that the people, not the government, are the best stewards of our country's God-given natural resources, the natural resources being the people. The Democratic Party have abandoned their promise of being accountable to the American people. That's the Republican Party's words, not mine. They refuse to control our borders, but try to control our schools, farms, businesses, and even our religious institutions. We, as Republicans and Americans, cannot allow this to continue. That is why the many sections of this platform affirm our trust in the people, our faith in their judgment, and our determination to help them take back their country.
Sandy, you're done.
Thank you. Commissioners, respectfully, we conservatives elected 10 of you who ran as Republicans to stand with the residents of Ottawa County, not to stand with Michigan's Democratic governor, and not to stand with Michigan's Democratic Attorney General. Thank you.
Just come to the microphone.
Good evening. Thank you for bearing with us through all of this. My name is Dawn Beitenheis. I live in Grand Haven, Michigan. I work for the Grand Haven school system. I just can't wrap my head around this. Children are not at risk. You've heard it over and over again. We know the statistics. They have a 99.997% survival rate. They are not at risk, but we do know the harm. I've seen it firsthand in the schools. You've heard it, excuse me. I've sent you emails listing all the studies that show the negative impacts that these masks are having on our children, our babies. I walk out of that school almost every day crying from what I see. It's not fun. I had a medical waiver to not wear a mask because I walk out with a headache every day. It was denied. It's not fun. But I continued to show up for those kids
because I know that I was a bright spot in their day. I'm a reading assistant, so I help those that need extra special help. I have seen they cannot hear and understand with masks on. There's miscommunication from the teacher and from the students to the teacher. We know that 73 to 90% of communication is body language, with 90% of that being facial expression. We're not seeing that with the mask on our face. Masks reduce social interaction. I used to walk into school being energized by the energy of those kids. Walking in those halls last year, it was silent. We're talking 7th and 8th graders that are quiet. That's not normal. We used to teach deep breathing because there was a big mindfulness push. We know that oxygenated brains think better. We're depriving these kids of the needed oxygen. They have reduced cognitive function.
Thanks, Don.
Yep. Liberty,
Who's
the
that?
state of being free with society.
Sylvia
From oppressive
Rodea.
restrictions.
Who is?
Where's our liberty?
Sylvia Rodea, not
Okay,
sure if
so-
she's here though. Madeline Bullheis.
Hi, my name is Madeline Bullheis, and I attend Rosewood Elementary. I have asthma and had a serious asthma attack about 2 weeks ago. My mom had to bring me to the doctor just to get me another spacer for my inhalers. I take them every day, multiple times a day. I have 3 questions. 1, were you mindful that other schools don't have AC and that the masks are hurting me and others just like me as we struggle to breathe? 2, what about the CDC, who is telling you how to take care of me instead of my mom, dad, and family? They don't even know me. They haven't been at my doctor appointments or hospitals with me. They say that we can get what my mom and dad call an exception, so that I can breathe and not have to wear my mask. But they were lied to. My doctor's office said that they can't do it anymore because the CDC sent a letter saying that if they did, they would risk their license to care for the other kids. Why are they scaring the ones who are helping me, my brother, and others who need them? Why are you letting them do this? 3, why are you forcing masks that hurt us while they keep lying to us? The masks are not even the strong ones. That could protect us. I have a tight chest today, more than the days before today. My mom and my brother and I walked all the way in from the long street at the 4-way stop to come and talk to you. Why are you not listening to these parents and adults who are protecting me and fighting for us? Maybe you will listen to me. I may be small, but I am fierce. God chose me for this time and made me strong in Him. God chose my parents to be my parents and trust them to care for me. God chose every one of us for a purpose. We are all unique and special and have different needs. I am not a one-size-fits-all this. This is a parent's choice only. If you won't listen to my parents, all these parents and adults here trying to fight for me and others like me, thank you. Keep fighting. Don't be discouraged. Please, I beg to hear my heart and listen to me. This is wrong. You are hurting me. Can't you see the CDC and health department is tricking you into hurting me and all the kids out there just like me? They don't want you to know what's really happening. I pray for you and everyone. We are all the same leaf from different branches of the same tree. Please, I beg you, unmask us and stop hurting us. I didn't come here for you to ignore me. I came here to share our voices and my light to make the God-given rightful change.
Thanks, Madeline.
Caitlin Bullheis.
Hi, I am Madeline Bullheis's mom. We reside in Jenison. She goes to Rosewood Elementary, as she said. And I'm speechless. There's nothing else I can add to what she said. That is clearly the Holy Spirit working through my daughter, as we were supposed to go to the zoo today. So with that being said, I, as her mother, a taxpayer, a citizen, I demand that these mask mandates be rescinded. Free our children. I am her mother, okay? These parents know, and this is taking away our rights. And God entrusted me to be her mother, and my job is to protect her. And I want her to have that family and those friends and those events and be there. And you guys are the ones that can enable that for our children. And those that want to have the masks, that's okay too, but at least get them the masks then that actually protect them. I'm just speechless. I didn't know as much as what she was going to say, and I'm not a public speaker. So thank you for your time, and God bless. I will continue praying for you all. And this just shows our children, God's children, not even ours. She is his. My son is his. Nothing will take that away from me. Please
Thanks,
make the
Katie.
change.
Thanks. Who's next?
Denise Rewersma.
Want to say that first name again?
Denise
Denise.
Rewersma.
Who's next?
Okay. Ronnie Allen.
Hi, this is Ronnie Allen from Allendale. I've been coming to these meetings and speaking out against the mask mandates for a few months, whether on Zoom, I've been there listening, sometimes talking. And I've become a bit cynical. I am actually kind of cynical by nature, so I was a little cynical that anything was going to happen, and I was right. I wasn't wrong about that. When we got close to school starting, it was like, oh, here it comes, and it didn't surprise me. One thing I was surprised by, though, when I drove up today after work, I actually wasn't planning on getting here, but I was able to. So that's why this is kind of thrown together, was just the numbers of people that showed up. And I am just so grateful for that. To Ottawa County, to the people who showed up today, it floored me. We, the people, have spoken. Today, earlier, we heard the recent Ottawa County Health Department orders defended by hand-picked experts and lauded by elected bully pulpit leaders, not all, but some, it feels like. But the loudest voice, those of us who elected you, are hearing great numbers and greater voice. As parents who are experts specifically to our own kids, we've spoken out, and many are experts in our own fields. Whether you rescind the orders or whatever terminology you use or whatever I don't know all the semantics and logistics of it, to make this order go away, to deal with the people who put the order in place. Like I said, I'm not getting in the weeds on that, but it needs to be undone. There's no longer cover from the state that we're just doing what the state told us to do. There's no excuse anymore. And also to everybody who came, and I know most people are gone and everybody's tired, but
Thanks, Ronnie.
keep speaking out. Keep coming.
Kim Mull.
Kim?
Good evening. You know, I've been here all day, and I have been very diligently listening to all the moms and some dads, many grandparents. I'm sorry, I'm Kim Ma, Hudsonville. I'm a daughter of the king, and I'm a grandmother of 7. And I know I will not be silenced. But I've been listening to all these moms today. And I want them all to know I'm very proud of them. And I don't think my name is the one you need to remember. You need to remember Madeline's name. So go Madeline. She is our future. And I hope you'll think about that. One of the questions I had in the other room was, I'm sure that all of you who live here in Ottawa County, a conservative region of Michigan, I'm sure many of you are very familiar with a word from God, train up a child in the way they will go. And can you all repeat the end of it? And they will not depart from it. So I hope none of you have departed from the way that you were raised up by your own parents. I pray that your parents would be proud of everything you stand for and everything you do on a day-to-day basis that affects these neighborhoods and these communities. So I'm going to give you a little bit of this. I probably won't finish. Wisdom shouts in the streets. She lifts her voice in the square. At the head of the noisy street, she cries out. At the entrance of the gates in the city, she utters her sayings. Make your ear attentive to wisdom. Incline your heart to understanding. For if you cry for discernment, lift your voice for understanding, and if you seek her as silver and search her as for hidden treasures, then you will discern the fear of the Lord and discover the knowledge of God.
Thanks, Kim.
Thank you.
Kristen Jones.
Kristen?
Hi, my name is Kristen Jones. I'm a parent in Hudsonville. The first thing I wanted to say and wanted to bring up is the fact that some of you up there claim that this divisive issue is about 50-50. And one of you even claimed that 70% are for this mandate. I really want to know what kind of math you're using, because the fact that I am speaker number 140 something, and we've had maybe 4 or 5 people that came up here to speak in support of this mandate, this divisive issue is actually more like 0.003% that support this mandate to the 99.97 who oppose these mask mandates. We have proof here tonight that many of you are lying, and it is your job to take the first steps into fixing this. I want to reference School Code 38010, the rights of parents and legal guardians and the duties of public schools. It states that it is the natural, fundamental rights of parents and legal guardians to determine and direct the care, teaching, and education of their children. The public schools of this state serve the needs of the pupils by cooperating with the pupils' parents and legal guardians to develop the pupils' intellectual capabilities and vocational skills in a safe and positive environment. I want to read that one more time. By cooperating with the pupils' parents and legal guardians, not by cooperating with Health Officer Lisa Stefanowski or any other entity. Michigan Legislature School Code 38010 clearly states that the school must cooperate with the parents to decide the direct care of their children while in public schools. And that is obviously not happening because right now the health department feels that they can step into that role, and it's not right. I came here today to ask Ottawa County Commissioners to do everything in their legal power to work together and stand up for the will of the people and the districts that they represent to overturn the mandates issued on 8/20/21 and help us parents get the rights back to our children. Thank you.
Thanks, Kristen. Who's next?
Zachary Coster.
My name is Zachary Coster. I live in Hudsonville. First off, I guess I just want to start off with saying I really wasn't planning on speaking, but after seeing everybody here, I figured I would at least have a couple words. There's nothing I'm going to say that nobody else has said, but you guys poked the bear. You guys, whether it wasn't intentional, you guys started this, and it's not something that's going to just go away. So, I mean, I have to go and there's consequences for every decision that you make. And, you know, I got to go and apologize to my wife. I've got to pick up my 4 kids from daycare because I'm sitting here because I believe this is an important enough issue. And I got to unfortunately tell her that, you know what, I believe it's time for me to pull my kids from the public school that they went to today after seeing what I saw. And she's not going to be happy. And I poked that bear. And so now you guys are going to have to deal with that as well. And I got time and I'll deal with it. So, and I'm going to have to apologize. So I hope that you guys can do the same thing that I did, and I'll have to figure it out. But, you know, I'm going to take my licks and I'm going to deal with it. Thank you.
Who's next?
Andy Tuggle.
Sandy Tuggle, Spring Lake. As commissioners, you oversee the health department, and it's long past time to reel in this unelected agency. Your constituents are grown adults, but they're being treated as incompetent. School boards are also being treated as incompetent by mandating they change their policies that they thoughtfully spent the summer creating. As the health department mandated more restrictive rules than last year for lower elementary children. But meanwhile, in Grand Haven, there are 0 people in the ICU with COVID. What is going on? This does not seem to be at all about health. If it were about health, where's the guidance about boosting our immune systems? Where's the guidance about healthy eating? Is information and access to effective treatments being withheld from the public in order to support the emergency use authorization? MDHHS was given legal notice in March of 2021 about their false and/or misleading marketing claims for the COVID-19 vaccines. Our tax dollars are paying for these advertising claims that violate federal law. They have also been FOIA'd and were unable to provide the science they are using for requiring masks. I sent both documents to all of you on email today. Never before in America has the public been coerced into an experimental, liability-free medical procedure lured by donuts and lottery money. Over a year and a half into COVID, everyone should be able to make the choice as to whether we cover our faces or the faces of our children. Masking healthy children teaches them to fear their friends, fear their teachers, and fear that they may be spreading a disease that they do not have. The families of Ottawa County should be treated better than this. The behavior of the health department is appalling, and I ask you to remove the Ottawa County Health Director from her position. Please do whatever it takes to rescind the mandate to protect parental rights, and if you are unwilling to do so, I ask you resign from your commissioner seats. Thank you.
Thanks, Andy.
Dave Muma.
Dave?
Thank you for your time and attention. My name is Dave Muma, and I'm from Zeeland, Michigan. I haven't heard anybody actually make this one statement. And actually, Commissioner Garcia, I know you're from the education background. I do understand that. We've worked with one another in the past. I want to actually read you a mission statement from one of the schools in this county. They say, we, this staff, I'm going to remove that, commit ourselves to creating and maintaining a safe and welcoming learning environment. What I ask each one of you commissioners is this middle school has 5th through 9th graders. Your health mandate that you have allowed to continue incorporates half of those students have to wear a mask and half of those students do not. How is that a welcoming, learning, and safe environment? Maybe none of you had issues in middle school. Maybe some of you did. Middle school can be a really hard environment. The only reason I'm speaking today, I wasn't planning on it, but I actually do have a 6th grader. I have an 8th grader and a junior in high school. And my 6th grader was like, Dad, why do I have to wear a mask? I said, son, I'll do whatever I can. That's the only reason why I'm here. And I would ask that you allow the schools to actually have that environment that is part of their mission statement. That's what these staff members have committed to. Thank you for your time and your attention.
Brandon Holstedge.
Good evening, Brandon Holstedge from Allendale. I'm taking a little different angle today. Pray. Dear Lord, I pray for everyone sitting up here today. I pray for these words. I pray that these words spoke today linger in their minds and give them food for thought. I thank you for all of these fighters that came out today, fighting for their kids and families being destroyed. I pray you work in these men's hearts and lead them to do what is right and what has been proven to be the majority this afternoon. God bless these men and their families. And all God's people say, amen. God bless. Thank you.
Brett Kuipers.
My name is Brett Kuipers. I'm from Holland, 122 East 25th Street. Pretty incredible day today, actually. I came here early and had to leave to go to work, went through a rainstorm, made myself really wet, got back here and was surprised to be able to still speak. In a free country, that's a great thing to be able to say. I want to tell the board that it's a very simple choice, actually. I've heard a lot of people saying it's a hard choice. Freedom is not a very hard choice, especially when it accommodates everyone. When everyone can have their own freedom of choice, they can have autonomy over their own bodies. And I hope the weight is felt here on this board, not that I don't think it is from today, because it's been an exhausting day. But to force a child to wear something that is not good for their health is child abuse. It actually is on the HHS website, and their definition is any recent act or failure to act on the part of a parent or caretaker. Our caretakers are our teachers and our schools, which result in the death, serious physical or emotional harm. There's a lot of emotional harm going on. My daughter breaks down frequently over the masking and the situation of the last year and a half. An act or failure to act with which presents an imminent risk or serious harm. Not to act is to act. Not to speak is to speak. So if you do not act on this type of an issue, which is causing child abuse to children, you are implicit with it. Thank you for your time.
Thanks, Brett. Who's next?
Andrew Gearing.
My name is Andrew Grink. I think we're seeing the weaponization of the health department. Where are the case studies that prove masks in the classroom combined with behavioral science benefits the lowest affected of our population? Much like the King of England looking for the lords that would give up the keys of Scotland by using leverage, by granting them prima nocta. If the health department is weaponized by using you to strip the freedoms men and women fought and died for, by changing the environment our children grow up in as normal when it's not. Do your job, represent freedom. I hope we get some brave hearts up here, because there's been a lot of blood that has been shed for our freedoms. Thank you.
Mary Jane Gears.
Good evening. I have only 4 words to summarize 4 hours of speeches. Masks are unnecessary. Unnecessary. Masks are ineffective, abusive, and illegal. That's what I've heard the last 4 hours. Since I have 2 minutes, I'm just going to say those 4 words again, maybe again and again. Unnecessary. Ineffective. Abusive. Illegal. Unnecessary. Ineffective. Abusive and illegal. One more time. Unnecessary, ineffective, abusive, illegal. That summarizes masks. Thank you.
Ross Siegenthaler.
Good evening. Ross Siegenthaler, Spring Lake. I'm here to address some of the what I would call misinformation or I guess not proper terms or words coming from some of these public health officials particularly regarding the community education webinar that I attended last Friday via Zoom titled Answers from the Community Experts. As a father of 3 children who attend a local school here, I went to this webinar online to ask some questions on children and COVID-19. I was appalled at the lack of information provided and the blatant misinformation spoken by Dr. Jamison. You see, there is this term called informed consent, and I would hope you all understand what that means and the consequences of not providing it. Out of the 28 questions that were asked by all the attendees, I asked 19 questions. Do you know how many of my questions were answered? One question. That question that was answered was, what is the difference in a viral load between an infected vaccinated person and an infected unvaccinated person? The answer was 0. They're the same. Due to the limited time, I will only read a select few that fell on deaf ears, and I will provide what I think are facts as answers. Question 1, it's been 17 months. Can you please provide a RCT, a random control trial study that shows that masks do not harm children? No, because there is not one. Number 2, how many children were in the Pfizer vaccine trial for ages 12 to 15, and what were the percentages of severe adverse events? The trial results showed that out of 2,260 kids in the trial, 1,131 were inoculated and 1,129 were in the placebo group. There were 5 severe cases of adverse reactions. That's 5 severe cases of adverse reactions out of 1,100 children. The FDA's definition of a serious adverse event is disability or hospitalization. Number 3, does the spike protein stay at the injection site? Again, these were not answered. No, it does not. Recent autopsies show it travels into the cells, into the organs, specifically the testes and ovaries.
Ann Mowry.
Thank you.
Okay.
Hi, my name is Amy Mowry. I'm from Holland. I was not planning to speak today. I've been here since 1. I just came to be in support of all the parents that have been here all day long. But something struck me when I was sitting out there. And before I came here, I told my children that I would do everything I could. So I figured I know I personally emailed you guys a couple of times, but I just wanted to tell you about my experience because it hasn't been said so far. My kids go to a school that is a balanced schedule. So they've actually started August 9th. So we had our open house almost 3 weeks ago. And it was so great to go into the school. I haven't been into my kids' school for 18 months. I got to see where their classrooms were. I got to see the teachers. It's been rearranged so much in 18 months. It was amazing just to see families and to be in that community again. It was wonderful. There were a couple of families that were masked and that was fine with us. And then my kids got to enjoy 2 full weeks of school unmasked. And guys, they were so happy. It was amazing. And then yesterday they had to go to school and they were such troopers. But my 6-year-old daughter, sweet girl, big blue eyes, blonde hair, she was lethargic. And I asked her, I said, babe, why didn't you call me? Why didn't you tell me I'd come pick you up? She said, I just was nervous, Mom. I didn't want my teacher to, think that I didn't want to be at school. And it just breaks my heart. And so I kept him home today. And I don't know what I'm going to do tomorrow. I don't have a plan. I just know this isn't right for my kids anymore. We had COVID. We experienced it on many different levels, like a lot of people have, like a lot of you have. And I just know on the bottom of my heart that this isn't right for our kids. And I just please ask you, like I said in my email, please do whatever you can. I don't know what that is, but you can do what you can. And that's all I'm asking today.
Thanks, Ann.
Reginald Hanegraaff.
Good afternoon. I didn't want to speak today, but this subject hasn't come up, so I just wanted to bring it out. My father said that gave me sage advice many years ago, never complain to somebody that can't make a difference. I think it's been clearly established that you can, so I pray that you do that. What I want to talk about is the war that's raging right now, a war that you're not even aware of. It's a war not against for our minds, which is real, or war for world government or socialism, which is real, which this pandemic, as they say, is working towards. But it's a war that's happening right now in each one of you and myself. As I stood out shoulder to shoulder with other citizens in our community here, I was breathing the air and I was ingesting and bringing in through my mucosal system germs. And what was my system doing? It was recognizing which germs was not of me and which germs were of me. What was part of me, what was not part of me. It was looking, it was searching. It was diligently looking on defense. It's our mucosal system. It's one of our immune systems that is constantly working. We're not talking about that. We talked about the mask, the ineffectiveness about, we're not talking about our God-given immune system that is consistently working towards it. So I'm asking you, are you going to choose for man's mask or God's masterful design in our mucosal immune system that is constantly working? We should be building our immune system for our children, not putting masks on them. And I want to end with this. It comes from Psalm 139, verse 14. I praise you, Lord, for I am fearfully and wonderfully made. And we are fearfully and wonderfully made.
Thank you.
And Dan Vanderswag.
That's my father-in-law right there speaking on behalf of his grandkids. You with that diaper on your face, if he farted right now, could you smell it? That's how stupid this is. We're all playing games here with people's lives, and I'm sick of it. I represent all these hardworking guys that couldn't be here today to take off work to put up with this BS that you guys are putting down. And there's hell coming. There's hell coming, and I'm not doing it to threaten anybody. But there's a lot of good guys out there ready to do bad things soon. Watch what's coming. These mandates are against the Nuremberg codes. The first one states voluntary informed consent. Are you a Nazi? What is it? They sent my dad off to Vietnam and fight for the country, but you're going to tell him to wear a mask?
Sir,
I appreciate the fact that I can't control myself. There's a lot of other guys that control myself, that can't control themselves.
Talk to me.
That's why they're not here right now.
Narrow somebody.
I have nothing else to say. Do what's right. There's a lot of bad things coming.
That's all the in-person public comment. We do have 11 current Zoom hands raised.
It's your pleasure, guys.
Let them speak.
All right. 2 minutes. Cut 'em off when they're done.
Allowed to talk.
Can you hear me?
Yes, you have 2 minutes to talk. If you could please state your name and address for the record.
My name is Kate Ritzma. I live in Jamestown. I am an Ottawa County resident. Here I am going to play a video of my 7-year-old daughter sobbing the other day when I told her she had to make a choice to go to school with a mask or stay home. I dare you to not cry. She is crying because she does not get to go to school and breathe freely. She is 7, and last year or last fall or spring, she had bacterial pneumonia. This is the 5th time in her 7 years of life that she has had pneumonia. She has asthma, she's had bronchiolitis, but I am not able to get a medical mask exemption because the laws are prohibiting these doctors to do such a thing. This is disgusting. And don't you dare tell me that you don't have a choice to make this go away, because you do. And your lawyer who you have is disgusting with his body language, and he should be fired. He does not deserve to be sitting up there with you men. And I thank you, Mr. DeYoung, Mr. Terpstra, and Mr. Meppling for standing up for us.
The employees. So,
No, I'm sorry, but Mr. Bergman, I am an anti-masker, and what you are saying about your constituents is despicable. You should be fired along with Tracy or whoever her name is that works for the health department. It's disgusting. And if you don't take this away, I am going to fund any lawsuit against you.
down in just a minute.
No, don't tell me what to do. I'm sorry. You can mute me, but I'm done listening to you.
All right. Who's next?
Alyssa Olson, if you could please state your name and address for the record. You have 2 minutes.
Hey, can you hear me?
Yes.
Okay. My name's Elisa Olson, and I live at 3113 Park North Drive in Jenison. Never in my nearly 15 years of being a mother have I ever thought I would have to speak out at a county commissioners meeting, fighting for my children's right to breathe fresh air. This last mandate for the children ages pre-K through 6th grade is absolutely absurd, and the timing of it was underhanded, shady, and calculated. I ask that you review the CDC data shared by Tom McMillan, who is a State Board of Education member. The data shows that unvaccinated kids are at much less of a risk from COVID than vaccinated adults. I also ask you to look at the Ottawa County's dashboard for COVID-related data. As a county, we have still seen 0 COVID-related deaths in children ages 0 to 19 of age. Overall, number of deaths have also been trending downward since this past December, as stated on the dashboard. In June, there were 13 deaths. In July, there were 4 deaths, and in August, there's only been 2 deaths so far, and none of these have been in kids that this mask mandate affects. I'm sure there are untold numbers of children suffering mental health issues as a result of being masked last school year for nearly 40 hours per week, my own children included. The data does not support masking our children for yet another school year. We did it and complied last year, and I refuse to allow it to continue to happen again this year. I hope you have all seen the data out there that simply does not support that homemade or even store-bought masks as being effective against COVID. Since the virus itself is so much smaller than the fibers and weaves of such a mask, it's like throwing sand through a chain link fence. As our elected county commissioners, I implore you to vote to reverse this unconstitutional and unnecessary mask mandate that the Ottawa County Department of Public Health has set into motion.
Thank
Please.
Who's next?
Gabby, could you please state your name and address for the record? You have 2 minutes.
Yes, can everybody hear me? This is Gabby Manalash.
Yep.
Okay, perfect. Thank you so much for your time. I've been on this Zoom call for, since 1:30 this afternoon, so I've heard everybody and I have seen everyone on the video. I'm a resident of King County and moved there in 1985, so it was quite a long time since I grew up there as a child. But I wanted to introduce myself because, you know, I did see the 2 pediatric infectious disease physicians on at first, and there are others who would strenuously disagree with their testimony. So I've been a licensed Michigan attorney for 16 years, specializing in federal law. For the past 8 years, I have worked at one of our most prestigious national laboratories. It's actually the national laboratory that has devised and marketed and distributed many of our therapeutics for COVID. So one is actually just on the verge again of being approved, and it has been successful in treating tumors in dogs, and they have found it to also be successful in treating COVID. So there are a lot of therapeutics out there, if they would be prescribed, that would keep people from ever having to get on a respirator. I'm also a congressional candidate over Michigan's District 3. More importantly, I'm a child of immigrants who came to the United States legally, escaping communism under President Ronald Reagan's regime.
Yeah.
I'm also a mother to a 9-year-old daughter who's a 4th grader and had a classmate of hers in her school yesterday faint, pass out because it was so hot and there was no AC on in the building. I'd like to tell you something that I've been hearing that really concerns me a lot as an attorney who's been practicing federal law for 16 years. I cannot believe that American citizens are not being given medical.
Yeah. I don't remember what county she was from, not Ottawa County.
Kent.
Kent, okay. All right. Who's next?
Aileen?
Aileen? She's muted yet.
Yeah, I have asked to unmute, but she's not unmuting.
There she is. Okay.
Aileen?
Yes.
Hi, if you could please state your name and your address for the record. You have 2 minutes.
I'm Eileen Vandersher. I live at 12291 92nd Avenue in Allendale, Michigan. I support the mask. I feel that it's important that we care about our neighbors, about the people that are more vulnerable, and that children are carriers to the older population, even if they don't get sick. But with this covariant, the rising, they are showing that children are more at risk with the variant than the original COVID-19. Thank you.
Thanks, Eileen. Who's next?
Elizabeth, if you could please state your name and address for the record. You have 2 minutes.
Hi, my name is Elizabeth Flandreau, and I'm a resident of Allendale. I have 3 children, ages 9, 4.5, and my youngest one would have turned 2 a couple of weeks ago. As a parent of a deceased child, I want to let you know that no matter how low the risk is, any risk is too much for our child. If 1% of kids who get COVID get severely ill or die, that's great if you happen to be in the 99%, but if you are in that 1% or that 0.1%, it doesn't matter that the odds were very low. What matters is that you lost your child. And wearing a mask is such a small inconvenience to protect our children. I imagine that decision was very difficult for the health department to make, especially since you guys have been experiencing such vitriol from anti-maskers. And I want to let you know that I support the mask mandate. My 4.5-year-old happily wears her mask all day at school. And some of the other problems that people have brought up in terms of air conditioning or not having the right masks and things like that, those are separate problems that we should absolutely look into solving. But the problems that they're listing are not problems with masks. We should get air conditioning and use disposable masks that can be replaced if children are making messes on them. And all of that is such a small price to pay for saving any of our children's lives or future livelihoods. Thank you.
Next.
Kendra, if you could please state your name for the record and your address. You have 2 minutes.
Kendra, do you need to unmute yourself? Okay, let's go on to who's next.
Okay. Deanna, if you could please state your full name for the record and your address. You have 2 minutes.
My name is Deanna Hunter, and I'm a resident of Allendale in Ottawa County. And I am not against masks. I'm actually for masks, but I'm against the mandate to use such masks in the hospital. In order to properly apply a mask, we're supposed to wash our hands, apply our mask, and then after we're done touching our face in our mask, we wash our hands again before we're going to potentially contaminate something. And we are not to touch our mask because it's contaminated as well as our hands until we intend to take it off. So we wash our hands, we take our mask off, and then we wash our hands again because the mask is contaminated. Now, I want you to think about the age group that's being mandated to wear masks, which is 11 years old and under. I want you to think about the effectiveness of that and how kids do not do that. They don't even typically wash their hands after using the bathroom. So we're asking them to do a very adult thing with no training when adults have a hard time putting on a mask and not touching it. So I just want you to think about how this mandate is affecting these young kids And the force of putting them on our kids and what it's actually doing, is it really being as effective as it should be? So my kids will be returning to school with masks, even though they're over the age of 12. My youngest is 12, because I want them to wear masks and they are properly trained by me to wear an FDA approved mask. I don't care if the person next to them is wearing a mask or not, just like the lower grades. It shouldn't matter. My mask is protecting me. My kids' mask is protecting them. They wear it because I have chronic lung issues. So they're willing to wear it for me, which I appreciate. But we shouldn't be forcing masks on anybody. We should be encouraging it, but not forcing it. That's all I really have to say. I just want you to think about what we're doing to our kids and giving that choice back to the parents, because it's such a big responsibility to wear a mask properly and safely and not contaminate everything. Slapping a wet mask on the desk is not preventing COVID from spreading.
Thanks, Dana. Who's next?
Dan, if you could please state your full name and full address for the record, and you have 2 minutes.
Thank you. Can you hear me?
Yes.
Can you hear me okay? All right. Dan Winarski, 7788 Canary Lane, Jenison. 9 out of the 11 of you commissioners keep claiming your hands are tied and that the health department can do whatever it wants with the COVID mandates. That is simply not true. You can remove the mask mandate today if you have the courage to do so. The question is, do you have the courage? All of you commissioners, ask yourself this: does the government have the power to mandate political speech? I ask you again, does government have the power to mandate people to make political speech that they do not agree with? Because that's exactly what face masks have become. One political party has adopted them as a symbol of their COVID political agenda. Face coverings are a political statement that says you submit to that party's political agenda. So right now, today, any one of you can make a motion from the floor ruling that mask mandate is unconstitutional because it mandates political speech. I know the chair said he would block motions from the floor earlier, but you can challenge the chair right now. Any one of you, that is your right as a commissioner. So today, you commissioners can repeal the mask mandate right now. Make a motion to declare it unconstitutional political speech. If you do that, you can repeal the mandate today. Do not force our kids to wear a political symbol. Make the motion today. Before you close the meeting, say, Mr. Chair, I would like to make a motion. Thank you.
Thanks, Dan. Who's next?
Alicia, if you could please state your full name and address for the record. You have 2 minutes.
Alicia, you need to unmute yourself. Okay, who's next?
Kathy, if you could please state your full name and full address for the record. You have 2 minutes.
This is Kathy Seaver, 10721 52nd Avenue in Allendale. I would like to express my support of the mask mandate for public schools grades K through 6. We are in the middle of a pandemic with rising cases of COVID-19 due to the Delta variant. The CDC, the FDA, and the World Health Organization all show that wearing masks indoors helps control the spread of this virus. With the Delta variant, there are more cases in children than there have been with previous variants of this disease. It is imperative that while we wish for normalcy, we recognize that this virus has not gone away. I would not like to see another 600,000 people die by this time next year because we are not willing to do everything we can. This is not political. Thank you to the health department for making the mandate to protect our children and the greater community. Commissioners, I am asking you to uphold the decision made by the health department. Thank you.
Thanks, Kathy. Who's next?
Kathleen, if you could please state your full name and full address for the record. You have 2 minutes.
Kathleen, there you go. You need to unmute yourself.
I think I accidentally muted her now.
Okay.
Oh, there she goes. Okay.
There.
Hello,
Hi. You're
My
on.
name is, sorry, go ahead.
Give us your name and address, please.
My name is Kathleen Lucas. I live on Byron Road in Zealand Township, and my children attend Hudsonville Public Schools.
Okay, you have 2 minutes.
I would like to begin by apologizing to the board for the threats, the screaming, and the abuse you have had to endure for the last several hours. Thank you for giving me the choice to be heard here today via Zoom. This is a great example of personal choice. I do not believe the same choice should apply to masks in schools. The science does not lie. Masks are effective. Masks do not harm social, emotional, or physical health. There are multiple peer-reviewed scientific studies that prove this, regardless of whatever made-up science has been presented today. And I'd be happy to share these with you. However, masks are effective only when worn by all parties. When the poor choices of another party puts the rest of the population at risk, it should no longer be a choice. Are drunk driving laws government overreach? Are indoor smoking laws government overreach? No, not when the lives of the general public are at risk. In our district this year, there are no learning cohorts. There is no social distancing. There is no vaccine to children under 12 that is available. Without a mask mandate, there is zero protection for children against COVID. Children's lives are at risk. Children's rights to a safe learning environment are violated without a mask mandate at this time. I heard over and over today that, quote, maybe only 1 or 2 children will die, end quote. I am appalled by the number of people today who refuse to make any small personal sacrifice to even maybe save the life of 1 child. I'm sure the board would not make such consciously cruel choices. Even if we look past the 1 or 2 lives of children that will be lost, long COVID is also affecting the lives of children. Did you know that AAP is now recommending that any child exposed to COVID undergo an EKG to assess the health of their heart prior to returning to playing sports? For all the screams of trauma due to masks, would it not be far more traumatic for children to lose the classmate and potentially even feel at fault for that loss if they tested positive around the same time? Barring a true medical condition, children only have issues with masks when they are taught to have issues with masks. Parents who do not like the mask mandate do have a choice. They have the choice to enroll in virtual school or to homeschool. Thank you.
Thanks, Kathy.
Sylvia, if you could please unmute yourself and give us your full name.
So Sylvia spoke already today?
Okay.
No, I didn't. I had to leave to go get my child.
Okay, all right.
Your full address, and you have 2 minutes.
Okay, thank you. My name is Sylvia Rohde, and I live in Allendale, and my address is on record. Freedom is our default. The Constitution is our default. Individual freedoms are not suspended in times of crisis or speculative crisis. We are not ruled by the common good. We do not lay down the individual freedoms of our children, our schools, our churches, or our businesses, or we will welcome tyrannical oppression for all. Apart from Christ, freedom is the best, brightest hope for man and nations. Freedom is woven into our hearts and our history by our Creator, as evident throughout Scripture as courageous men and women interposed on behalf of God's people in the face of tyranny and oppression. People of faith led the charge in freeing our nation from Great Britain and establishing our nation on principles of natural law, recognizing our natural rights given to us by our Creator, among those being the right to life, liberty, and the pursuit of happiness, and the right and responsibility to direct the care and upbringing of our children. Why do the people of Ottawa County rise up in the face of tyranny, of masking little children, of overriding parental rights, of seeing the beginnings of a repeat of freedoms lost in 2020? The desire for freedom and truth, and the knowledge God gave us the responsibility to raise our children, is deep in each of our hearts. It is no wonder the schools of this county are being inundated with religious exemption requests when masks go against everything inside of us. In 2020, we didn't know anything about this virus and we accepted caution, but now we do. There have been 0 deaths in children ages 0 to 19, while we deprive them of childhood and teen experiences and watch their mental health and suicide risks skyrocket. We pray you will find courage and interpose on behalf of the people and uphold your oath to the Constitution. The only thing necessary for the triumph of evil is for good men to do nothing. Today, you have not only done nothing, you voted for $2 million of tyranny. Tyranny is not our default. It is our duty to remove leaders who promote it.
Who's next?
Shelby, if you could please state your name and your full address for the record. You have 2 minutes. Shelby, I'm sorry, Shelby.
Shelby, yeah. My name is Shelby Visser. I live on 10859 Blair Street in Zealand. I'm a farmer and a mother of 2 young kids. I'm here today like everyone else because I care for my kids and the life they are growing up in. I have been with my kids almost every day of their life. I know what foods they like. I know what they don't like. I know what stuffed animals they need to sleep with. I know what they need. I know when they have allergies. I know if they have colds, and I know what medicine works for them so they feel better quickly. I have earned the right to care for my children, and no one else has. The government does not have the right to tell me how to care for my kids. We have the right to care for our children best. If I believe my kids shouldn't have a mask on, that's my right. I urge you to repeal your mandates trying to co-parent with us. That is not your job. It is your job to defund the health department and fire who needs to be fired. This is our job to parent, and we have this job handled, so do yours.
Thanks, Shelby. Who's next?
Cadence, please state your name and your full address for the record. You have 2 minutes.
Yep. Hi, my name is Cadence Siegenthaler, and I live in Spring. Began. I would like to refer to a community education webinar via Zoom that was titled Answers from the Community Experts. There was Dr. Jameson who said, in terms of what's in the vaccine, he said there is salt, water, sugar, fat, messenger RNA, and that's it. There's nothing more. Well, unfortunately, that is completely wrong because he forgot to add that there is a polyethylene glycol, or PEG. It's used in a number of household products like toothpaste and shampoo, and increasingly in pharmaceuticals. Some experts believe that people previously exposed to this PEG may have high levels of antibodies against PEG, which puts them at risk for anaphylaxis when receiving it in the COVID vaccine. A 2016 study found that as many as 72% of people have at least some antibodies to this PEG. This is a possible explanation for the high overreactive of note. The design of both the Pfizer and Moderna vaccine trials excluded people with history of the components of COVID-19 vaccines. Your experts either purposely suppress the information or they're very uninformed. Either way, they are spreading dangerous misinformation by not supplying parents and the public with complete and truthful information, making informed consent possible. Thank you very much.
Thank you. Who's next?
Teresa, if you could please state your full name and full address for the record. You have 2 minutes.
Hi, my name is Teresa Patiu. I'm a mother of students at Allendale Public Schools. I'm speaking out of deep concern for the safety of the children being required to wear masks. According to the CDC.gov website, mask wearing comes with great responsibility. According to the CDC.gov website, for mask wearing to be both effective and safe, specific protocols must be followed. I'm going to list a few of the CDC published protocols and ask specific questions. I will be emailing them as well with hopes for a response. The following 6 protocols from the CDC.gov website pertain to mask handling. These safe mask handling protocols in use will be happening at school where parents are not in attendance to observe and monitor their child's behavior. CDC published protocol number 1, do not, capitalize for emphasis, touch a mask when wearing it. CDC published protocol 2, to remove a mask, handle the mask only by the ear loops or ties. CDC published protocol 3, do not touch your eyes, nose, or mouth when removing and washing hands immediately after removing. My first question is, what measures are in place at the school? Responsibility of the teacher to ensure these protocols are being followed. If it is the teacher's responsibility, please confirm if the teacher or the school is assuming the risk and liabilities associated with the safety protocols published by the teacher or not copied by the children through school supervision. Also, if it's not the teacher's responsibility, risk and liability.
Closer to your microphone.
I'm sorry.
You need to be closer to the microphone.
Okay. I apologize. Also, if it's not the teacher's and school's responsibility, risk, and liability, please confirm if it's then the child's. CDC published protocol number 4, Be sure to wash your hands before putting on a mask and immediately after removing a mask. My second question, what procedure has been put in place, especially in the lunchrooms, to ensure that kids are washing their hands after removing their masks and then again their hands before putting the mask back on? CDC published protocol number 5. If your mask is dirty or wet from sweat or saliva, remove it and keep it in a sealed plastic bag until you can wash it immediately. Wash it to prevent them from becoming moldy. Wet masks can be hard to breathe through and are less effective than dry masks.
Thank you, Teresa.
Denise, if you could please state your full name and full address for the record. You have 2 minutes.
My name is Denise Ruersma. I'm at 17574 16th Avenue in Coopersville. Parents are fighting for the mind, hearts, and souls of their children. And as a grandparent, I stand alongside them. If parents aren't allowed to protect their children, who will? The schools have let parents down. The government has let parents down. They are frustrated and they need to be heard and they need action from you. These people here voted for you. They expected you to have their best interest in mind. Apparently, there's someone else pulling your strings. I saw how this affected my grandchildren, and it broke my heart to see the unnecessary struggles they went through and also their parents. How is it that these young children are the ones being masked when they are the least affected by the virus? This makes absolutely no sense. Parents have every right to decide how to raise their children. Your parents were able to choose how to parent you, and you chose how to parent your children. Now give these parents the respect they deserve to parent the way they want to. Masks are their choice, not yours to impose on their children. You are telling parents they are not smart enough to know how to parent their children and that you know better. Would you or your parents have stood for that? I think not. Let's get back to our roots. You need to tell the Ottawa County Department to rescind this mandate and let parents parent. You say there's nothing you can do. Then why are you on this board? I sat on a board. I know what it's like to be behind in those seats. But you know what? We listened to the people that were on the other side of that table because they're the ones we needed to answer to. Do your job. Thank you.
Thanks, Denise.
Dina, if you could please state your full name and full address for the record. You have 2 minutes.
Hi, Dina Machinsky, 1381 Stutters Pass, Zeeland, Michigan. I am just listening here, and I just want to thank you, Health Department and commissioners, for all you've been through. My oldest son has a cognitive impairment, moderate cognitive impairment, and he understands why he needs to wear a mask. He understands it's to keep everyone safe. He understands that he needs to do it, and he does it with ease. He cares more, and we all care more about our brothers, our sisters, and our community. And we are pro-maskers because we know and trust the science. This is no political agenda, guys. This is our kids' lives. And I just want to thank you guys for doing your job. And I'm so sorry you guys are being put through this. But I do believe that pro-masking right now is the best thing to do for the safety of our children. Thank you.
Thank you. If you could please state your full name and full address for the record. You have 2 minutes. Is anyone there?
Just an email.
Okay, who's next? And just the audience knows, we got people that are calling in just to call, and we're going to cut it off in just a couple minutes. So we've been here since 1:30 and been listening to a lot of conversations, right? So I think we're going to accept 2 more, and then that'll be cutting it off.
Okay, Chelsea, if you want to unmute, if you could give us your full name and full address for the record. You have 2 minutes.
My name is Chelsea Jensen. I'm actually out in your guys' hallway right now because I wasn't allowed to be in there. I'd like to start out by reading a quote from a Hungarian Jew from the documentary The Last Days. People wonder, how is it that we didn't do something? We didn't run away. We didn't hide. And while things didn't happen at once, things happened very slowly. So each time a new law came out or a new restriction, we said, well, just another thing, it will blow over. When we had to start wearing the yellow star to be outside, we started to worry. Commissioners, I am calling on you today to take a stand for what is right and constitutional. You are elected officials, elected by the people, for the people. When are you going to listen to their voices? I believe you are all good people, but when push comes to shove, why are you all spineless and not taking a stand? Most of us here received an email stating that one of you, and I'm not sure who, said that sometimes the government needs to make your decisions for you. And that's what we are doing. Excuse me. Since when did we elect you to tear up our Constitution and take away our rights? I want to remind you that the purpose of the Constitution is to protect our God-given freedoms. It's a tool for the people to restrain the government when they try to tyrannize our lives and interests. It is not a tool for the government to restrain the people. We are talking about a virus with a 99.999% survival rate for children. We have people here that love masks when the packaging on the mask clearly states that they are not effective against COVID-19, and they warn us against causing cancer. There are many parents that want to talk about the long-term effects of COVID, but no one is talking about long-term effects of masking children 5 days a week for a majority of their day. It's appalling to me that—
Who's next?
Jeff, if you could unmute yourself, you have 2 minutes. If you could please state your full address for the record.
My name is Jeff Rudd, and I live in Schoolside Estates in Hudsonville. And I just wanted to—
Wait a minute, Jeff. Where do you live?
Hudsonville. In Schoolside Estates. I across from Georgetown Bible Church.
Okay, all right.
Georgetown Township. And I wanted to thank you all for staying so late and listening to people complain about something that you all know you don't have the authority to change. I personally support the health department's recommendation that children remain masked. I have 3 kids of my own that go to Georgetown Elementary, and my wife and I were very concerned when there wasn't a mask mandate. We kept our kids at home last year and did virtual schooling because we didn't want to put them at risk. And we were very apprehensive about sending our kids to school this year without a mask mandate. So for those of us that were really looking for a lifeline, that's what you gave us. And for the people that are complaining about how kids don't follow proper mask protocols, that's not the point, guys. Like it's a 90-10 rule. If they're wearing masks, it's protecting them. And that's what's important, is keeping our kids safe. And if your kid doesn't go in with a mask and my kid does, my kid is not protected. The mask is mostly to keep the viruses from getting out of your infected kid into mine, not to keep mine from getting your kid's viruses. So thank you.
Thank you.
I'd like to entertain a motion for adjournment.
So moved. It's been moved and seconded. Comments or questions? All in favor, say aye. Aye.